Good morning, ma'am. Ma'am, good morning. Can you hear us? Yes, ma'am. We can hear you. Very good morning to you, ma'am. I am Dr. Prasad, Professor of Medicine, and we will be starting shortly, ma'am. Uh, we'll will be attached on screen all the time. Thank you, ma'am. Thank you. It's a pleasure, ma'am, to hear you. We'll be starting shortly, ma'am. Thank you, ma'am.
Good morning to one and all present here. I am Vaishnavi Satish.
And I am Anushri Mukadam. We warmly welcome all guests, teachers, and fellow students to the third medical conference, Medalium, and a Zygus Colloquium. I ask all the dignitaries to come on the dais. Dr. Sanjeev Thakur, sir, Dean of Dr. VMGMC, John Ebenezer, sir,
So please come up on the dais.
Dr. Dantkare, ma'am, Deputy Dean and HOD of the Department of Pathology,
Dr. Tirankar Bam, Professor and Head, Department of Obstetrics and Gynecology.
Dr. Savaskar, ma'am, Professor and Head of Department of Pediatrics,
Dr. Prasad Sir, Professor and Head, Department of Medicine. Dr. Chaudhary Sir, Professor and Head, Department of Radiology.
and Dr. Doijer, sir,
Assistant Professor, Department of Physiology.
Arthur L. Schawlow said, to do successful research, you don't need to know everything. You just need to know one thing that isn't known.
Research is a robust technique to explore new concepts through proper observation and facilitate taking the right decision at the right time. Research is the backbone and the prerogative to quality work in the medical field. 3 years ago, the UG conference was organized in Dr. VMGMC Solapur, and we stand here today to continue that legacy.
On that note, let's commence this event. And what better way to do so than to be installed by eminent speakers from all over the country? Let's begin with the inauguration.
Medalium, and Azygous Colloquium. The theme that our conference is based on this year is research based learning. This academic fest started with various pre conference events, workshops, seminars, quiz, competitions, and symposium, providing enriched learning and career building opportunities that just cannot be found in local settings and static classroom curriculums.
First, we had the research methodology workshop in which students learned how to do research and the basics of research. On 16th and 17th of August, students were introduced to a plethora of medical techniques and equipments like airway management, CPCR, ECG, IV line, laparoscopy, episiotomy, basic suturing skills, catheterization, etc. through a hands-on workshop.
Practically every single day, some new innovation comes to fore, some new path breaking study is published, or some new guideline is released. Each medical topic is spread across various subjects and different years of MBBS. The Vertical Integration Seminar, which was held on the 18th of August, provided a unique opportunity for the students of all years, right from the first year till the final year, allowing them to coalesce their knowledge and present a holistic picture, integrating all the new advances regarding their topic.
The fourth day of the pre conference event highlighted the theme of the conference. There is no better way to understand a concept than by practically utilizing it. Research was conducted by student participants and they presented it through the means of a poster in a poster presentation competition. Students visited the hospital and gathered history and related information on a case of their choice, and they showcased it in the case presentation competition.
A national level medical quiz, Diagnose, was organized on the 19th of August. Teams from pan India colleges like KM Mumbai, BJMC Ahmedabad, AIMS Rishikesh, Madras Medical College, etc., participated in a highly competitive environment.
This magnanimous conference will give undergraduate medical students the chance to perpetuate education and promote skill development. The conference focuses on sharpening the skills, providing the ability to interact with peers, to try new equipments for the evolution of novel and locally relevant ideas, and the development of consensus in contentious areas, all leading to improvement in healthcare delivery and patient outcomes. All of this has a direct impact on our daily clinical practice, helping us to improve safety and patient care.
Lighting of the lamp is symbolic to igniting the flame of knowledge and eternal learning. I request our judges on the dais to proceed with the lamp lighting ceremony.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिः परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोऽस्तुते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्राश्च मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् यस्य तिष्ठेत् गृहे दीपः तस्य नास्ति दरिद्रता शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु.
Now let's hear a few words from our respected guest. I request Dr. Kanadkar ma'am to give us some inspirational words.
Very much. At the outset, I would like to compliment all the students who have organized this medallion, the third conference, as you just mentioned, at the college. And I think this is really important to take research and such activities to the next level, that unless we have participation. I'm sorry that I'm traveling and it got cut in the between. So to all the dignitaries on the dais, faculty members, the organizing committee of Medallion, and all the other students who have reached or yet to reach, I'm sure even those who reach later would be benefit by listening to a few words of grey wisdom that I can share with you. I compliment you for organizing this meeting, because Shubhasya Shigram, if you have started early, a job half, like well in time started, is already half done. A time has come when knowledge is doubling. Did you know, dear students, it's doubling almost every 12 hours. artificial intelligence is threatening to replace normal intelligence. In such an opportunity and this timing, it is not enough to be able to know the answers. Gone are the days where we teachers and faculty members can just provide you information. Today, information is available even on Google, even on the website. What we need to do is teach you how to sift through the information and change it to knowledge and thereby wisdom when you apply that information. And all this is taught in your research methodology and ability to question things around you. So, therefore, the time to give you fish to eat is over. We have to teach you how to catch fish. And if that has to be done, there has to be you, the important stakeholder. So, therefore, when you come together and organize such a meeting, I think it's very important. It is important that we understand and learn medicine for its basics, physiology, biochemistry, even first MBBS subjects, your anatomy, when they are applied into your clinical medicine, you really understand it. Otherwise, learning procedures, learning machines makes you a glorified technician. If you have to be called a doctor, you have to be a researcher. You have to have a curious mind who can find solutions. Let me tell you, I was no different as you are as an MBBS student. And I envy you all today who have such opportunities that from your undergraduate days, you are exposed to these new techniques. We learned it much later, where research methodology was first time, where probably because we just had to find a p-value and we took statistics seriously as a postgraduate thesis. But thereafter, one realized that there was no getting away. And then applying this to everyday clinical practice became the most exciting part of my journey, whether it was finding solutions for small problems. Did you know that my first problem as a clinician was, and a pediatrician, we had no NICUs, we did not have high intensive care units, but there were small babies which had to be monitored. So did you know my simple innovation of putting a temple bell and giving mothers an opportunity to sit in my corridor special care baby unit, so that one mother took turn and rang the bell to call me when she needed that a baby was having apnea, or when later during dialysis, and knowing that the cost was so much, using simple innovations like keeping a peritoneal dialysis fluid bag wrapped in a sterile sheet above a radiant warmer so that it became warm while doing dialysis for a baby. I mean, these were simple solutions which one had to find, and all of us clinicians keep innovating. The importance is to do it scientifically, to document it, to share it, because any research, if it is not shared, if it is not published, and it is not peer reviewed, it is worthless. So we have to be able to share, and then it gets its due course, due diligence, and where people can use it, verify it, and carry on further. So therefore, the first thing that I request you all is to ignite that passion in yourselves, ignite a curiosity. Don't take things at face value. When you look around, see for small problems which need a solution. It could be in the form of a simple diagnostic test. It could be a need of a small innovation to give a therapeutic, to administer an IV fluid or stabilize it or take photography. I mean, and young minds are the best. If you know, the average researcher of, say, in a company like Microsoft is only in his 20s. So why are we different? People who come to do medicine are among the most brilliant minds. But somewhere we shut our mind to the possibilities that we can do more than our everyday. And like very correctly the MC said, that it doesn't come in your routine education, and you need to look beyond to be able to find solutions. Your new curriculum, which is a competency based medical education program, does try to address a few needs of translational and integrated approach to training. But even that cannot be completed unless you learn how to find solutions, how to fix a problem. And for that, you need to diligently work at the bedside, see lots of patients, try and understand their problems, because research which happens only in a laboratory is and may be excellent, but unless it has a translational element, at the end of it you don't feel the satisfaction. But if you've found a problem, you've looked around, you've talked to patients, you've handled patients and found, yes, there is a problem, and then put heads together and find a solution. The other message I'd like to share with you is research is not to be done alone. There has to be collaboration. There has to be groups. So whether it is, if you're finding a solution and an innovation, please go beyond yourselves, do interdisciplinary, multidisciplinary. And today the solutions need even more thinking beyond. Like you may need to talk to, computer engineers. You may need to talk to engineers. You may be able to find solutions by working together in teams from different disciplines. That is how you find the best solutions. So these are some of the small tricks that I'd like you to remember, and take this forward and get more and more students interested. You'd be happy to know that Maharashtra University of Health Sciences, to inculcate this spirit in you, has started the summer internship program, giving you an opportunity. And some of your students from your college did participate and get selected. Next year, we plan to take it even bigger, where you'll get 2 weeks of an opportunity, if selected, to go and work in an area, maybe in a specific research laboratory, or it could be learning nutrition, you're learning each other's interpathies, because there is nothing which is absolute. Treatment and well-being or caring for a patient, you need to keep your mind open and respect all other specialities and learn from each other. So you might want to learn a little bit of yoga, you may want to learn meditation, you may want to, so that you can use it for your life as well as other people, and then you would also be able to do research in that. So therefore, please do take advantage of the summer internship program. We're also increasing the number of student scholarships for small research, giving a grant of 15,000 per student, so that in your summer 2 months you can take on projects. So the call will come out. Encourage more and more students to take it up. And besides a conference, bring research and a thought of questioning and trying to find solutions a part of your daily life. It may be in any field. Once you know the tricks, once you learn how to do it, you will apply it everywhere. With all this, I'll end here and wish you all the best once again, and may you have great success in this conference, in attracting more students to join this mission that you have taken up of organizing this conference. But more than that, let it ignite the young minds to think beyond textbooks, to find newer solutions, newer avenues, and that may create you newer career options in the future. Thank you so much. God bless.
Thank you so much, ma'am, for your inspirational words. You truly summed up the meaning of research and going for new opportunities.
Thank you, ma'am. I request our Honorable Dean, Dr. Sanjeev Thakur sir, to felicitate Dr. Kanetkar ma'am.
Madam, I'm audible? Madam, I'm audible?
Hello.
Ma'am, as a dean, I'm extremely thankful to you give your valuable opinions, suggestions to my students who I think you will be a good role model to them because we have seen you from your undergraduate days. I from BJML College, you were there in FMC, and the career as a student. Then you rose to the one of the third woman in the Indian Armed Force to be promoted to the 3-star rank, and also as a deputy chief of Integrated Defense Staff Medical, and now you are the prestigious post of vice chancellor. And with you, with your ideas, dedication, my students all over the Maharashtra state will be beneficial, and they will really excel in their research activities. And I hope with your valuable guidance, we will start as a lot of subspecialty course research, and you promote them. And thank you very much, madam, to give your valuable time to my medical college. Thank you very much.
Thank you.
Thank you so much, ma'am. Thank you, sir. I request our guest, Dr. John Ebenezer, sir, to come up on the stage. I request all the
I would like to welcome our Dean, Dr. Sanjeev Thakur sir, on the stage. Dr. Sanjeev Shamrao Thakur sir, the Honorable Dean Dr. VMGMC, is an expert surgeon in laparoscopic endoscopic surgery and a specialist in bariatric surgery. He is a pioneer in his field, having an immense amount of experience in administration and teaching. Dr. Thakur sir took his laparoscopic training from various centers all across the country. In 1996, he became one of the first people to start laparoscopic surgery all over Maharashtra.
He has performed the largest series of laparoscopy fundoplications in hiatus hernia in India. Till now, Dr. Thakur sir has conducted more than 90,000 open surgeries and more than 25,000 laparoscopic surgeries. He was one of the first people to conduct bariatric surgery in a government setup. There aren't enough words to describe his accomplishments. I request Dr. Sanjeev Thakur sir to enlighten us with his words.
Uh, Good morning, my students. First of all, I'm enlightened that you are doing a conference at the entry level of your MBBS curriculum. Uh, First of all, I thank you for you arranging this conference, and this will really benefit, encourage to care to look your views to the society. Among all, we have Dr. John. He is Padma Shri awardee, BC Roy National awardee. BC Roy is topmost awardee to a doctor can get. He is with us, my colleagues and my dear students. Uh, the invitee you've called for the lecture have done their phenomenal work in their respective field. And such thing you've started in your career is really will help you once you go back to your peak, and will you look back how were you in first MBS. When I was sitting in the dais, I was remembering my days of my undergrad days. Uh, that time it was my medical education was like a schooling that time, that we used to attend lectures and the teacher used to come on a blackboard and we used to learn like that. Over a period of 30-35 years, the teaching technology is changed. A lot of things are available in your hands. A lot of smartphone, tablets. You can really go to the YouTube. You can go to Google and find out. I emphasize you right now that you have really worked hard from your first standard to 12th standard, and then you got the MBBS admission. As far as me is concerned, from my childhood, I was dreamed to be a surgeon. Uh, because my father was, he's a surgeon, still alive at 92 years old, still seeing patients. And from my childhood, I used to go with him in OT, an operation theatre. And I used to see the intestine, and I wanted to become a gastroenterology surgeon from my childhood. Now, almost you, when we become a doctor, is by chance, by your hard work, you come to a prestigious medical college. And to be honest, there is hardly any difference between the different medical colleges. First thing I should assure, and you should not bog down, that you have come to the MBBS, where in a Solapur is a smaller place compared to Mumbai and Pune. I've been, my education been in BJ Medical College, Pune. Hardly is there any difference between the approach of the teachers, Pune and Solapur. It's your mindset. If your mindset is positive, you will definitely grow and you will shine globally. And this is the first step in your life that you are getting a automatic a communication skill. To be honest, as of now, communication skill helps the first important, not the guideline, is a staircase for your success in the life, because our success depends upon the communication skill. The way you have arranged this conference, how way you communicated such a big faculties, and they have come all the way. This shows that you have a better communication skill, and if you use this better communication skill in your life, right from your career, this first symbol is your starting point. I think you will get success, because this communication skill on which your milestone, your success depends. And I hope you communicate with the different faculties. They are really stalwarts in their field, and you find your own role model in these faculties and grow up and shine this medical college. Thank you very much.
Thank you, sir, for those words and telling us about the importance of communication for a medical professional. I request all the dignitaries to please come on the stage.
I request Dr. Dankale Ma'am, Deputy Dean and Professor and Head of Department of Pathology, Dr. Tirankar Ma'am, Professor and Head of Department of Obstetrics and Gynecology, Dr. Savaskar Ma'am, Professor and Head of Department of Pediatrics, Dr. Chaudhary Sir, Head and Professor and Head of Department of Radiology, Dr. Prasad Sir, Professor and Head of Department of Medicine to come on the stage.
I request our Honorable Dean, sir, to welcome Dr. John Ebenezer, sir. I request Dr. Tirankar ma'am to welcome our Honorable Dean, sir. I request Dr. Prasad sir to welcome Dr. Tirankar ma'am. I request Dr. Chaudhary sir to welcome Dr. Prasad sir.
I request Dr. Dankale Ma'am to welcome Dr. Savaskar Ma'am. I request Dr. Doijer Sir to welcome Dr. Chaudhary Sir. I request my colleague Shitaja Lunawat to welcome Dr. Dankale Ma'am. And I request my colleague Harsh Agarwal to welcome Dr. Doijer Sir. We thank you all. Now I request all the dignitaries to be seated.
Please put sir's pen drive. Where have you?
वो इधर से लोड हो गया सर
सर को बता दो.
इथे थांबा ना कसं चालू होतं. Benedict is an approach of a surgeon to the students.
पेन ड्राइव वरती टॉपिक काय?
Benedict surgery. अच्छा हे जायचं कसं? Okay. First of all, good morning, everybody. I thank you for the organizing team of Medalium 2022, hosted by Dr. V.M. JMC Government College, Solapur, on 20th and 21st of 22. This will be a really a feast for you to arrange yourself, your mind, focus for your personality development and success in your life. And lot many stalwarts are there during their lecture, their experience, their approach to the life, and I think you will all get excited, ignited with their knowledge, and you will get tremendous success in your life. I've done my undergraduate and postgraduate from the Government Medical College, BJ Medical College in Pune, and I did my fellowship of GI surgery from All India Institute of Medical Science. It was a 2 years fellowship because at that time I wanted to do MCH GI surgery, but the MCH degree was not available in India. So I work one of the stalwarts, Dr. Saman Nandi, one of the first person to begin with animal liver transplant, and is a very sincere and hard-working, honest surgeon. This you will find the 3 generations of surgeons from BJ Medical College. My father still sees patients. He was a very famous surgeon of his own time, did a lot of surgeries. My son is doing surgeries in this medical college. Now, why I have thought that I should concentrate on obesity, because I found, as in Pune, so my career started, lot many patients come to my OPD for surgery, say for hernia, for appendix, for piles, and they were obese, obesity. And then I went through the literature and found that obesity is one of the killer, is what we call a silent killer, which ignites the blood pressure, diabetes, arthritis, and longevity is lessened or goes down below the mark. So, how do we define? I'm not just going to go details of obesity. It's just to highlight what I have done it, and I expect you to do choose your path in first semester. Maybe you go to any career, but try to go at the zenith of your career. Now, obesity means excess accumulation of fat. You find nowadays we go to railway station, go to shopping with the help of the stress, the pizza, because sitting all the time, you must have done for your entrance, sitting, just gulping your food, junk food, and study, stress. So, all this factor leads to obesity, and we evaluate is body mass index and waist to hip ratio. Now, in talk about what I'm going to talk about, not European standard, Asian standard. So anything more than 22, we start in overweight. The concept of 25 is also gone. And what we find nowadays, 50% of the population going in this era, you will be a minimum is obese. See, go anywhere you see, there will be obesity is really taken. Now, these are the guidelines. The underweight is 18.5. We hardly get 18.5 is really malnourished. But we must think, if your BMI is crossing 25, you are at risk of obesity. Just see yourself. Apart from your study, I think this is a time that you should take concentrate of your health as well. I remember I used to go to the gym, not gym as a weightlifting, but did my aerobic exercise, still I know. From my fifth of age, I am doing exercise. My parents' motivation, taking care, and then I came to I understood the health, because to stand for 10 to 12 hours, you require a mental and physical health. And I appeal that we have developed the good ground, and you should go to the ground and do something for yourself, not for the people. Now, we have morbid obesity is defined as BMI is more than 40 kg, or they have a 35 kg with presence of comorbid like blood pressure, diabetes, ischemic heart disease, asthma, osteoarthritis. Now, this is extremely important. The risk increases if the waist circumference is more than 94 in male and 80 in female. And hip ratio, waist to hip ratio should be desired. Men should be less than 1 and women should be less than 0.8. Now, this we should know. Obesity is an imbalance in energy intake and energy expenditure. You must know how much energy is how much calories you should take every day. I think if you take this habit from your childhood, you see you're just growing age. But if you take care of your health from your first MBS, I don't think there's an issue, because you've seen a lot of doctors are getting infarcts and strokes at the age of 40. We know the lot of pressure on us of your studies, then competition, patient-related stress, family issues. But you are alone, you have to face these issues. So take care of your health. See, the obesity is an epidemic, because we have gone, I don't know, you must be younger, 2 3 years, because we have seen COVID in 2020. The death rate was more in this obesity and morbid people. See, can't exercise, eat too much, gain weight, get depressed. It's a vicious cycle. You have to come out that cycle. Now, what are the causes? People say that we don't eat much and still we put on weight. So, familial, genetic, gender, social, and psychological depression. There are two types of depression. One, with patient get depressed, overeats, and one person do not. That we call anorexia nervosa. Now, this comorbidity I'm extremely stressing, because we just don't check ourselves. If you, because I've seen that when you enter the MBBS and we go for, we have done a mandatory pre-medical test, because if at all it is there, we can detect and treat it. So you can see endocrine, diabetes, cardiovascular hypertension, then hyperlipidemia, coronary cerebral vascular insufficiency, venous stasis. Then if it's an orthopedic, you have a arthritis common, then fungal infection. So these are the comorbidities. Now, person says snoring. The wife says, I cannot sleep because her husband snores. So sleep apnea, asthma. So these are the factors which run with obesity. Now, whenever there is a disease, obesity is a disease itself. So you have to give a treatment. So what your aim? There is some aim when you treat obesity. Number one is comorbidity. You treat the comorbidities. Number two is quality of life. A person should be healthy and a survival life expectancy. If a person is obese, his life expectancy decreases at 20%. 20% is too high. So, what are the advantages of weight loss? Please do not follow the modern diets which is available in Mumbai, Pune, keto diet. Do a normal diet and good for exercise. I think you'll come down. Avoid the junk food. So, weight loss of 0.5 kg to 9 kg is associated with its proven data. 53% reduction in cancer deaths, reduction in diabetes associated mortality, and 20% is reduction in mortality. Then survival increase 3 to 4 months for every kg of weight loss. Improvement in severity of disease, reduce hypertension, insulin resistance, person feels fit and mentally active. Because see, from morning I had two VCs. Then I did my exercise. I came to inauguration. I will deliver lecture, and I'll be operating 5 cases right now. So you have to be mentally and physically fit to take challenges. Now, what is your treatment goals? Number one is prevention of further weight gain. Because once you either give a medical line of treatment or surgical line of treatment, patient, there should not be a weight gain. Weight loss to achieve a realistic target. See, 200 kg should not expect to become 50 kg in a year. So always you should have a realistic BMI pertaining to that patient. Long-term maintenance of a lower body weight. That's the goal. Now, these are the options available. Number one is always nobody will ask for surgery. Wherever you go, being surgeon, the patient comes to you in OPD doesn't mean that patient requires surgery. So there are a lot of medications available that will suppress your hunger, dietary changes, exercise, behavioral therapy, psychotherapy, hypnosis, jaw wiring. Jaw wiring, we hardly do. This is the practice in Europe where person is compulsory eater. We hardly do all these things. Unsuccessful at significant or sustained weight loss. This is extremely important. So, after medical treatment fails, number one, our patient demands that he needs a surgical correction of his obesity. The bariatrics is the branch of medicine that deals with the causes, prevention, and treatment of obesity. Bariatric surgery includes a variety of procedures performed in obese. Now, what are the indications of surgery? When do you advise? Number one is we have modified our own data. So, we are advising the surgery from 28 to 30 with comorbidity and more than 32 without comorbidity. What are the exclusion guidelines? One is patient is truly unfit. For that patient, we put a balloon. So options are available. And balloon, there are a lot of balloons have come in the market. And with that, put a balloon in, that is called an intragastric balloon. That will also cause almost significant weight reduction, and the load on the heart and the kidney will go down. So, women who want to become pregnant within the next 18 months and history of substance abuse and untreated major psychic disease, that too we have operated, we have treated with antipsychotics, and we have operated that patient. So, whenever we do this bariatric surgery or we call as a metabolic, patients are unfit. So, we have to evaluate them. One is staff evaluation and one is a laboratory evaluation. So, we have a biggest OPD in Maharashtra where there is a dietitian, psychologist, nurse, surgeon, support group. This is the list, but we hardly do malabsorptive procedure more because the Indian scenario cannot sustain that malabsorption and they land up in cachexia. So we, according to the patient, we advise them a surgical option. These are the instruments are required, or we say armamentarium in OT. We have a modern OT. We are coming with a modern OT in couple of months. Should be a voice controlled model. We should be one of the first kind in Maharashtra. These are the long extra long trocas where hardly, otherwise they will not enter the abdominal cavity. This is the commonest procedure where in Indian scenario or Asian scenario, that is a sleeve gastrectomy, where we make the stomach as a banana. So, two things are in this. Number one, the fundus is removed. After taking out the fundus, the hormone called ghrelin, which is a hunger originator is out and the stomach capacity reduced, and patient loses weight almost 20 to 25 kg in a year. These are the port sites. These are the different steps what we follow. These are the modern gadgets: wig cut and suture, the stapler. Previously in Australia, people used to do open bariatric surgery. This is our OT setup, what we do it. This is a staple line. This is also gastric bypass. When the patient is of 35 BMI and patient diabetic, we do a gastric bypass. Now, what are the possible side effects? You must know, because patient is going to ask you this question. What will happen? So, a patient may have some nausea, vomiting, gas bloating, dumping, temporary hair thinning, and some psychological changes, because he was looking 120 kg, now looking 100 kg. So, changes in bowel habit. But these side effects are tackled with proper medication, proper counseling. Again, go back to that you have to take the patient confidence. So, better communication skill is extremely important. For every step, never use a lift to go upstairs. Always use a staircase. Same, the communication is extremely important in your life. Always in any disease, this multidisciplinary approach in your life also. Now, when in childhood, your parents supported you. Then, when you come to a professional college, your teachers, your colleagues, your senior colleagues will teach. You approach them. It is like a multidisciplinary approach. And whenever the patient comes to you, the initial contact, because you have to introduce yourself. You never say, when a patient comes to you in OPD or your friend, call him by name. If you call the person by name, it gives immense confidence of that person in you. Don't a pora. You don't never have that government approach. Always be a polite, sympathetic to your colleagues, to your teachers, to the patients. So we always give them pre-operative information. What are you going to do? We evaluate him. What type of surgery we're going to do? What type of things can happen? Because you have the consent. Patient should not say, why have you didn't inform me? So what we call informed consent. And then a post-operative follow-up and support. The patient needs support. You go to your PG, you get depressed because in third MBS you study only, sit in the room, and then you go for your PG. You're exposed to the patient, the stress of the patient, the work, you're alone, working day and night. So you need a support. So always make a good friends. Then you can share your views and come out. Don't get depressed or bogged down with these issues. This is my dedicated team with the surgeon, the registered nurse coordinator, registered dietitian, psychologist, social worker, exercise specialist, insurance coordinator if it is required in the private sector, and administrative assistant. Now, this is extremely important for you also, because you might be eating food outside. Always take some vitamins, minerals in your daily habits. Enough of protein supplement, whatever is available. Don't expect to buy a expensive protein, but things what we in Indian food we take. You have good amount of proteins. Take some vitamins, fruits. Now, what are the patient responsibilities? Your role before surgery. Always, wherever you approach, not for the surgery, as a you want to become a good doctor, good human being. So your role is defined in your MBBS curriculum also. Commitment to improve your health, diet, exercise, mental health. These three things applies to you as well. That doesn't mean that you are obese, but this will carry for your lifelong. Discuss your health history with your surgeon. Ask questions and vocalize. Ask him to speak. You don't speak. You just initiate, the patient starts speaking. And commitment to follow all the instruction on nutrition, activity, other care after surgery. Now, the conclusion. Bariatric surgery or a metabolic surgery effective means to achieve clinically significant permanent weight loss with low rates of complication. This what we posterior specimen looks. This is a cartridge what we see. Can you see this? We can treat associated umbilical hernia in the same sitting. This we operated 1 month before, pre-op 145 kg, post-op. Can somebody play the video? Come. You see, he is jogging and he's lost 45 kg in 1.5 months, almost 1 month. This is the result. Only bread earner in his life, and he'll come to near normal after 1. So this is the results what you get. This is a patient we operate pre-op 155 kg 6 months before, and this was the patient, and now he just came to me yesterday. He is 90 kg now. You see the way he is walking. He was not able to walk, dyspnea and all sort of thing. This is really the benefits of obesity and metabolic surgery. This is what a glimpse of your surgeries we have performed. Mr. Super 192 kg, the highest ever we operated in this institute. And can you see the liver cirrhotic? The 20 years old boy. We had a liver cirrhosis and he was extremely obese. And we operated here so that everything is possible. It is not a question of the city. If your mindset that you want to do it, can you see this vessel? These are really portal hypertension and large varices. Can you see? You will once in lifetime you will get such scenario, such patients. Poor boy, 22 years old, having liver cirrhosis, and this is what we separate a stomach. You will, if you are interested in developing your surgery, we will be doing a Facebook live. There you can really attend, see and ask us the questions also. So this was absolutely a bloodless surgery. Can you see with the modern gadgets which are available in a government sector? In fact, I am proud to say that the equipment or armamentarium we have got in our institute should be one of the finest armamentarium in Maharashtra state. So we are way ahead of the private sector as of now. Can you see this? The modern things available, and this stomach is really mobile. It's very risky if you make mistake, because no mistakes we can't afford. We can't open and close it. You have to be so methodical that there will be little error. Any small error, a patient will pop out on the table. So you have to be very extremely proper way of handling your tissues, and less handling is extremely important, because it's always a one go, because you cannot change it again. Once it's fired. So you have to be pretty sure that when you do this is an automatic stapler gun. You don't have to just it's like a trigger. You just put your finger on trigger and it gets fired. So these are the linear cutter available in our institute, and we do this surgery uneventfully. Next. If it bleeds, it causes the iliac clip. This is the third stapler fired, and we take out the stomach's specimen. A small amount of oozing will be there because of portal hypertension. We do after stapler, we do a leak test. That's extremely important. We give a methylene blue, a thorough wash is given, and with a drain, because we have excised the specimen. It is always safer to give a wash. We put a drain, comes out, patients start early after 6 hours. This is the 180 kg person. We did a mini gastric bypass because he had a lot of comorbidities. This requires a longer learning curve. But then, as the experience goes, we have already done it, and you will also learn. If you come to operation theater, you will learn these things, and you will really uh, get a nidus to bear to start your career in any branch. But I expect you become a good stalwarts in your future. This is what we exercise the stomach half, and then with the modern gadgets, this was a 170 kgs. Now the patient is 65 kgs. Is free of diabetes and hypertension. Whatever we have operated till today, there is no death. Number one. Number two, the comorbidities are absolutely gone. Patient is diabetes, sugar free, diabetes free. Hypertension is out of medications. Early liver changes were there, kidney changes were there. They are all doing good. This goes to our team because there is a lot of good communication, and we developed a confidence in the patient. So even if I don't pick up the phone, our team members pick up the phone and advise them any issues with them. A proper support is given. This is pineal sinus is an entity where there is an infected sinus, hair growing sinus on the sacral region, and is one of the notorious condition. Previously, we used to excise it, and the wound took 3 months to heal. Then a lot of flaps have come. People in India are also doing again the recurrence. But with the laser, what we are doing it, patient is going home, and we are doing under local. This is what machine we have got, and we are almost doing most of lasers, pineal sinus, Fisher Nano. See, this was a condition of this patient. Can you see 1, 2, 3, 4, 5 opening? And this was the secondary sinus. So actual laser application, and this was the immediate post-op, and this was the thing. Otherwise, normally we excise this much, or we make a flap and close it. And can you see patient immediately walking under local? So and patient, I don't have a photograph, but the sinus is healed in 2 months. This is a laparoscopic E-tape repair. Now, for a hernia, you know, you learn. So, any bulge in the inguinal scrotal region, this is your in first MBBS. Once you go, you will learn slowly. So, the laparoscopic E-tape repair is a gold standard. Nowadays, this procedure is a gold standard. All over the world is followed. Can you see the translucent layer? This is what a laparoscopy tells you. There are 2 layers. We never learned, we learned a translucent single layer. So in anatomy you are learning, these are 2 layers. Can you see this is superficial layer and the deep layer? And this is the mesh. We have, can you see the mesh? The double hernia were done, and the best meshes we are. This is a gold standard today for a laparoscopic E-tape inguinal hernia. Can you see, if you do an open appendectomy, you take a McBurney or gridiron incision, and you find this, can you see this liver? So it was below the liver. Can you see? So subhepatic, sub is below. So because of laparoscopy, you can really do a good job. Again, this is the video of laparoscopic appendix. This is specimen is taken out, and patient walks home same day or next day. Can you see this? This is when you put in a scope, you can see the hernial sac. Can you see the testes inside? that is called as hernioscopy or a sacoscopy. You can see and you can really verify what is the contents in that. And again, can you see this is a mesh we have put, and then we will suture the peritoneum. That is called as laparoscopy transabdominal pre-peritoneal repair. This is a fundoplication, a hiatus hernia. Always you bring the stomach from the behind esophagus and we do a shoe shine maneuver. Can you see this? A classical shoe shine maneuver. This is what is a floppy niscence or a partial fundoplication. But this maneuver is extremely important. Now, whenever we put a graft inside, we have either we put a glue that sticks to the parietes, or we do tack with our tackers that fix it. But best and cheap is safe. That is what we call as intracorporeal suturing. With the help of proline, this really requires a lot of efforts, skill to suture this. Can you see this? So this you should learn. So what is 3 things you have to follow? Learn what I learned. Then I again the new techniques. So I unlearn myself, and then I am relearning. So this you should follow in your life. I think you will get good success. Can you see the skill? This is what you are suturing with the help of. This is a laparoscopic cholecystectomy. This, can you see, this is the ruveus sulcus. Can you see this? You must know. Then you should know the calot's triangle. And this is what we cut the cystic duct. Can you see this? This is with the hair. Tie. Never you clips because it leaks. And this is a CVD. This is a stomach. This is called the ruveus sulcus. So whenever you operate above, you will not do a biliary. Why? What is important? Gallbladder surgery. Number one, we don't want a biliary because there is lot of anomalies are there. So we do not want any injury to the common bile duct and vessels. So you must know what is calot's triangle. These are the commonest thing. We comes with the piles, bleeding piles, and these are bigger. And we do a stapler hematopex. Can you see this? This, and patient goes next day home. This is what the procedure. These are available in our institute, doing free of charge, and patient this is what we first step is to dilate, because you have to insert the stapler. Now this is a anoscope. Can you see this? So this has to be fixed with the help of whatever the non-adhesive suture. Otherwise, you have to do a surgery above the dentate line. If this slips, you might fire a stapler. Dentate line is very sensitive. You must know the anatomy of the anal canal. We perform the staple surgery above the dentate line. That is painless. And open surgery, what we do is below the dentate line. So that is really painful. So to have a success in this surgery, you should do a proper fixture of the anoscope with the help of non-adhesive sutures. The key to success is a pursing suture. It has to hold the mucosa and hold the stapler gun. So this really required a bit trick, the experience, and it is done almost, and the patient doesn't have much of bleeding, and it's almost a painless procedure. This is a stapler gun which we fired after taking a pursing. You will not understand. This is your outlook that the treatment pattern is changed, and it is performed in our institute. This is what is firing has been done. This is our team. It's none of us, including me, ever do the great things, but we can all do small things with great love, and together we can do something wonderful. Saint Mother Teresa. Thank you very much.
Thank you, sir. Sir rightly explored a highly prevalent epidemic like obesity, an apparently harmless disease which affects a person both physically and psychologically, further highlighting the importance of bariatric surgeries in today's times. Sir educated us about the intricacies of laparoscopic surgeries on treating the various gastrointestinal ailments, igniting an interest in surgery and its skills.
Dr. Thakur sir has been through an arduous journey only possible due to his dedication and perseverance. His knowledge knows no bound. Sir, we are very grateful to have the opportunity to learn from you and to witness your intellectual seminar. We have learned tremendously from you and wish to continue to do the same in the future. Thank you so much, sir.
Now we would like to hand over the mic to our colleagues Mehak Agarwal and Omkar Bhosle.
Now, we are honored to welcome Dr. John Abenzar sir as our next guest for the upcoming session.
Dr. John Ebenezer Sir is the first orthopedic surgeon from Karnataka to have received the fourth highest civilian honor of the Padma Shri Award. He is also honored with Dr. B.C. Rao National Award. He is known for promoting holistic orthopedics, the West meets the East, which is a practice combining modern medical techniques with yoga for the management of osteoarthritis of the knees and other chronic orthopedic problems. Also, he is a recipient of the Rajyotsava Prashasti, the second highest civilian award of the government of Karnataka. He is an internationally renowned orthopedic surgeon, author of over 200 books, and holds 8 Guinness World Records.
So now, I would like to invite Dr. John Abenzar sir on the stage to further glorify our event.
Thank you very much for those kind words. Uh, it is a matter of great pride and privilege for me to be a speaker in this uh, unique conference which I am witnessing here. It is for undergraduates, and as a professional, I have been touring across the world doing so many conferences, but it is mostly for professionals, senior doctors, and postgraduate students. But here, it is for you people, undergraduates. When Harsh invited me for this conference, he gave me 3 options. One was to conduct a workshop on orthopedics because I'm an orthopedic surgeon. So, putting casts, splines, or how to put a sling, or how to do an intraarticular injections, I could have done a 1-day workshop for you all because that is my profession. Then the second option was to speak on holistic orthopedics, which I have pioneered, incorporating medical yoga into medical management, surgical management in orthopedics, paving way for new, unique, non-orthopedic, non-surgical treatments. And the third one was to give a motivational talk to you all young students. I picked up the third one because the first one can be done by many, and even the second one can be, maybe sometime later. But what I felt very necessary was to speak to my young students, the kids here, about how to become a successful doctor. So I thought this is one topic which I would definitely like to share with you all. So thank you very much for inviting me. I thank the organizers of the third Medalium of Dr. VMG Medical College, Solapur, for this invite. I have some Solapur Connect. Dr. VM Iyer, who is the doyen of Indian orthopedics. He has got his Iyer Orthopedic Center in Solapur. So he is a very great mentor of mine. So it is with great respect I come to this city. I'll be visiting him after this program. And his son-in-law, Dr. B. Shivashankar, he is now managing the Iyer Orthopedic Center. And he was the past president of the Indian Orthopedic Association last year. So these are my friends. He is my colleague, in the sense he was my junior, 2 years junior in my undergraduate days in Karnataka Medical College, Hubli, Dr. Shiv Shankar. Third, Dr. Kusum, who is working in Ashwini Rural Medical College here. She is a classmate of my daughter-in-law, Varsha, from Mysore Medical College. She has her mother-in-law here, Janabai. She is from Sholapur. And, she'll be coming to this conference. She thought my lecture is at 3 o'clock. But I texted her saying that my lecture has been preponed. Mostly she will lose the lecture, and also she will lose an opportunity to see her mother-in-law, her husband and herself on the screen here in VG Medical College. Right. So she is my patient, her mother-in-law. So these are my Solapur Connect. Beautiful city. I was just driving down the city. Very nice. And I really feel very happy to be here. You all here have chosen the medical profession. The question is, why did you choose it? What is your reason for choosing it? I am in love with white apron and stethoscope. Apron hugs me all the time, and steth always stays close to my heart, as told by Pranita Nayak. Was that the reason why you selected it? Or because health career is one of the best in the world? Because whether it is a doctor, nurse, pharmacist, the noblest job in the medical field is to be a doctor. It is the priciest health career to attain. It is not easy to become a doctor, not cheap also to become a doctor. Huge time and money is invested to become a doctor, and it pays dividends to society. There are varieties of specialties, which itself is a rewarding life. You saw the bariatric surgeries now, such a rewarding and such a exhilarating experience as a surgeon. And in addition to patient care, we get to train in academia, research, what our VC was talking about, or both. Most importantly, the Hippocratic Oath is an example of the strong intentions to make a difference in this health professional. What it meant to be a doctor then, driven by service, principles and humanity, is Dr. B.C. Roy. The driving force then was mainly service. What is the driving force now? Good life, status, money. Money versus service. Majority desire the former, but emphasize the latter. We want money, but we are, emphasize that we are here for service. How many medical colleges are there in India to make us realize our dreams? There are various numbers. One number is, as per 21 May 2020, there are 542 medical colleges and 64 stand-alone PG institutes in India whose qualifications are recognized by the Medical Council of India. The demand versus supply. 8,70,075 number of students who cleared NEET in 2021. Out of this 8,70,000, 90,000 got medical seats. That is the number of medical seats. Around a lakh of seats we have in India. There are 19.2 applications for a single seat in India and 6.1 seats for 1 lakh population. You can imagine how privileged you all are to be in this institute, to do this medical course and become doctors. We have 68 type of specializations for we doctors to choose from. Maybe orthopedics, pediatrics, you name them. There are 68 different types. Success as a doctor for you all these years, this has been the secret. Now it is no longer the case. What is the success to become a good doctor? Do your MBBS, then go for post graduation, then do fellowships, then branch out into super specialties, then seek for a job or start your practice. Some people go abroad. What do we all aspire as a doctor? Well, everyone wants to settle down, have a good practice, earn well, raise a family, have house, car, travel, luxuries, comfortable and happy life. That's what all are dreaming here. We are trained to be good doctors. Such excellent medical colleges train you people to become good doctors. But we are not trained to face the harsh realities of being a doctor. What are those harsh realities a white apron carries? We are all dreaming of a good life. We are not prepared for this. Long working hours, emotional work, no work family balance, multitasking, high responsibilities, critical decision, poor social life, fear of failures, increasing competition, difficult patients, and workaholics, being admired. We become victims of burnout. We burn out. It grows gradually on us over time. Perhaps beginning in medical school or in residency, we become disillusioned. We become cynical. It becomes very difficult for us to do a competent job. Stuck with 4Ds: depression, divorce, drinking problems, death by suicide. We become a victim of the fifth D. We become desperate. Then finally, we get disillusioned with our choice. We go on strikes and we roam the streets protesting. So young doctors on strike. So life at crossroads for we doctors. Which way to go? This way, that way. Where to go? And we face peculiar problems as doctors when you come out. Life is not what it appears to you when you are in a college. Life is so rosy here, so dreamy, you enjoy. But once you are on the field, your life is totally different. You face some peculiar challenges. What are they? Rural service. We are asked to go to the village and serve. What happens there? Poor working conditions and very poor salary. No other professions, whether it's engineering, IAS, lawyers, have this dilemma of doing compulsory service in rural India. And to do work in rural India, you may be the best brain here, but once you go on to a rural India, none of your intelligence is going to work there. What works is totally different in rural India. Poor salary. How much we earn as doctors? See, this is one slide which shows that in a medical college, if you spend 22 lakhs to become a doctor, you will end up earning 7 lakhs per annum, maybe on an average. These are average figures only. So poor salary, pathetic to say the least. Unemployment among doctors, plenty. You will not find enough jobs for you people outside. And then long working hours. Typically you work for 40 to 50 hours in a week, and lack of sleep and long working hours. Poor working conditions. You stay in hostels which do not have enough facilities for you people. And doctors of today are forced to frequently switch their professions. So many becomes IAS officers, so many go for some other allied subjects, and some people take up into managing. They become administrators. They switch the professions. Why? While we struggle to make it, there is an easy backdoor entry by Ayush doctors. We are facing the challenges now. All the young medicos here are going to face the challenges. There are 7.7 lakh Ayush doctors in India. They will be right at your throat when you are on the field. So that is what is the challenge. And the National Medical Commission, which earlier it was Medical Council of India, comes out with various codes which are frequently changing, and this will unsettle a doctor. We think of so many things, but MCI comes down on us heavily. And we need to wake up to the harsh realities. How does India treat its physician? The patient is dead. Let's beat the doctor and go home. Workplace violence and humiliation is a unique job hazard for India's medical professionals who seem fair game for people, politicians and police. How did it come to this level? Why are we being beaten? We are the people who serve the society. We are the people who save the lives of people. Why is that we are being beaten black and blue? How can we stop this? And what will happen if it doesn't stop? What will happen to these young people here if they get assaulted on on their workplace? What will happen to their morale? What will happen to their psychology? And it has got a far-reaching, far-fetching consequences. Violence against doctors has reached epic proportions. Who is responsible for this violence now? Very disturbing and scary visuals. We have not become doctors to face a situation like this. It is the worst nightmare for all concerned. I'll be elaborately discussing about violence of doctors towards the end of my talk. And then, apart from violence, the stress a doctor undergoes has emerged as the biggest killer among medical professionals. The lifespan of doctors have come down by 4 to 5 years when compared to the normal population. Is it not a paradox? A doctor who is supposed to save lives is living less. His lifespan has come down. A recent survey by IMA has shown that 80% of the doctors in India are stressed out in this profession. 80%, not a small number. 56% do not get good sleep. 13.7% face criminal prosecution. 82.7% stressed out. 46.3% fear violence. 24.2% fear being sued in the courts. 62.8% of the doctors surveyed are unable to see their patients without any fear of violence. 57.7% have thought of hiring security in their premises. This is a scary statistics. Well, with these challenges, is there a set formula for you all for success? Our curriculum is woefully inadequate. It has not changed since my time. I did my MBBS in 1979, and these are the very subjects I studied. This list I got from Harsh. I asked him to send the list. I wanted to know whether there is any change in the medical curriculum. No, 19 subjects I studied, 19 subjects you are also studying, but there is a sea change in the present practice. The times have changed. And what are in this scenario with this 19 subject? Can we dream? Can we have vision? What is our goal? How to take suitable actions? And what is the success rate? You can see the pyramid, inverse pyramid. Success is so minuscule now. Success as a doctor, not just with these now. We need much more. MBBS, PG, fellowship, job, practice abroad is not enough to become successful. We need certain extra things. Apart from our medical curriculum of 19 subjects, we require 5 non-medical skills and 10 additional skills to become a good doctor. What are those? It takes to become a successful doctor with these 5 extra skills. You have to possess this. One is marketing. Second is latest knowledge of the software. You staying up to date with the progress in the medicine. Communication, which is very important. As our dean said, communication is very important. And convenience. How convenient you are going to make the life of your patient is very important. Very important tool. Marketing is as important as good medical skills. Because why? Because it helps you to reach more patients. It helps you to retain the current patients. Approximately 90% of the patients will look for doctor's website, whether it is a website of the doctor. And communication tools that patients are looking for is blogs, social medias, chat rooms, contact forums, tips and advice areas of practice. This is a new skill which you should develop. Then latest software. This has become the vital part of healthcare industry today. There are approximately 1.5 million medical devices available today. Without this, advanced medical devices is impossible to treat or diagnose a patient. You saw the slides shown, the video shown by Dr. Sanjeev, and you saw the latest gadgets, latest medical devices. And to manage those devices, you require software, which are crucial. So they are designed to give medical devices a range of functionality. Wireless communication is another plus which helps schedule appointments, diagnose patients, billing the patients, insurance companies, and prescribe medications. Staying up to date. This is a Medalium. Here you have come to stay up to date. You have learned to learn more. What is the latest in the technology? What are the new medical studies? What is the new research? What is the new disease? What is the new medication? What are the new theories? You have to stay yourself updated because patients who come to you are more updated than you because of the easy availability of this internet, through which they can scan through entire thing. They will come and sit to you and they will give you their gyan. When you say that you should do this, you should say, they will advise you reverse because of the availability of technology. So you need to stay up to date. Patients are always looking for a doctor with knowledge of the latest breakthroughs in treatment. To be a successful doctor, you should never stop learning. Even at this age of 62, I still keep learning. There is no end to learning in medical science. When Dr. Sanjeev was telling his father is 92 and still he is practicing. So that is the story of we people. Communication. Maintaining a successful practice, strong communication skill is a must. Do not blunt, but take time to engage in meaningful communication with your patients. The patients are of average intelligence. They don't know the language. They are not as brainy as you are. They don't have that high IQ. So you should know how to talk to a patient who is of much lesser intelligence. Most patients complain about the lack of communication skill and not lack of competency. Every one of you here will become a competent doctor. But how many will become a good communicator is something now which we have to see. So while competence is extremely important, good communication skills can also help improve the outcomes for a patient. Then convenience. To be a successful doctor in today's medical world, you will need to possess these traits. Today, most people are often in a compromised position when they are ill. The more you do not inconvenience your patients, the more grateful they will be. This helps you retain your clients, makes you more popular amongst potential clients that are currently dealing with doctors that do not have these early appointment times, open access to intensive care units, short waiting time, present and professional staff, short NPO times before surgery. Do not become complacent. Always ask yourself, how can I become a better doctor? Apart from this necessary 5 skills, you need certain additional skills. That is, we need to change our medical curriculum, what you are studying now. Students are so intelligent that they can grasp all these 19 subjects in a jiffy. They don't need, they are nowadays not finding the necessity of going to the classroom. They can sit in the rooms and read. They can as well bunk the classes. Why? Because those skills they can read in the room. Why do we go and listen to a boring lecture when nobody is interested? Because you are so intellectually, God gifted. So this medical 19 subjects is not the only thing. You need these skills which you cannot sit in your room and learn. Impossible. You cannot sit in your room and learn. What are those extra additional skills? We need to learn administration. You know how to administer your clinic, your hospital, your nursing home, or in a government service, whatever. And you need to learn about management, which I talked about earlier. More so about digital marketing. Communication cannot be done in the room. You have to get out, go to the bedside of the patient, talk. Communication skill. And then you have to learn self-defense. I think there should be a short course introduced here wherein you will be taught how to save yourself. If somebody tries to attack you, you should be ready to counterattack. So you need this self-defense technique. Then you need to learn about medical jurisprudence. Otherwise, you will be sued in the court. Nowadays, you will be sued in crores, not few lakhs. Simple. A drug allergy, a person takes paracetamol, develops anaphylaxis, and that person is sued for 2 crores, 3 crores in the court. What are you going to do? Your career will be almost over, finished. Paracetamol is a very simple drug, over-the-counter pill. But still, patient can have reaction for that. So if you don't know how to handle legal issues, you are in a soup. All this knowledge will not come to your rescue then, right? And then we need to learn about finance management. First of all, for a doctor, finance is extremely difficult. You will not be earning so easily. You will have to struggle to earn money. And then once you earn money, you should know how to manage your money. Otherwise, you will end up in too much of debts. Telehealth is a reality. We need to accept it. Online consultations, consultation over videos have become a reality. And it is a growing influence. You have to adapt it. Otherwise you will be left behind. You have need these additional skills as to how to diagnose, how to advise on a telephonic conversation. You have to be extremely careful here also, because one slip from your side, patient develops a reaction or complication. You are likely to be sued. Then you need to indulge in a lot of physical activities to keep yourself fit. How many of you who are sitting here are doing regular exercises in the morning? Please raise your hands. Look at that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. 10% of the students out of maybe 150 or 200 delegates here, no physical activity. No physical, no yoga, no swimming, nothing. If at all you do, maybe once in a week or once in a month or never at all. And then emotional and mind control. How many indulge in trying to learn this skill of mind and emotional control? Spirituality. How many are into spirituality? How many believe that you are part and parcel of the huge spirit, the God, and how you should generate the control of your mind? Yet, all this knowledge, the medical curriculum, the special skills and additional skill, at the most can make you a good doctor from an average doctor. But is that enough for you? Is that enough? If you become a good doctor in a town, is it enough? Why not convert this good into a great doctor? It's a different path altogether. Becoming a good doctor, all medical schools are teaching you. But to become a great doctor is totally different. So we all seek success. Here, what is success according to you? Is it materialistic success like money, fame, riches, bank balance, power, position? Or is it a holistic success where you have got peace, happiness, satisfaction, contentment, and you are making a difference in the patient's life? Which success are you aiming at? Materialistic or holistic? Everyone without exception here wants to be successful in their life. Everyone without exception wants to be famous. Everyone without exception wants to be rich. Everyone without exception wants to be immortal. And everyone without exception likes to scale the summits of life and be successful. But only few become Narayana Murtis and Tatas, while majority of us languish in the oblivion despite all the intellectual capacity we have. Most of us end spending rest of our lives struggling to find the real fulfillment as a doctor. Why? Because we become victims of these. What are those? Unethical practices, corporate cultures, rat race, which are the death knell for medical professions. We need to recheck and introspect here, all young graduates. What is your goal? You want to make a living? You will definitely make a living. Pragmatism. Our curriculum will teach you how to make a living. Or whether you are seeking to make a difference in the society. For that, you need principled living. And we need to inculcate. Nobody is going to teach you that. So what is that we need to do? Most of us end up making a successful living. Pragmatism. You are a super rich doctor, super powerful doctor like Devi Shetty. So he is a successful business model. If you are aiming to earn lots of money, well, you can follow him. That is pragmatism. But to make a difference in the lives of people in the world, it needs a different set of rules. My dear friends, you need principles. You need service as your goal. These are the two pictures I have put here. One is Mother Teresa. Another is Dr. Ida Scudder, who found out Christian Medical College, Vellore. They made a difference in the people's life. And what were their principles? Should we abandon pragmatism, like business and all, and become principled like Mother Teresa to adopt and become, like a saint? Is it possible for you all to become Mother Teresa? You will say, what, sir? We have invested so much of our life. We don't want to be doing service like Mother Teresa. We want to earn money and have a business model and be successful. Or you aim for both. Business, service. Excellent. If you can earn money and also do service, and if you can satiate your inner fulfillment, why not? That could be the best thing what one can think of. So it all depends now on what is your goal in life. If I ask young students, what is your goal? They'll say, I want to become doctor. Okay, you'll become a doctor. Then I'll ask, what is your goal? Then they'll say, I want to become a postgraduate. Okay, next to finish postgraduate. Then what is your goal? Then you will tell, I want to do a fellowship. Okay, attend. Then next what? Next, I want to go abroad. Next what? Next, I want to join government service, or I want to join corporate hospital, or I want to start my own. Attain. Next what? Now I am very happy. I want to get married. I want the most beautiful wife. And girls think I want the most smartest boy on the earth to be my husband. Okay, then you get that also fulfilled. Then next, I want all very intelligent children. Okay, God will grant that also to you. Then what next? Sir, I want a big house, mansion to stay. You will get that. Then what? I want to drive BMWs and Mercedes. You will get that. Then what? Farmhouses. Then what? Holidays. I want to go abroad, enjoy. You'll get that. Then, because your goal was to make a living, you'll make very successful living, because there is a nature's law which says wherever attention goes, energy flows, things grow. Wherever your attention goes, energy flows. Suppose you want to make a very successful living, that is what you're thinking. So the energy will flow in that direction and things will grow. This is nature's law. So if you plan for a living, you will definitely. But what if you plan to make a difference? You want to make a difference. How? What is the set of rules? Good doctor versus great doctor. How should be the approach? First, of course, to become a great doctor, you have to be a good doctor. Without being a good doctor, you cannot become a great doctor. So to become a good doctor, all these courses, Medalium, everything will help you. Then the choices in life are in front of you. There are plenty of choices you'll have. There are two paths which you can choose. First path and second path, which I'll elaborate now. In life, choices versus consequences. Path 1 versus path 2. We can control the choice, but once you make the choice, you have no control over the choice. You will have to live the choice. It is like saying, when you pick up a stick, you pick up the other end of the stick too. You have no choice, right? So first path, conventional versus unconventional. Conventional choice, situation number 1. Graduation, post-graduation, training, fellowships, private practice, job, government or private, teaching post, going abroad, marriage and family is the first conventional choice, which 95% of the we people choose. There is a second choice. After graduation, you do post-graduation, but not all are lucky. They don't get to do fellowships because of finance issues or because of family issues. So they just, no training for them, no fellowships. Then they go again from 5 to 9 choice, like private practice, job, teaching post abroad, without doing fellowship. That means graduation, post-graduation, settlement. The other one is graduation, post-graduation, training, fellowships, and then settlement. Then there is one more choice, unconventional choice. What is that unconventional choice? Do MBBS, get married. How many dare enough to do that here now? Not a single hand is being raised. MBBS, marriage. Then family, you get kids. Then you go for PG, post-graduation. Then you make the career choice. Then you think of training, fellowship. This is the unconventional choice. You have got 3 options in front of you. Okay? Now let us explore one. Path 1, graduation, PG training and practice. So here on point 1 to 10 scale, graduation, post-graduation, training. This is also a training, what you are undergoing now. Then do fellowships later. Then set up your practice. Then lifelong practice. Till you die, a doctor keeps practicing. You ask any doctor, he'll be sitting in his clinic or he'll be sitting in the nursing home, hospital, practicing. So this is path number 1. This is Medalium's focus here. What is Medalium's focus? Training. They're training you. They're training you all here. So this is path number 1. And how to train? See, you have to start from the basic, like how to put a suture, how to suture an episiotomy, how to do a dressing. That's what you're being taught. That is how these great people like Raj Kapoor and Hrithik Roshan started. Raj Kapoor started as a clapper boy. That was his first. He started from the basic. And Hrithik Roshan was asked to sweep the floor. His father made him. Suddenly he did not become a superstar. His father told, you have to come from the grassroots. Then first sweep the floor and then learn all the technical job. Then you will become a director, assistant director, then an actor. That means what you are now undergoing training is the same thing what a great person becomes by training in the basics, like how to do a CPR, how to put a dressing, how to put a drip, how to put a Riles tube, how to give an enema. These are the basic skills you need to learn to become a great doctor. And then identify people with successful private practice. Follow their formula. Here Dr. Trehan from Medicity. So you just do a case study on him. How did this guy become so rich? You will also produce the same result. You learn, model it on him. Second situation, conventional choice, degrees, no training. Are they doomed? Look at this extraordinary choice I'll show you now. You have degrees or skills, but you don't have training, no fellowship, nothing. After PG, you are forced to get into service. Now look at this guy. Hippocrates Sushruta Charaka. No medical degrees, no post-graduation, no books, no computers, no internets, no library, no training, but still their names are remembered from centuries and will continue to be remembered for generations to come. Thomas Alva Edison, no engineering degree, no training, only elementary schooling. Yet he scaled dizzy heights. The very bulb under which you are sitting now, the projector which I am projecting, is all the discovery of Thomas Alva Edison without any engineering degree in his name. Wright brothers, no engineering degree, no experience, no training, no education, but they found out aeroplane. Okay? Here, Mohammad Rafi and Kishore Kumar, one is trained, another is untrained. Mohammad Rafi is trained, whereas Kishore Kumar was untrained. The great music maestro Naushad, he used to hate Kishore Kumar because he did not have formal musical training. He used to just sing. But you know how famous Kishore is, and you can understand training matters. But if you are untrained, it is not the end of the world for you. Narayana Murthy, Infosys, trained. An IIT graduate. Bill Gates, 9th standard pass. And you know who is Bill Gates? So no training. Sachin Tendulkar, trained under great Ramakant Achrekar. Whereas Virendra Sehwag, nobody to coach. He plays naturally. No, training is not there. But did it make it a difference to him? And here, Steve Jobs, a school dropout. Just elementary colleges. No degrees, no training, no experience, no fellowship. But they all made it big despite these hurdles. Their achievements are not paralleled even by the most qualified and well-educated engineers and scientists in this world. Then, what was that made them tick? It was the attitude. They created their own opportunities. They created their own training. They changed the way the world functions. They become immortal. They cut that T from Kant and made it from impossible to possible. And most of them followed Arindam Chaudhary's 9 P's. Arindam Chaudhary's 9 P's for success. Discovering the diamond in you. Each one of you are a diamond here. Only thing you have to discover it yourself. That's all. So what are the tools to discover it? These are the 9 tools. I'll show you them. Passion. The passion. If passion becomes profession, then you are on the way to success. Positive energy. You have got so much positive energy that you infect people with energy. Not, your face is, like that, and the moment patient sees you, he will die, on the bed itself. Looking at the doctor himself looks like patient. No, you are exuding positive energy. Even a dying patient will feel that, okay, I can live. So positive energy. Perseverance. Perseverance. You have to simply wait for your chance to come. You cannot get frustrated in life. Okay? And then performance. Your performance. Narayana Murthy, son of a middle school teacher. And look at his performance as an Infosys giant. Personality. Dr. Pratap Reddy, who established Apollo Chain of Hospital, just an MBBS graduate. He has got 40 hospitals all over the globe. And all the best brains are working with him. He is just an MBBS. So that the personality. People-centric approach. The low-cost airlines found out by Gopinath has revolutionized air travel in India. So people-centric. His goal was to help the people. Right? Perspective. Visionaries. His vision, Bill Gates' vision, you know what it was? His vision was that there should be a computer in every house. That's all. That was his vision. And he attained it by producing so many computers. And then principles. Principles in life. The spiritual guru, Pandit Sri Ravi Shankar, who released one of my books. He is a man of principles. So you need to have that 9th P. And then the 9th P of Arindam Chaudhary is patriotism. You love your country. You don't ridicule your country. I have seen so many, including my children, when they become good doctors, great doctors, the first thing they do is they start finding fault with our country. What is this nonsense country? So much of corruption, so much of pollution, and they all fly off. And they deride the country which brought them up and gave education. So patriotism is extremely important. If you all, each one of you is sitting here, can practice these principles, it will take you to greatness from goodness. Like how these people did. So it is called syntax. Syntax means you do the same thing what a champion does, which I showed now. 9 P's. Then you will definitely reap that, the success. Then this is third, the unconventional path. What if you are being different from the rest? What if you follow the unconventional way? Are you doomed? What is that unconventional way? Graduation, marriage, children, post-graduation. If you follow that path, are you over? Your life is over? Let us see. Let me tell you my story. Our dean said that even if you have one award in this, I'll be happy. This guy has got both. Padma Shri Award and Dr. B.C. Roy National Award. So, this is my story. Let me tell you. My professional life started in Karnataka Medical College, Hubli. As a houseman, I got engaged and married a PG who was 3 years elder to me. I was just 24 years when I got married. And my personal life commenced, which is called now Harakiri in today's time. Or what I started my life in a reverse gear. Not forward, backward. So, that is how my life started. I chose my life partner, Dr. Parimala, who is a gynecologist now. From my music team, we had a Medicastra. I chose my life partner from there. Then I was father at the age of 25 years. Disastrous decision for a youngster now. My son was born when I was just a 6 months PG. Okay? And then I did my post-graduation Jain Medical College, Belgaum. They told me that your career is doomed, man. Even before you could start your post-graduation, you have got a kid, you have got a wife, and you are over. I was posted into a village in Karnataka called Alnavar, which is about 30 kilometers from Dharwad. So my wife was working there. Then I took up government job because I was kicked out of my house because we ended up in a love marriage. And you know what is the fate of love marriages then? They kicked me out saying that you married at 24. So you please leave and take care of yourself. Then what I had to do? I had to take up government job. I took up job as an assistant surgeon. And I was an orthopedic surgeon. They posted me into family planning department and asked me to do tubectomies. Then they asked me to do a camp. I was given a jeep, a nurse, and a ward boy, and huge bins. I was asked to go around and the taluka. I was in Hassan Taluk, Hassan district, and operate and do. I said, sir, I'm an orthopedic surgeon. No, you may be anything. You may be anything. You have taken a government job. In government job, only MBBS counts, not your post-graduation. Please go, otherwise you quit the job. I could not quit the job because it's my survival. Okay, then I started taking the jeep, running around in the village, in the schools. All benches were put like this and patients were lying down like that. Okay, and we start the tubectomy surgeries. My sister Rupa, she used to go and give local anesthesia. I used to come, make a neck, pull out the tube, okay, ligate, close, and then go to the next table, go to the next table, go to the next table. Like that in a school, I used to do the tubectomy camp. I was forced to do it. I did it. I won a state award for it. You can see it. My name is displayed here in Kutumba magazine in Kannada, in Department of Public Health, in Karnataka. I won an award for that also. What? Doing tubectomies. Most number of tubectomies. My DHO came and felicitated me with a towel, shawl, plate and all. Because I reached 100% target as an orthopedic surgeon doing tubectomies. That is how my life started. Then did my diplomate of National Board in Bangalore Medical College. And I found that to teach young students like you is the best way to coach yourself, not going to coaching classes and taking up NEET exams. No, you coach youngsters, you'll become much more perfect than all. So I had the option, like you all, to do a UG, PG training, practice, then earn money, then go to the dead end. I said that's a dead end. Once you start earning money, then you are nowhere else to go. You are reached your dead end and then that will be your end also. So I had this option, but I chose the other option. I went into this unconventional path. Academics, teaching, books, presentation, research, newer treatment methodologies, professional bodies heading it, social service, academic, public education, community education. Then comes practice. You see where the practice is. After 10th option of mine is practice. Extracurricular, and then activities, then fulfillment. So my first priority was teaching. I was a very popular teacher for MBBS and PG students in Bangalore Medical College. They used to flock to me. Even in the nights, they used to come to me for my clinics. And I was very, very happy teaching. But I was a selfish guy. By teaching them, I was teaching myself. To pass the exams. Diplomate of National Board, I passed in first attempt. Out of 48 students who took exams for DNB, only 7 passed. In that, I was the one. And the success for my passing was not because of my brilliance. It was because of these young students who allowed me to teach them. By teaching them, I learnt twice. I became expert and I could, diagnose the case quickly like this. So first teaching, then books. I was the only orthopedic surgeon in the world today to have written over 200 books for a wide genre of readers, whether it is MBBS students, postgraduate students, practicing orthopedic surgeons, physiotherapists, nurses, lawyers, general public. I got over 200 books. I have got 2 Guinness World Records in book writing. So that was my book writing, skills. Then came presentation. All around the globe I have gone, Egypt, America, UK, you name the country I have gone. Over 300 presentations I have done, so far, and that gives fulfillment. Then I went into research. Yes, Vyasa, what our Vice Chancellor was telling. You all will become technocrats. You are super brains, but you will become a technocrat unless you resort to research. So you are fortunate that a Vice Chancellor is telling you that. I was not fortunate. Nobody told me to do research. I had to do myself on my own. And I joined S. Vyasa Yoga University in Bangalore. And so far, I have got 70 international publications in peer-reviewed and indexed journals with my research. Then I became the only orthopedic surgeon in India whose name figures in the non-arthroplasty treatment guidelines by the American Academy of Orthopedic Surgeons, which is a great honor for me. These were 3 research papers of mine, which was picked up by AOS to frame the guidelines of non-operative treatment for knee the knee surgeries. Then went into community service. I have my own trust called Swasthya Health Foundation. With that and with Rotary and with orthopedic bodies, I have done over 500 free surgical health camps. Then I went to Nepal, risking my life, and served these people in 2015. These were the mangled remains of Nepal. My family was scared whether I will come alive. The hotel where I was staying in Kathmandu was shaking every night like this, gad, 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 gad. Then we used to, think how to, run away once if it starts falling on our head. Though by rotation, we all were awake. We were some 5 doctors who had gone from Karnataka. By rotation, 3 hours I will sleep, 3 hours you sleep. If it starts shaking, you wake us up, we'll run. So that was our plan. Because we were destined. We thought we were mentally prepared. If I die, okay, fine. Let me serve and die rather than die somewhere like in a heart attack or a road traffic accident or suicide. Better to die serving people. That was the mindset I had when I went there. Then I became a COVID nodal officer, government of Karnataka, for 274 days. In the first phase, when there was no vaccine, I worked for 274 days on field with only a mask as my weapon. War against COVID-19 when there was nothing. It had just broken out and we were under great risk. I did 107 days duty on railway station platform, standing, screening the patients, guiding the youngsters like you how to screen. And then I became nodal officer of Bangalore, municipality board, West Zone for 167 days. Relentlessly I worked, going around, and these were the places I worked: railway station, bus stand, slum, footpath, factories, shopping malls, housing complex, public place, red alert zone. Then railway, I screened, we had 10,700 team and 1,03,000 passengers. I held them screen. And then I visited 87 PHCs as a BBMP nodal officer. 339 teams were under me, 132 wards, 1,215 staffs working for me. 66 lakh population of Bangalore was covered by our team. So this was the railway station duties I did, standing there as an orthopedic surgeon doing community work. And that is where I am privileged. This is the only profession which gives you both intellect and mind and service. If you combine that, you will go into the greatness. Then I became the medical superintendent of a general hospital, which is a 250-bedded general hospital called C.V. Raman Hospital in Bangalore, which was on the verge of closure with only 29% occupancy when I was made the medical superintendent of this hospital. When I left that after 18 months, that hospital occupancy rate had gone to 89% and I got a national award for that hospital for excellence. Then I revived a 250-bedded, 119 years old, sick CSI hospital in Bangalore. This was the first corporate hospital which was formed 119 years back. The chief minister underwent his open heart surgery in this institute, which is on the verge of closure now. So I became a medical board member, revived it. Now it is earning in crores. When I took over, it was only earning 4 lakh rupees per month. Now it is earning nearly 2 crores per month. Then another hospital which I revived was a rural hospital called CSI Hospital Chikbalapur, which was started 108 years back, which was again on the verge of closure. Then I just, helped, rehabilitate this hospital. So what is that community activity you do later on in your life will determine whether you go from good to greatness. No? So these are the community service I did, whether it's Nepal earthquake, whether it's COVID, or whether it is hospitals, sick hospitals getting in. It's not only about my nursing home. It is not about me earning. It is about others are also doing well. That's what we need to do. Then I became former vice president of the Indian Orthopedic Association, which is the premier body of orthopedic surgeons. Then I became president of the Neurospinal Surgeon Association of India. Then I had some unique distinction. I started holistic orthopedics, and I started geriatric orthopedics too. So now founded Geriatric Orthopedic Society of India, which is now doing extensive work in geriatric practice. And then this is the new subspecialty which I've discovered. We have pediatric orthopedics, but we didn't have geriatric orthopedics. Now we have geriatric orthopedics. Currently, when I'm speaking now, one of my colleagues is attending a camp in Goa, where the Goa Medical College has organized a geriatric. Today is Senior Citizens Day. 21st August is a Senior Citizens Day. So we are doing a camp there from Geriatric Orthopedic Society of India, which is my baby. I'm not there. I'm here in front of you, but the work is going on. Then I set a new trend called holistic orthopedics. Simple, East meeting West, incorporating Indian principles into Western medicine was simple thing what I did. That is called holistic orthopedics. It is not holistic orthopedics. It is WHO. That means whole body concept orthopedics. That's what it means, right? And then it has captured the imagination of the world. I have been invited as speaker all across the globe now. I have delivered 40 orations so far internationally. Then I still do my yoga. I still play cricket. I was the captain of my team always. And at this age of 60, 62, I am playing with the Rotary members who are so young. I remained not out. I went as an opening batsman. I remained not out. And I took 2 wickets for 4 runs in just the permissible 4 overs given to me. I hardly gave any runs. I took 2 wickets also. And I went as opening batsman and remained not out when all my colleagues got out. At this age, right? And then 9th priority of mine was music, inspiration. I have a music band in Bangalore called Inspiration, and I go around. This is a spine conference which was done in Bangalore, and it was completely the entertainment was me. This is me and my wife Parimala. Both of us, have this. We have a team, of course, and we go around giving musical program. My son Rakesh, my daughter Priyanka, my daughter-in-law Varsha, all are accomplished singers. So we all sing all Hindi songs, Kannada songs, you name them, we'll sing, and we enjoy that. My 10th and last priority was practice. Don't think that Dr. John has no money. I have 3 hospitals. Parimala Healthcare Service, Dr. John's Orthopedic Clinic, and Ebenezer Orthopedic Center, both state of the art, and I am earning enough money. Then I became an orthopedic surgeon with 8 Guinness World Records. Not 1, 2. 2 in academics for book writing. Social service. I was not proud of academics. I was proud that I set up Guinness World Record in social service and health awareness. Low backache, osteoarthritis, neck pain. I created awareness for villagers. A huge multitude of magnet of patients sitting, all uneducated, treating them how to take care of their knees, take care of their backs. And it went on to create world records for me. Then till today, I am the only TED speaker from orthopedics in India. Only TED speaker to deliver an international TED talk on February 18, 2017. So, time for reflection for you all. I've just told you my story. Because I can tell anybody's story. I can tell Edison's story. I can tell Narayana Murthy's story. Then you may feel that, oh, doctor is telling story of somebody else. I have told you my own story. I am standing in front of you as an example now. So, you cannot discount me now. You can say, no, he was all talking bookish. No bookish. I am talking my own experience in front of you. So, was it the right way I took? What was the right path? 300 international national awards I've got so far. Okay. I got the Padma Award. And do you know the significance of Padma Award? 140 crore population in India. Only 120 awards per year. That means the percentage of you getting that award is 0.609. That means 120 awards only in a year for 140 crore population. We are nearly 50,000 orthopedic surgeons in the country and 3,000 in Karnataka. Only 18 of the orthopedic surgeons have got Padma Shri award so far. So total Padma Shri given from 1954 to 2022 is around 3,000. That's all. For 20, for 30, how many years now? You can imagine from 1954 to 2022 is almost, I think, 70 years now. Only 3,000 awards. That means on an average, only 50 per year in India out of 140 crores get the award, and only one orthopedic surgeon in every 3 years get the award. So these are the illustrations of the other Padma Shri awardees. In that you can see Dr. Sancheti's name here, and you can see Dr. P.K. Sethi and Yash Gulati, Raj Gopal and all. So I was one among them. And with whom I shared the award in 2016. If I say that I got a Padma award, you may not be very happy. Then you see with whom I have shared. Pandit Sri Sri Ravi Shankar, Dhirubhai Ambani, Rajinikanth, Sania Mirza, Saina Nehwal, Priyanka Chopra, Ajay Devgan, Rajamouli, who made Bahubali, and Udit Narayan. So these were my fellow Padma awardees. So was it not a proud moment for we medicos that one of the doctor was among these? Then got the Dr. B.C. Roy National Award, which is the highest award which a doctor can get from the medical council here. How significant it is? Only 11 Indian orthopedic surgeons have got it for since 1962. This is the list of 11 people. And to get both Padma Shri in orthopedics, Dr. B.C. Roy National Award in the single calendar year, there is no record in India. Getting both the top awards in a single calendar year. I become the first doctor to get both. Right? So, and I got a MCI award for research, a Silver Jubilee National Award for research. Then the BC Roy National Award was for community service. So these are the three wings of a doctor: practice, community service, research. I got award for all three: National Award for research, Silver Jubilee Research Award by MCI, and then the Dr. BC Roy Award for socio-medical work, and then Padma Shri for my orthopedics. So from nothing to Rashtrapati Bhavan twice. That is my journey. If I can do it, why can't you do it? If I can do it, I don't have two brains, I don't have four eyes, or four limbs. Just like you I am. If an ordinary man like me can do, each one of you can become a Padma awardee here. Each one. Right? I had no family background, I had no godfathers, no great institution backing me, no government support whatsoever, but still I shared the space with Prime Minister, President, Vice President. I am standing just behind the Prime Minister, you can see there. Just behind Prime Minister I am standing. So we shared the space with them, and it was such a, and the person next to me is the ISKCON, founder and ISKCON president of India. I think his name is some Pujari somebody. So he's a ISKCON, head. So with those kinds, and Priyanka Chopra is there. 1, 2, 3, 4 on the left of me. So I shared space with these all. And I was feeling proud as a doctor to be there, because I was not a celebrity at all. I am a just ordinary man like you and me. So I had made an unconventional choice. I faced ridicule, criticism, rejection. Then finally I found acceptance, and then submission, and then praise. So how did I reach that level? My foundation has taken me there. I grew up listening to the stories of Mother Teresa and Dr. Ida Scudder from my mother. It was my mother who told me, you are not going to become a doctor to earn money. She told me. When I was joining at 17 years, when I was about to join the medical school, she told me, if your intention is to make money, please don't join medicine. You have got such a high rank, you can become an IAS officer, or you can go to engineering, or you can go into some real estate kind of thing and earn money. But if you are going to become a doctor, then these are the two role models you should follow. She told me when I was very young. She told me, see Mother Teresa and Ida Scudder, they should be your role models. Then I promised my mother, yes, I will follow them and I will fulfill your dreams. So from conventional to unconventional, you find your passion, stick to it. What are the mantras for success? You have both conventional and unconventional. Either of the choices can lead to success for you. There are lesser fortunate people who made it very big in life. Those without training opportunity need not despair. If you make an unconventional choice, no need to worry. You can still reach the top. I am a prime example for you. So in this model, you can see your success as a doctor is based on what is your core value. It is not just training. Core training, become MBBS, PG training, extra skills practice. That is what you are. Then there is on the other side, left side, you can see core values. Money, power, family, ego, principles. What is your core value? Everyone has to go back to their rooms and introspect. What is my core value? Okay. So that is the second path which you need to take. For lasting success, you need to change your core belief system from materialistic to principle based. Your core value has to change. So what is those principle? Ethics and principles. Ethics is honesty, integrity, sincerity. Principles are these, which I'll enumerate now. Be ethical towards your patients. Be honest to your patients. Look upon your patients as your extended family. You don't do this to your parents. You unnecessarily don't replace the joints of your parents. You don't do it for your grandparents. Then don't do it for patients also if it is not indicated. Have the principles, following principles in your life. 1. Have a role model. Don't start your life without a role model. Model on them. Choose anybody of your choice. Maybe your father, maybe your brother, maybe a surgeon, whomever. But you choose the right role model and model on them. Let service be your motto and not money. You aim to become a good doctor and not a rich doctor. That should not be your aim, that I'll become a rich doctor. No, you aim to become a good doctor. And service. Keep service as a motto. Medicine is the only profession where you get to do service every day. Your road to immortality. Embrace service. Then our profession is service based. Keep it that way only. My mother told me these stories, selfless people, great people, and told me to emulate them. Mother Teresa. So she told me to emulate them. You also think of emulating her. That is our service. Third principle, contribute to society. What we should aim is to become a good doctor. And who is a good doctor? A good doctor is one who will contribute to the society. This is Dr. Ida Scudder, who started Christian Medical College with a single bed dispensary. Now you know where CMC Vellore stands. It was started by one non-medico initially. She was a non-medico. She came to India. She was from US. She came to India where her father was a gynecologist practicing in Tamil Nadu villages. So she came to him to stay with her father during the vacation. And one midnight, there was a knock on the door. There was a village, man standing, asking, "There is my wife is delivering. Please, there is a doctor here. Please come." So her father picked up the bag and started leave. Then asked that the villager asked, "Who are you, sir?" "No, I am the doctor." No. We don't want male doctors. I don't want any male doctor to deliver my wife. I want a female doctor. Then he said, "Unfortunately, I am the only doctor here." Then he said, "No, sorry, I don't want." He just left him and went away. And this was watched by Ida Scudder. He was watching in amusement that because her father was a male, this patient was not ready to take him along. Then she went next day to find out what happened. And to her horror, she found that both mother and child were dead. Because no doctor attended on her. It shook her conscience. It said, people in this country are ready to die, but not willing to take the service of a male doctor. Then she immediately said, "This is my life's calling." She decided, "I am going to become a doctor. I'll come back and serve the very people which my father did." And she goes back to US. From commerce, she changes to medicine. Comes back after 5 years as a doctor to the same village, starts a single bed dispensary for females, for women, and then goes on to build this hospital. Still today, Christian Medical College is for females. I don't know how many of you know. Majority seats are for females only because it was started by Ida Scudder with her vision. You can imagine what contribution she has done to a society, being a very ordinary person. She was not a highly intellectual IQ with a 90, 100. No, she was just with a golden heart. So this story was told to me by my mother. And be a visionary. Contribute to the society. Contribute to the society. Think about society, not your family. Don't think only about your son, your daughter. No, think about the society. Be a visionary and leave a legacy behind. When you pass away from this world, the world should remember you. They should say such and such doctor passed away. So many people die. Nobody remembers how many people have died. So leave a legacy. If you leave a legacy, they will remember you. See, these are the guys who will never die. Isaac Newton, Einstein, Edison, they will never die. Leave a legacy behind. Aim that I should leave my legacy behind, not wealth behind. How many cars you have, how many money you have, how many crores you have in the bank, nothing is going to count. Rakesh Junjunwala had 5 lakh billion dollars in his account. Not a single dollar he could carry. He left everything and went. Why? Because you don't carry money. So don't aim at a legacy like that. If you aim at a legacy like that, this is where you'll end up. No, either in the prison or somewhere, like that, because money was your goal, and you will change all your principles to earn money. And you know what happened to Telgi, you know what happened to Dawood Abram. They're all languishing in the jail, and one is already dead. So the principles, you should know how to conquer your desire. Your desire is the one which is your Waterloo. It will sink you, your desires. How you should conquer your desire to become ethical. This is, I'll tell you, the Life of Pi story. You might have seen this movie, Life of Pi. He is trapped in a boat with a Bengal tiger. So he is the hero, take him as the hero, and the tiger is your desire. That's your desire. And the ocean is the life, where is a single boat. He is left with a tiger, and the tiger is about to eat him. Right? So that is how that is how our life is. I am the hero of my life, and there are plenty of desires I have, and the whole world is my stage. Right? So what he does after several days of living with a tiger, he understands that he cannot tame the tiger. It is impossible for him to tame the tiger because it's a ferocious animal. But only thing what he can do is train the tiger. That's how they train in circus. Like that he realizes. Then he uses a stick to train the tiger. Right? So likewise, you train yourself to control your desires. Your desires within you are like this tiger which is about to jump. So you learn how to tame the desires. Okay? Your desires will leave you once you die. No, this tiger, as soon as they reach the shore, it passes away into the jungle, even without looking back at that fellow who was with him for so many days. So it will be like that. Your desires, if you court your desires, one day to leave you and go alone, you will be just trapped like that. So live with your desires, but don't allow it to overpower you. I have a Maruti car. No, now I want a Toyota. I have Toyota. Now I want Mercedes. I have Mercedes. No, I want now Tesla. I have a house. Not enough. Like that. Desires. Try to control the desires. Enjoy your life. Life you enjoy, not the desires. It is an adventure. Your life is an adventure. Try to enjoy it. So these ethics and principles with firmly in place, now you are ready to embark into the world as a doctor. So you cannot choose these things. Our life we cannot choose. Our religion we cannot choose. Our parents we cannot choose. Our country we cannot choose. These are all predestined. But we can choose the way we want to live. That is in my choice. Inculcate these 44 belief systems in you. What is the belief system? Focus on the foundation of your life. That is one belief system 1. Belief system 2. First, have a blueprint of your life ready. You don't build a house without a blueprint. But you are ready to start your life without a blueprint. Which is more important? The building is more important, or your life that is more important? If I ask you what is the blueprint of your life, I don't know how many of you are going to answer now. So you prepare, sit, introspect, find out what is the blueprint of my life. What is that I want to see at the time of death? I have attained that blueprint, right? Then begin your life keeping the end in mind. Always keep your end in mind. This is your end. So I'll start there. Remember, you are just a guest in this world with a limited time. Your stay here is only for a brief period. Okay? You need to make your life meaningful and accountable. And you need to leave the imprints of sands and time. And you belong to the universe. You are a part of this big world, right? Your life is not just for your family, state, and country. Make your life useful to others, not only for you and your family. Be like nature. Contribute. You always contribute. See, animals don't hold wealth like us. Okay? These, nature are not selfish like us. They only contribute. And don't be in the rat race. Why? Because even if you win in the rat race, you are still a rat only. You are become a Pied Piper, wherein all the rats will follow you. We all are into rat race. That fellow is doing 1,000 knee replacement. I will do 1,500. Rat race. But don't indulge in that. Buddha renounced his material desires. He said, no more wealth for me. I don't want the palace, the money. He renounced it. Why? Why did he renounce this? He wanted to find fulfillment and greed of wealth. You remember these Chadda brothers? They shot themselves. They're so rich. They shot themselves. Greed for money. And then don't spend your time holding wealth. Okay? This is the Gaddafi who was shot dead in a drain. He was having 3.26 lakh crores as wealth. He was shot dead in a drain. So don't waste your time trying to accumulate wealth beyond means. Former President Obama, always every year, he used to lie down in a coffin box and they asked the people to close the coffin box. So he wanted to realize death. Then he used to experience death and he used to think how useless my wealth is. It cannot protect me. So that is how he used to bring himself down to earth. That about wealth. Then materialist things don't bring you peace. Don't expect or wish anybody else's money. And the greed of power. These Napoleons, Hitlers, you know what happened to them. So no greed of power. See, Ashoka gave up power. He said, I don't want any power. Because he found the futility of this. And, Jesus Christ, he gave up heaven and came and lived with us. He did that. And these, the leaders, world leaders who promoted their family to become extinct. And here is our own Lal Bahadur Shastri, who did not promote his family. His children went in a Tonga to school. And the children complained, Prime Minister of India's children are going to Tonga in school. Ordinary business people are coming in, Benz car and all. Father, please get us a car. He said, I don't have money to buy a car for you. If you want to go in the Tonga or you go walking. That's what the Prime Minister values, the high values. And never be ashamed of your roots. No one is superior. And be stable in all situations. This is the photograph I took of a Nepal earthquake victim. His whole family wiped off. His property wiped off. But still he was stable. I did not see a single Nepali crying in my earthquake duties. They were all accepting what has happened. Right? And then nothing is permanently flying. You know what happened to Amitabh Bachchan? He was bankrupt. His building was about to be auctioned by Canara Bank. Then how he changed his course with KBC. You all know that. So good times or bad times will not stay ever. So don't give up hope. And then when your profession becomes your passion, then work is worship for you. Remember, a champion does not do different things, but does things differently. Love and serve your country and people. Do not despise them. They need you. Give back to the society. The whole world is your stage. Never indulge in extravagance. Don't waste food and all because, so many people, underprivileged people don't have food. Never take shortcuts. Crime will not pay. Don't take that. Love yourself. You are unique. Believe in yourself. Never accept failure. There is nothing called failure. It is only an experience. I have not failed. I have just found 10,000 ways that don't work. That was told by Thomas Edison. So you are not a failure. Failure is your friend. You are a failure not because of failing, but by refusing to getting up and trying again. So failures are part and parcel of life. If you don't fail, you don't learn. If you don't learn, you will never change. Be forgiving. Forgive people. If they insult you, humiliate you, forgive them. Because otherwise you will be, let go. Let go all these negativities in life. And self-help is the best help. So do it yourself. And you are the architect of your life. Do not waste time in unnecessary prayers and rituals. That homa, that puja, this puja. All that is not going to help you. Take it from me. It's not going to help you. So don't waste your time in all that. Just do your job. Do not remind God his job. Unnecessary rituals. You are trying to remind God, please help me, please. God knows that he has to help you. So don't remind him his job. You do your job, which is very important. This famous movie, I don't know whether you have seen this, Manji. In that he says, Bhagwan ke bharose mat baitiye, kya pata Bhagwan hamare bharose baitha hai. Bhagwan hamare bharose mein baitha hai ki I will do something and bring good name to God. So don't wait for God to act. Work hard. No one has died working hard. And even if you don't work hard, look at the jewelries. The gold, if it fears fire, it will not become jewelry. The wood, if it fears cutting, it will not become a beautiful furniture. You don't resist hard work. Then be a part of the solution always, not part of the problem. Learn that system and don't expect justice and fairness in this world. You'll always feel why I am being targeted, why I am being humiliated, because you will not get justice and fairness. So many people were swept away in tsunami. What wrong did they do? What wrong did they do? So many people died in COVID. What wrong did they do? This is life. That's all. Don't expect. Just accept. That's all. Okay, this is my fate. So no justice and fairness. dedication always. And beware of the social media, the mobile, the internet, the Facebook. They are good servants but bad masters. Don't allow them to become bad master. Embrace discipline, pace you handsomely, always help others, and never lead a life of regret, and indulge yourself in charity. At least 10% of what you earn, give away to people. Don't blame circumstances. Make the circumstances work for you. Don't say, I am in Sholapur. If I was in Ames, Delhi, I would have changed the world. No, no. You can change the world wherever you are. And embrace and express gratitude in life. Remember your country, parents, teachers, the teachers who have spent their life here teaching you. Don't forget, don't say, I have seen students passing and coming out and telling, oh, हमारा teacher बेवकूफ है. क्या आता है उसको? Old man, old lady, सब outdated. Exam pass होना था इसलिए उनको respect देते थे. Now I am smarter than them. I have heard my PGs talking like this in front of me. They disrespect the teachers. They say teachers are outdated. Never do that in your life. Teacher is the architect of your life. If you humiliate him, you take it from me. No 36 crore God also cannot save you. They cannot save you. If you humiliate teachers and parents, no one will come to your rescue. You may be the most intelligent guy in the world, but values are important, and nothing is a handicap in life. Only your attitude is a handicap. And respect and love your parents. Don't send them to old age home. Don't send them to old age home, please. Take care of them. This I am saying as the president of the Geriatric Orthopedic Society of India, where I have been pained to see all senior citizens, most of them lying, languishing, waiting for death to come in old age home. Never do that to them, please, in your life. Okay? And don't go this way. Don't commit suicide in your life. Like that, I had got so many reasons to commit suicide. Always give life a chance. Don't never think suicide as an option, because your whole world depends on your life. Your parents are depending on you. Think about them. Think about your siblings. Don't give up your life for challenges. Practice this which I have told you. You are ready for any challenge in this world. Don't give up life. Okay? Don't get into this, stress in life. Follow holistic methods, which I told you now. That will take you to success. You'll not be a victim of stress like many doctors. Suicide among doctors is a product of stress. 30% doctors are affected. According to the Indian Journal of Psychiatry, 30% of Indian doctors and physicians go through depression, while 17% have thought of ending their life. A study has shown that doctors have higher suicide risk, 2.5 times more than general population, and about 4 doctors per 10,000 commit suicide every day. Out of 30 suicides, majority of the suicides were from medical education institutions. Never, 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 never think of suicide in your life. That is not the solution problem. This is my young orthopedic surgeon in UK, Javalkar. He committed suicide at the age of 38, leaving this young kid. Don't go this way. Don't go this way. You're not here to give up your life. You're not here to take up the life head on. So the message for you is to become a successful doctor. Do this. Just doing MBBS PG is not going to be enough. Pragmatism versus principle. Choose intelligence versus principles both. And then think out of box. Think different. Do not compete with others. Try to be yourself. Do not copy. Try to be yourself. And the cardinal rules for well packaged is, then do not be greedy, do not be unethical, do not be proud and arrogant, practice humility, do not forget your country, do not forget your teachers, do not forget your parents, do not forget the life principles. Rest God will take care. Rest God will take care. You will excel in your chosen field. Best example, Sachin Tendulkar. He was the first packaged example for formula for success, principles, pragmatism, both. They were intelligent and principled. These 4 people, and you can see the result. And develop the self-belief attitude. Conquering Mount Everest. Arunima Sinha, double amputee. She climbed Mount Everest twice with prosthetic legs. Okay, and in everything in life is about attitude and approach. Christopher Reeve, he was the Superman. He became quadriplegic due to a fall from the horse, and he became quadriplegic, and he was a wheel-bound man, but he became a real Superman after the accident and did so much of work for quadriplegics. And you knew about Sudha Chandran. She lost her legs in an accident, and she wore a prosthetic leg and converted that hassle into a success. So here is a man who lost 17 elections, became the greatest American president. So they all have discovered the diamonds in them. Now it is your turn to discover yourself. They all practice the 7P attitude of Arindam Chaudhary. You can now practice. So wherever your attention goes, I told energy force. If it is name, fame, you'll get that. You'll get richness, success, titles, car, house, everything. But ultimately you will die unhappy. For happiness depends on success at all, friend. Holistic success. That means aim to being a good doctor, then good son, good daughter, good student, good husband, good wife, good father, good mother, good brother, good sister, good friend, good neighbor, good Samaritan, good citizen, and finally a good doctor. Be a good servant before you become a good, great, master. So do not take, and you enjoy your profession also. Don't take your life very seriously. Enjoy your life. It is not that since you are going to become a doctor, you keep 200 kgs head on your head and always keep your mouth. No, enjoy. Go, dance, sing, do merry. But always keep your focus there. There are the two C's, community-based service, commerce, commercial-based. Choose the community service. Go, choose and help these unfortunate people there. Don't go commercial way. And if you treat your patients as a business opportunity, things may go wrong. Are we, you, me, victims of this image called God? People think we are God and think that we should always deliver. No, we have to go beyond this image. Our youngsters are at crossroads. 3 things you are going to face as you go out of the MBBS. One is violence, second is litigation, and third is suicide. So I have told you all this. So these are the worst part of being a doctor. The best part of being a doctor, So the worst part are these. The violence, the reasons are multifactorial. It could be because 75% of the doctors face violence during their practice in India. Remember this as you go out. Why? Because of the fear, anxiety, panic, misinformation the people have, mistrust the people have. So misplaced quotes in the social media. This is what makes them attack you. And feeling of wrongdoing by the doctors. Patient feel that doctor is advising for money. He's avoiding his duty. Long waiting hours. Feeling that doctor is not giving enough attention to me. So no good grievance redressal system. So all these are the types of violence. And what are the types of violence you will face? Verbal abuse. 70% is verbal abuse or violent gestures. The patients curse you. They try to hit you. That is the maximum abuse. That is violent abuse or violent gestures. Then is vandalism, physical threat, assault, and rarely murder. And where it happens? In ICUs, emergencies, and visiting hours. So these are the areas where you need to be careful. And who is responsible for the violence? Rarely patients are responsible. It is the relatives, the attenders, the sympathetic bystanders, the political workers, the local goons, and sometimes the police. So they are the people. So what is the prescription for preventing violence? Our curriculum of study has to change. You need to develop more communication skills, understanding the patients who could be violent. You preempt that this fellow could become violent. So be cautious at violent venues like ICUs. The casualty, be cautious there. That is the time when things may go wrong. And you should be ready to run away from that place also if something goes wrong. Or you should be ready to fight back. Fight or flight mechanism. And try to educate the patient relatives. Improve the healthcare. Some of these are implementable. Some are not. So to arrest the violence, what is the role of a doctor? Patient is in heightened anxiety about the disease and finance. Important reasons for initiation of violence. Doctor should train himself to do anxiety alleviation, right? Then avoid the long queues, lack of communication, opaque billing system, unnecessary billing on the patient is the reason for violence. And then when the violence is going to happen, when there is a death of a near and family member, bereavement, be careful. When their life, when a patient's or when a member of the family has died, for you it may be just a patient. For that family, it is the universe for them. He may be the earning member, he may be the only child, right? So have empathy. Don't be gross. Say, your patient is dead, please take and go. Don't be rude. That is when you will face problems. So when there are young children, when there is only earning member of the family, only child with serious disease, be careful. That is the place where you may be subjected to violence. Studies have shown that seniority versus junior matters. That means if a senior doctor can step up and declare that the patient is dead, then the likelihood of violence is reduced than a junior telling. If a junior says, a houseman says, or a postgraduate says that the patient has died, then it will infuriate the patient. But if a senior stands up and says, look here, I have done my best, so this was the thing, and the people will accept the advice or the bad news from a senior doctor because they respect a senior doctor. So I feel that my senior doctors who are sitting here, they should help the junior doctors when a situation like this arises, where what happens in nursing homes when there is a death, the operating surgeon will run away. He will call the resident and say, hey, go and tell them that the patient has died. That fellow goes, that resident has no feeling, nothing, goes, sir, your patient expired, please take the body. Then that is where you will get thrashed because the senior surgeon has run away. The junior doctor doesn't know how to reveal. We used to say, don't say your patient has died, you say your patient has passed away. So that makes a less impact. Okay, you understood? Then hospitals should improve. They should have good grievance redressal system, good security system. And the family and society also has to understand that they should not assault the doctors because there are laws now. It is a criminal offense. There will be 3 years of jail, 7 years of jail, and there will be 50,000 rupees that the patient should know. So put up a display in your hospital. And media should also understand they should not highlight the death or violence. They should downplay it, but highlight the success of a doctor. And the government should come out, legal actions should be taken quick, and there should be good training for doctors so that there is no violence. Then the second problem which you are going to face are legal issues. Why do most doctors get sued? Because failure to diagnose. If you don't diagnose, 31% of the times you get sued. Patient suffered an abnormal injury, you have not found out. Then you fail to treat the patient in time, and most importantly, poor documentation is the one which is very, very serious. You should know how to document everything on paper. If you don't document on paper, even the court will not be able to save you. You might have given an injection. Say you have given an intracardiac injection for the heart attack, but you forgot to write it on the case paper. Then, when it goes to the court, they'll just see the case paper, that's all. You said, no, sir, real, I have given God promise, mother promise, that promise, this promise. I have given, sir, but I forgot to write. No, you will not be allowed. So, documentation is extremely important. So, these are the simple measures recommended by experts to avoid assaults and legal hassles on doctors are the best. I offer a different, very simple and pragmatic solution to this growing menace of violence and suing. These are very difficult, no? What I told, how to avoid violence, how to avoid getting sued. You need to have legal knowledge. You need to learn karate. You need to learn so many things. But is there a simple way how to avoid getting sued? How to avoid getting beaten? Yes, there is a very simple way, which you all can do. What is that simple way? Munna Bhai MBBS you have seen? You have seen Munna Bhai MBBS? What he used to do? What he used to do? Jadoo ka jappi. If the patient is shouting, wait, don't shout, come, first give me a jappi, man. Even that highly agitated fellow will calm down. He said, you may be, having lots of intellect, but use your heart. चल पहले गले लग जा, बाद में मुझे तू मार. No problem. तू मारना चाहता है, मुझे गाली देना चाहता है, तू गाली दे. कितना हो तो जी भर की गाली दे, पहले तो गले तो मिल. Simple thing which anybody can do. This lesson, it may be a joke, but it is not a joke. It is true. Suppose if you are highly agitated, somebody keeps a hand on you. Will you not feel comforted? You are highly agitated because of some issue in the college. You are boiling with anger or grief. Then your friend comes and just hugs you or just puts your hand around. Will you not feel soothed? Or you will get infuriated. अरे क्यों रे जादू जप्पी दिया मुझे? मैं इधर इतना बॉइल हो रहा हूँ इधर. जादू का जप्पी दिया, मार दूंगा. Will he tell like that? Will he? Will you tell like that? Will you tell? If your mother comes and hugs you, all your emotions will be cooled down. Tuck, immediate. हाँ माँ. Then tears will roll down the ear. तेरा बेटा मर गया, तेरा बाप मर गया. चल, ऐसा लगता है कि मेरा बाप ही मर गया है. You give a jappi. Very simple. Please learn the hugging specialists in the world. Amma from Kerala. Her only thing is hugging. That's all. She only keeps hugging people. Mother Teresa. Only thing hugging. That's all. No legal jurisprudence. No violent karate techniques. Nothing. See the compassion they show. Are we not meant to be this? We are dealing with human beings. We are not software engineers dealing with computers. We are not IAS officer dealing with files. We are dealing with people. human emotions. So you become them. You hug them. You put your hand around. Be empathetic. Sit. If they're shouting on you, you don't reverse shout. Just wait. Let the whole steam go. Be compassionate. This is the best solution what I can give. I have not seen any doctor being sued who either hugs or speaks sweetly. Your family doctor concept was there earlier. Family doctor concept. Basic MBBS, that's all. Huh? Entire family used to go to him. He is not a surgeon, he is not an orthopedic guy, he is not a pediatric guy. He is just MBBS. He used to sit like this in the house of the patients, drink some cup of tea with them, eat biscuits, and talk to them as family member. And whatever medicine he used to give, that is to cure them. Now you see, one medicine you give the, क्या सर इससे अच्छा मेडिसिन दो ना, गूगल किया मैंने, इसमें क्या है, इससे अच्छा दो ना. Then if something goes wrong, they'll come and hack you. Then even if you use a sugar coated pill, they take मैं अभी ठीक हो गया. क्यों? That belief, that love on the doctor. If that family practice principle can you adopt as a specialist, then you can see the results. You will never be sued. No one is going to hit you. Okay? Be kind and affectionate towards patients. Will anyone assault or sue a doctor who talks, listens, touches and hugs? I think no one will do that. So let us bring back that nobility into our profession through love and service. How I wish Harsh had inculcated in this Medalium life skills. How he had taught you all how to hug the patients. How he had prepared a workshop wherein how you talk to a patient who has lost his family member. A skill, workshop skill. How you should avoid, how you should fight back, how you should use simple things in your defense when you're attacked. I think next Medalium, fourth Medalium, should have this life skills. Where is Harsh? अरे हर्ष हाँ हर्ष बैठा है. देख हर्ष मैं तेरे को ज्ञान दे रहा हूँ. Next one day workshop, you keep this. Yoga, meditation, life, how to communicate to the patients. Bad news, how you are going to declare the bad news now. Train these guys. They will remember you for lifetime. One day the situation may arise for them. Then the training will help them. Not only suturing out, that's all good, fine. I'm not saying that's wrong. Please sit. No, you please learn life skills as a workshop for young doctors. So this is my advice to all youngsters. Have a bigger goal in life. Why? Now I end my talk with this small thing called Vivavos. How many Vivavos you people face in your life as a doctor? Tell me. From first MB to final MB, 19 subject Vivavos, that is final exam. Then all assessment, and then final exam. How many Vivavos you face? You're always dreading the Vivavos. When you go and sit in front of the senior examiner, your heart is racing fast. You don't know what he's going to ask. Then how I'm going to answer, how I'm going to impress, and how I'm going to get more marks out of this guy who doesn't want to give marks to me. And girls had a technique. When a question was asked, if they don't know, they start crying. The moment they start crying, they, ठीक है, रो मत बेटी, जाओ. We are not that fortunate. We boys are not fortunate. They will hack us if you cry. साले लड़का होके रोता है, ज्यादा सवाल पूछूंगा तुझे अभी, तो मस्का मार रहा है मुझे. I will not leave you. So crying is not going to help you. It's not going to help you. So Vivavos, always a challenge for us. IAS officers, KS officers, they have passed one Vivavos, that's all in their life. And they act so great. You go to a bureaucrat, see how he treats you. A bureaucrat, he is not intelligent guy, he is a most average guy. Only one Vivavos he will face, that's all. And in that one or two will clear and that becomes whereas you medicos, super intelligent brain, how many exams you take? NEET exam, that exam, 19 subjects, Vivavos, you are much more intelligent than all the professionals. So, final Vivavos you will have with whom? Not with your teachers, not with your parents, not with Prime Minister, President of India. You will have final Vivavos with God. Why you should lead an ethical life? Why you should become a principal doctor? Because whatever you do in your life, ultimately, it is going to be between you and God. That's all. You and God. It is not between you and your patients. It's between you and God, because patients are God's creations. So whatever help you are going to do, it is between you and God. So this final viva voce, get ready, how it will go. I'll give my own example. Now, why ethical living? Because you're going to meet your maker and he's going to question you. Your ultimate viva voce is going to be with God. Can you pass this viva voce? You have passed so many viva voce, become doctor, postgraduates. Now, can you pass the viva voce which the God is going to take care of? Do? What questions do you have in mind for me? Welcome to the dream interview with God. Now, God is going to interview you, not professors, HODs. Your God is sitting there last, final. So, I thought about myself, how I will face the viva voce. My final interview with God. I am dead. I am entering. I don't know where I'm going, whether I'm going to heaven or hell, I don't know. But at the entrance, God is sitting. He says, welcome friend, welcome back to where you belong. You have come to your ultimate home. Now, I will ask you a few questions. Before I allow you inside. The viva voce starts. We'll ask you, yes, my son, tell me about your human journey. I was an orthopedic surgeon, sir. Good. Next. I was a very famous surgeon, sir. Good. Next. God is asking me, I'm answering. Sir, I replaced more than 5,000 knees during my lifetime. Good. Next. I fixed thousands of bones as an orthopedic surgeon. Good. Next. I did thousands of arthroscopy procedures, spine procedures, sir. Good. Next. I was office bearer of various professional bodies, sir. Good. Next. I made lots of money, sir. I became very rich. Very good. Next. I built a big home. Good. Next. I drove expensive cars. Good. Next. My children studied in international schools, sir. Good. Next. I built a big hospital. Worked in big hospitals. Very good. Next. I had a huge bank balance, sir. Good. Next. I'm getting irritated. God is going on. Tell good next. Good next. Good next. What next? I did some social service in my free time, sir. Good. Next. I won many awards. Good. Next. That's all, God. What is that you expect from me? I did my best. I did everything. You are asking still good next. Good next. Next. Well, God, my son, very good. You have lived your life as per your standards in a very satisfying manner. But now peep down from heaven. Now you are with me and look down your fate below. See the earth now. From sitting with me, you see. Look what happens after you die. Your money is bloated by your kith and kin without even blinking an eyelid. You thought too much about before spending and saved for the family. Now the same family will not think twice before spending your मेरा बाप का पैसा उड़ाओ उड़ाओ मेरा बाप ने कमाया इतना ऑपरेशन किया मेरे लिए छोड़ गया उड़ाओ. So what did you achieve in life? Did you spend your life for all this? What is your final outcome? Your family and the world has forgotten you already. You are compulsorily remembered or not remembered on these 2 days only in your life. That too by your family. One is during your birth anniversary, they will remember and garland your photo. And death anniversary, they will remember my father or mother died and garland your photo. They will remember only 2 days in the year. Your colleagues have forgotten you. You shared a lot of beer with them, you hugged them, you did so many things, but they have all forgotten you and they are leading their lives comfortably. Your hometown, state, country, world does not even know you that such a such person existed in this world. What does your obituary read? What is that which is written on obituary? What gift did you give to the world? You say you were a successful orthopedic surgeon. You used orthopedics to fulfill all your desires and needs. In return, what did you give to orthopedics? How did you enrich orthopedics? You became rich with orthopedics, right? What did you give to your society, state, country, and the world? These are questions that God is asking me. You only took, but you never gave. You never gave. Even if you gave a pittance. So this is what you are. What difference did you make to the world? Did you make any difference to the world? You manipulated your way to success, always felt that you lived a life of purpose. My son, you have wasted the precious gift of life I gave you. You could have done so many things, but ended up doing so little. I was shocked. God is telling me I have not done anything. Arey, so much I did, so much of honor, respect I have got. Arey, God is telling you I have wasted my life. Why? Then say, final remarks from God. How the teacher gives you the marks now. Final viva voce. Yeah? The marks given. You wasted your life. That they live as if they will never die and die as though they had never lived. You have wasted your life. You could have done so much like these people. You could have done so much as a doctor like Mahatma Gandhi or Mona Lisa or you could have done so much. What is that you have done? Replaced joints, fixed bones. That's all. Right? You could have lived for generations to come like these. The hypocrites, the Charka, Shushura. Like that, you could have lived for generations. No, you didn't. You could have made a difference in the world. Like all these great people. You lived the life of a beggar. You only took. You never gave. Tell me how your life is successful. Your life is not successful. The life was a gift which I gave you. You have wasted it. So, then somebody knocks on my head like this. Truth dawns on me. Arey haan na, मैंने क्या किया? पूरा waste ही कर दिया मेरा life. Then I will say, sorry God, I am so sorry. Please give me one more chance. I will now live the way you have told me to live. Send me back to earth. I will start my life again. I will make amends. God says, ये जिंदगी ना मिलेगी दोबारा. मैंने तेरे को एक चांस दिया, तूने गंवा दिया. बहुत लोगों ने तेरे को एडवाइस किया, तूने सुना? डॉक्टर जॉन ने बोला, भाई माइक पकड़ के 1 घंटा लेक्चर दिया, तुमने सुना? टीचर्स ने बोला, तुमने सुना? तेरे माँ बाप ने बोला, तुमने सुना? बुक्स ने बोला, सुना? कितना चांस था तेरे पास सुनने के लिए? और एक जिंदगी चाहिए? नहीं मिलेगा. चल तू आ गया वापस, अब तू चल अंदर, अब तू जहां जाएगा तेरा कर्मा जैसा वैसा तू जाएगा. So that's what God is saying. So get inspired, my dear friends. Take to ethics or else you are doomed. Enjoy the journey of your life. Not just becoming a doctor, not just passing MBBS. You enjoy the everything what you are now undergoing. Okay? For success, follow the process and not focus on the results. Was it a wrong decision? This dilemma always, this question I always, why did I become a doctor? My Hindi teacher, Thana master in my school days told, you should become an IAS officer, John. You don't go become a doctor. He said, why sir? My dream is to be a doctor. No. You are having different skills. You are a orator, writer. So I think you become an IAS officer, you become very good IAS officer. No sir, I want to become a doctor. So always has to question myself. Was it a wrong decision to be a doctor? You also ask your question. Is it a wrong decision to be a doctor? There are so many medical colleges, so many doctors. So what about me? The answer is no. There is a great dearth of good doctors. There are many doctors, but good doctors hardly. And there are huge possibilities for you. In our profession today, you see what COVID did. And who was the leader? Who was the hero? It was the medical profession. So huge opportunities. People are waiting for you all with expectations like a Jesus is going to come, a Buddha is going to come, a Messiah is going to come. They are going to see no less than a God in you. This is the only profession. Nobody will see God in IAS officer. Nobody will see God in an engineer who built a dam. No, they will see in you. So you are the only profession where you can influence. India needs more doctors. Only 6.1 per lakh is the seats available in the country for MBBS. So it is not farce. Our degrees, our course, still it makes sense in the present time to become a doctor because you have got chance to save. There is only one person on this earth, one profession on this earth whose life is not touched by a doctor. Only profession to have a privilege. He may be a rich guy, influential guy, he may be a king, queen, he may be a small beggar on the road. Everyone's life you will touch. At least thrice you will touch. Once, when the person is born, a doctor is required. When the person becomes sick, a doctor is required. When the person dies also, they require a doctor. Why? Because doctor has to certify death. Then only the crematorium and the burial ground will bury that person. So how influential you are. You are the only person who can touch the life of everyone in this 700 billion people in the world. You can touch their lives either during the life or at the time of birth, death, or during illness. You are such a powerful person. Inculcate those values. अपने आप को जगाओ. Discover the diamond here inside, and then you see the difference, how you'll become. So that was my path, unconventional path, what I call as holistic journey. I went like that, academic, the social service, research and all, and I reached there. You also can reach. I chose my way. Was it the right way? Well, it is for you to decide. All roads lead to Rome. You will reach your goal ultimately, irrespective of what you choose. Provided you have the right values and the attitude, you will be successful. And don't forget this song, Muqaddar Ka Sikandar, Amitabh Bachchan's song. रोते हुए आते हैं सब, हंसता हुआ जो जाएगा, वो मुकद्दर का सिकंदर कहलाएगा. So do you want to be called as Muqaddar Ka Sikandars? Then embrace the life of principles, ethics. Money will become the byproduct. Take it from me, you'll become the richest man. You'll get enough money and also enough duas, blessings. But if you chase money, you'll get money, but you'll be deprived of duas, blessings, principles. So my dear friends, thank you very much for inviting me here. Let me end.
Hello.
What people see, what people don't see. So, most importantly, as you grow into this profession, take care of yourself. Do yoga, do meditation, do pranayam, and take to this combined principles of pragmatism, principles, ethics, not just money. So before I leave the stage, let me sing a song for you. Are you ready to listen?
Sir, I was just going to say that. Sir,
Okay.
here.
Okay.
I was just going to say that. Here. Sir.
Oh, okay.
I'm Dr. Prasad, Professor of Medicine. We want to hear you sing, sir.
Okay. One song, a motivational song, which I used to motivate myself. There were no counselors for us then. Bollywood songs were the counselors for us. Okay, this song is from the movie Imtihan, a 1974 movie. Vinod Khanna, Tanuja, Kishore Kumar, Majru Sultanpuri, who wrote the lyrics, and Lakshmikant Parallel, who composed the music. That is apt for all. I think you should learn this song and sing in your rooms always, which I did. You can sing along with me also. रुक जाना नहीं तू गई हार के कांटों पे चल के मिलेंगे साए बहार के रुक जाना नहीं तू कहीं हार के कांटों पे चल के मिलेंगे साए बहार के. Can sing with me. O Rahi. Can you not sing? O Rahi.
All of you sing along with, sir.
O Rahi.
O Rahi, O Rahi.
See, sir is singing so well.
O Rahi, O Rahi.
साथी न कारवां है ये तेरा इम्तिहान है साथी न कारवां है ये तेरा इम्तिहान है यूं ही चला चल दिल के सहारे करती है मंजिल तुझको इशारे देख कहीं कोई रोक न ले तुझको पुकार के ओ राही ओ राही ओ राही ओ राही सूरज देख झुक गया है तेरे आगे झुक गया है सूरज देख रुक गया है, तेरे आगे झुक गया है, यूं ही I forgot the lyrics.
यूं ही चला
यूं ही चला चल दिल के सहारे, करती है मंजिल तुझको इशारे, देख कहीं कोई रोक नहीं, ले तुझको पुकार के, ओ राही ओ राही ओ राही ओ राही, रुक जाना नहीं तू कहीं हार के, कांटों पे चल के मिलेंगे साए बहार के. Like that, you also, when you walk on this path, always keep your hope. You will become one good doctor. I am hoping that out of the 200 people here, there is one Padma awardee sitting here, or more than one Padma awardee sitting in this audience. And I will get to listen one day, if I am alive till that date, that one of the Solapur Medical College Medico has reached Rashtrapati Bhavan. Let that day come. Thank you.
Thank you very much, sir. We would like you to come in the central stage, sir, please.
This talk is dedicated to my mother, Sampath Kumari, because she is the one who taught me all these principles which I have shared with you today. Thank you, my mother.
My dear students, I think we are spellbound after listening to sir for last maybe 1.5 hours. Okay, so I think all of you should get up and give a loud standing ovation. Louder. Thank you. Thank you very much. Thank you very much. Please sit down. Sir, when Harsh told me that Johnson was going to talk and he's an orthopedic surgeon, so I was just wondering what could be the talk. And in the list of the speakers, the topic was not mentioned. So I kept asking him, what is sir going to speak? But I'll tell you, this has been the most inspirational talks. And I think, Harsh, your Medalium is already a success because, as sir said, me too as a teacher would dream that one of you will be in the Rashtrapati Bhavan someday. You may not become the President of India, but you will definitely win an award and go there. Thank you very much, sir. It is indeed a great honor. Throughout, when I saw sir's presentation and he showed that he was singing with madam, actually I was tempted to tell you in the end to sing. But sir, you have fulfilled that desire of us also. So indeed, we are very happy to have you here. I hand over the mic now to the conductors of this program. I request Sirangan ma'am, the organizing secretary professor, to felicitate sir.
We are really very privileged to have a multifaceted speaker like you, sir.
For 1.5 hours. So much of patience you people showed, and not a single student got up and went out. And I should give a big applause for you for listening me for 1.5 hours. Thank you, students. Thank you, friends. Thank you, sir. Thank you, madam. Thank you, Harsh. Thank you, Dev. Very Sanskriti, who took such good care of me since yesterday. Thank you all. I really remembered my MBBS days, and it was great privilege to be a part of this Medalium, which is a unique concept. Because conference workshop for undergraduates is definitely required, but next time add life skills. Thank you. Thank you, madam. Thank you.
I would like you all to remember one thing what Sir said, that you all are diamonds, you are gems. What we are doing as teachers is only trying to polish. Okay? So, with that, Harsh, thank you.
The medical life can become draining and dull, especially for students who do not have a direction. Sir, you have inspired us to go in the right direction required to combat stress and the troubles that come our way. Thank you for mentoring us on how to approach common problems in new, innovative ways. Thank you, sir, for guiding us on how to make a difference in this world. We will definitely aim to mold ourselves into the greatest doctors we can be.
Padma Shri, Dr. John Abenza sir has accomplished milestones that most of us only dream of. His accolades are endless and still counting. We feel extremely privileged to have face to face live interaction with such phenomenal and dynamic personality. Thank you so much, sir, for enlightening us with your words. We will try our best to walk on the path of success while taking care of ourselves and always pushing forward to widen our horizons. Thank you, sir.
Harsh, lunchtime?
I request everyone to remain seated till further instructions are given.
Guys, please proceed to lunch and try to make it quick. We need to be here back by 2 to max 2:15. Thank you, everyone.
So, welcome back, all of you, for the post lunch session. It's indeed a very proud privilege for me to introduce to you Padma Shri Dr. Raman Ganga Kedkar sir. I think there's nobody here who doesn't know sir. He is such a pioneer person who's worked in the ICMR. Dr. Ganga Kedkar sir is an Indian public health expert and epidemiologist. He served as head scientist of the epidemiology and communicable diseases of ICMR and was active in handling the Nipah virus outbreak and coronavirus pandemic. When we fought the two waves of COVID, Sir was the person who was guiding us every moment. And because of his guidance and updated ICMR guidelines, we could successfully manage two big waves of COVID-19 pandemic, and we could also manage further the third and fourth wave. Sir has been awarded with the Padma Shri, which is the fourth highest civilian award in India for his service and research in AIDS. He was also the director in charge of the National AIDS Research Institute. And in 2018, he was appointed as head of the Epidemiology and Communicable Disease Wing of Indian Council of Medical Research. Here we have Sir with us to take us through his journey as a doctor to the stature he is today. Sir, I welcome you for this conference. Thank you very much for coming. I would like you to deliver your talk, sir.
Am I audible? Hey, am I audible at the back?
Is this better? Is sir audible to all of you? Quiet, please.
No, am I audible? Okay. Now, what I'm going to do, I was asked to speak on my reflections in my journey of research in the past and the success and missed opportunities. Now, let me first put up a disclaimer that whenever you tend to hear such talks, they can border towards narcissism. They can perhaps be a reflection which may invite a comment that ye satya gaya. But I'm not an eye specialist. But this is the first time I'm speaking like this on PowerPoints. Otherwise, people used to interview in other conferences. So please take everything with pinch of salt when you think about it. But at the same time, I'm telling you that I'm not going to hide anything. Now, if you actually try to go down the memory line and try to think, no, this was yesterday night was the first time I was reflecting so much on how my journey was. So essentially, this is going to be my best effort, where I have also got to minimize my recall bias. No, most of you must be knowing about recall bias. No, we don't remember things of the past, but we need to understand that. Now, this is my early part of my journey. My father was a part of a revenue service. He used to be transferred every 2 or 3 years. I was learning in Marathwada, all Jilla Parishad high schools. It used to be Marathi medium, and then I still remember what changed me more. In ninth standard, in a particular year, my father was transferred 3 times. The result was, when I went for higher mathematics quarterly paper, I got 10 out of 100. And then I came home, I still remember, I was crying and I came home and showed my mother, no, these are the marks that I have got. Her first response was, if you feel you should drop higher mathematics, then in those cases, in Marathi they used to say, Bangda ghal म्हणून. You have to learn, you have to struggle. And that's how my journey started. And perhaps it was a good thing to happen in early part of my schooling career. But one of the things that happen when you are part of Marathi medium is communication in English becomes a major challenge because we didn't know how to speak in English as such. Then subsequently, for pre-professional, I went to Lal Bahadur Shastri College in Dharmabad, which was the only college for science studies in that particular taluka. Now, I was underage because when I appeared for SSC, my age was 13 years, 6 months. And then when I passed pre-professional, I was underage, so I had to wait for 1 year. Then I did not know what I would do. So my father was transferred to Pune. So I joined Ferguson College. No, without telling my friends that I was underage and I was going to finally join medical career. But that was the only way I could socialize. And at that time, if you ask me, I remember at the time, they used to speak in English all the time. And I used to decide I am going to communicate with them in English. I also understand good grammatical English per se. They used to speak so fast that when I used to think of what should be my response, by the time I could utter those words, that part of conversation would always be over. So I developed all kinds of issues with one's own competencies that one perceives. Then for first MBBS, I joined SRTR Medical College in Ambezogai, and after first MBBS, I got transferred to Government Medical College in Aurangabad. But now knowing that the communication skills that I had, the fear of English, one thing which I must say, I was always a backbencher. Because I used to find it difficult to communicate, so I used to say, why should I sit in the front rows? I can't answer anything. And for whatever reasons, one habit that I had, I never adopted shortcuts. Those kinds of books which were written by Indian authors, not that they are bad, but they don't explain much. If I don't understand, I can't remember. So I used to read standard textbooks, whether it is, if I was to give an example, Harrison, I would never go to even Davidson, leave apart Golwala and those kinds of things. The result was, if you sit in the front benches, when the professor used to ask a question, what are the 5 causes of this? I would never know. Golwala used to have that. But Harrison never said what are the 5 causes. So essentially I remained as a backbencher. At that time, when I'm talking of a period sometime around 1981, we had very few PG seats as such, and there was almost no scope to go for PG in other medical colleges. So wherever you have done, you have to stay there. What was also difficult was my batch had a result for final MBBS where 27 students passed out of 100. No, unheard of in today's phenomena. But essentially, what would it mean? Some people will feel he must get a postgraduate degree entry into postgraduate degree program. But did this happen? No, it did not, because the number of seats used to be so small that I had no choice but to do DCH alone. No, I did DCH, and it was out of sheer ego, to be really honest, because my professor for medicine was Dr. R.B. Bhagwat, who recently passed away. No, he sent a feeler that if you join MD medicine, I'll give you a pure PG seat. Pure PG seat essentially meant that I don't receive stipend, which I didn't want to risk, because that was not something which I wanted to do. But I did DCH. But did it pay really well in my life per se? Perhaps it did. No, I still recall my first day as a resident in pediatrics. On the first day, I diagnosed dextrocardia situs inversus in a child, in a girl who was 7 years old. Now, this girl used to get repeatedly admitted in the hospital for malaria, so-called suspected malaria. And when I diagnosed that case and sent it to my SR, the first thing that happened was he shouted at me and he said, please show me your stetho. I said, why? No, he said, maybe you are using adult stethoscope and not pediatric one, so you are finding that this is dextrocardia. And do you think in our college, everybody has been making a mistake that the child actually has malaria, but it turns out eventually that you are claiming it could be hepatomegaly. No, you were actually looking at hepatomegaly. Fortunately for me, I received firing that day from everybody, including unit in charge. But I was lucky. No, when the X-ray was taken and it was shown the next day, it was dextrocardia situs inversus. And then the attitude was different. So I used to pick abnormalities well. It was I had a case series of cleidocranial dysostosis. And then people started calling me that he is a syndrome man. No, there is a big book in pediatrics of syndromes, where you see faces and things like that. And as I said, I always believed in looking at standard books that tend to guide you better. And that book was also seen by me from my seniors earlier. The result was I became famous only as a syndrome man while I was doing this post-graduation. After completing DCH, Professor Inge was my HOD. No, he himself suggested that either you join as a researcher in my department, because I have got an offer that I should become visiting professor for Bristol University, so we will do research here. I was not very sure because he is still alive. He is in Pune. They were living in quarter, and for first 15 days of the month, he used to come on a scooter. Quarters were close by. But after 15 days, he could not have it offered. He used to come walking to the medical college. So I realized, there must be a lot of stress, though this gentleman is known all over. He did his MD pediatrics from AIMS. He was actually his other peers then was Meherban Singh and those kinds of people. He was a big man. So I said maybe he may not stay with the government at all. He said, then in that case you work with me, handle inpatients, I will handle outpatients because I am older now. This, when he offered, I said, sir, there is one thing which we must remember. There is a Guru-Shishya kind of a relationship. The day we will become partners in financial issues, this relationship will be broken one day or the other. This I will never compromise at all. Then he suggested, I have seen you for last 2 years. Please go and go for research. Your aptitude is for research. You go and join National Institute of Nutrition in Hyderabad. Now, please remember, National Institute, National Institute in Hyderabad, no, I had never seen that before. But it was just that I heard about a lot of people who have been working in that area. In the hindsight, if I think that I did DCH, which makes you langda, no, in terms of competition. No, you have to compete with people who have postgraduate degrees, so you almost don't have any future. But if I would have done MD, perhaps MD medicine or even pediatrics in those days, I would have become only a practitioner. Maybe I would have been renowned practitioner in a small geographic area, and then perhaps I would have done a lot of money. But that was not to be. That was a journey which perhaps ensured that I have added one more handicap in my life, and I would move around with that handicap so that I remain focused. When I joined NIN, it was an accidental thing. My grandfather in Hyderabad was sick, so I had gone to see him, and at that juncture, I just visited NIN, and there was an advertisement there. And when I saw the advertisement, I remembered what Professor Inge had told. I applied, I got a job. But look at the paradox. That job was of assistant research officer. No, far below dignity for any medical professional per se. But I did not bother. The reason was, if you start reading even malnutrition anywhere, even now in the textbooks, NIN was one of the 3 global research institutes, a very renowned kind of institute. You look at their legacy. You had Dr. Gopalan as a giant, Dr. Srikantaya, Dr. Kamala Krishnaswamy, food and toxicology lady, Vinodini Reddy, a vitamin A lady. You read any kind of reference, you will find Vinodini Reddy. Then I joined NNMB. They posted me as in charge for Maharashtra State in National Nutrition Monitoring Bureau. The truth is, this is, how much of time do we have? When did we start? So that I can pace it appropriately. No, but you can always tell me that it is over. No, I used to take pride in those days. The reason was simple. We were asked to do nutritional status assessment among all tribals in Maharashtra and one in Madhya Gond community, because Madhya Gond was a primitive tribe, and in that primitive tribe, the growth rate was falling. So Planning Commission, which used to rely on our data, they gave a specific job to find out why the growth rates are low. But then you have to remember that this Madhya Gond survey used to take place in Gadchiroli, Bhamragarh zone. These were Naxalite areas. No. Even I had to face Naxalites then, because that was a time when the police had some certain encounters with Naxalites, and that led to all kinds of problems then. But I was lucky. Did that affect me anyway? No, it enhanced my resolve to try and make difference, because those were really poor people. We had to do something to them. But there were certain issues. This was a temporary job, and in 1988 we received a termination letter from them, and then I felt that I was less utilized. So I decided that I would switch the job. When I did that, I had 4 options. One was joining CARE. No, CARE is Cooperative for American Relief Everywhere. No, this is an American NGO, and they said you need Maharashtra. But I didn't want to do that, because I asked a question that, does this mean in future I can become head of your India division? They said, we still haven't done that. but the person who came to interview came from New York for the whole thing. But when he said that, I said, then I don't want to join. Then I was to become medical advisor Wockhardt, which I decided I would not, because my strength was nutrition. They had nutritional projects, nutritional supplements which they were producing. Then there was a post for research officer, National Institute of Virology, Pune. I couldn't succeed in getting that post. And then I went for research officer, Institute of Immunohematology. This is also ICMR network institute. And there I was selected, and unfortunately, when I went to see my director, he said, please write a project in 7 days for research work. You will work on sickle cell disease. And I was extremely upset because sickle cell disease was not seen so often in Aurangabad, Marathwada zone, and therefore I was less comfortable. But at the same time, there was a MS general surgery person who had also joined as research officer. No, he was offered to work on thalassemia. And thalassemia for me was very natural. But then I said, how do you say no to him? Take it as a challenge, move and try to do something in sickle cell disease. Mumbai is classically an ocean of professionals. No? You are coming from Marathwada. you don't have good credentials to actually go in and fight it out. On top of it, I was only a DCH person. When, if you actually look at the giants that used to be there, this was on the 13th floor of KEM hospital. On a 7th floor, if I recall correctly, it was Dr. B.C. Mehta, one of the most renowned hematologists of the country. You had M.B. Agarwal to compete with, Sunil Bichale, who was a GMC person, but then subsequently he went to Bombay. And I was the only medical scientist. The surgeon who had joined was least interested. He had come for passing time. There was no clinical work. And that hurts you a lot. Because the entire institute was lab-based per se. What I did then, since Bombay didn't have sickle cell patients, I established 2 clinics, one in Valsad in Gujarat and one in Nagpur for sickle cell disease work. And then when I did that, I had once gone to Valsad for doing work. Valsad was community-based cohort that I was trying to follow. I went there. At that time, Dr. Italia, who used to be my local, he was a pathologist. He was a local person who used to help us out. Now, what he did was, he said, when I returned back in the evening, he said, अरे जाके ना आज एक पेशेंट शाम को देख के आ. मैं क्या देखना है? तो एड्स का पेशेंट है. और फिर मैं क्या देखूं? तो हम बोले नहीं, आपने तो देखना है. अरे उसको गांव में से पूरा बाहर निकाले हैं. आई होप पीपल अंडरस्टैंड हिंदी, एवरीबडी. बाहर निकाले हैं, अभी क्या करना है? तो मैंने उसको हाँ बोला है. मेरे यहाँ से वो पॉजिटिव आया है. उसको पूरे गांव में उसके ऊपर, आई वोंट टेल द नेम ऑफ द विलेज, वो गांव में उसको ऑस्ट्रेसाइज किया है. तो अब उसने बोला, तो देन आई वेंट. उसकी कार थी, ही वॉज ए रिच मैन, वो गांव को लेके गई. एंड दैट वाज माय फर्स्ट एक्सपोजर टू एड्स. हाउ डिड इट हैपन? इट वाज वेरी स्केरी, because when I went to his house, we were sitting across on a dining table. I don't know why they had dining table right in the first room. This is a story which almost everybody who we trained in HIV initially, they actually knew. I used to tell them this story. Then I still distinctly remember that fellow came from the bedroom. His wife came out from the kitchen. And then when he was sitting, for him, I was first outsider who was willing to speak with him. So he was speaking with me in a very animated manner. And then the saliva of that person used to fall on my face. And I was so scared because J. Levy, one of the big researchers then in HIV, he had written a paper which was published 7 days back, where they had written that you can isolate HIV from every body fluid. It was those days. This is a story of 1989. And I panicked so much. His wife came and she said, "You have come in the evening. गुजराती संस्कार ऐसे होते हैं कि आपको खाना खिलाना पड़ेगा." At that time, the shower is on, and she's talking of eating. I was scared. I said, "नहीं नहीं, मैं खा के आया हूँ," which was wrong. It was not the truth. But then she said, फिर तो मैं बोला नहीं, आप ऐसे करिए, चाय लेके आइए. The hope inside was the only fact. I was not from HIV division, so for me, I didn't know anything beyond general logic. No, they used to say if you boil anything, no, HIV dies. So I said, fine, no, let me let me go ahead and have tea. But the shower of saliva was so much, it was occurring so often that my legs, they started shaking. It was violent shaking of my legs to a tune that I was worried when his wife comes with the cup of tea, she will also see that my legs are shaking. So I held my legs by my own hands to try and see that nobody else comes to know about it. This lady, when she walked out from the kitchen with cup of tea, she was smiling. And then suddenly there was a thought that came to my mind, that if this lady, who is a non-medical person, who perhaps stays in the same bedroom, is in contact with the patient almost for 24 hours, we don't know, they must still be continuing sexual activity. We still don't have, I haven't asked that part to him. If she can smile, then shame on you. You are at least a medical person. You should not do that. And then the shaking stopped. And that was the point where I actually owe everything to her for my entry into the field of HIV completely. What was worse? No, I came back to Bombay, and you have to report to your director. When I told my director that I had seen such and such AIDS case also, his first response was, it was Dr. Apte. No, Dr. Apte said, "Acha, then do you want to work in the field of HIV?" I said, "No problem." When I said no problem, his first response was, "Go back home, talk to your wife, and then report tomorrow." I said, "Why should I ask my wife? My wife is a homemaker. No, I do not discuss my professional decisions with her unless it involves her altogether." He said, I am far older than you." He showed, no, he was bald. "No, look at me. No, I'm telling you, you should go home and talk to your wife." So I went and spoke, to my wife. My brother was also there at that day in my home. So he had come from Pune. So when I spoke with her, what she said was simple. No, the first question was, my brother said, "Why have you fought with anybody?" I said, "No." He said, "You are a pediatrics person. Why do you want to work in HIV?" So I said, if everybody keeps on saying, "This is not my business," then who is going to work for them? So he said, "Acha, next time onwards, no, when I come to your house, I will bring my own razor. I will not share razor here, or all the things that you need to bring to your house, perhaps we will be using separately." And my wife, she said, "Please give me some time to think about it." That time, as I said, I was telling sir that my daughter, who is also a VMMC student, no, she was there at that juncture. No, so she said, "Let her sleep." I said, "Okay, let us discuss after that." We started discussing, and then she said, "Give me 1 day's time." No, I couldn't understand anything. Why she is taking such a long time? But I didn't want to go against her. Then the next day, when I asked her, she said, "You can work." And that was a scary thing for me, because I said, is it that it is power relationship of a male and a female, a woman who is not earning and a male is earning, so earning member, and therefore she is saying yes. So I asked her a reason, why? Why are you saying yes? Then she told me one thing. Please remember one thing, that if there is a fire in this house, I used to live on 7th floor. The moment you will detect the fire, you will say, you will just start running towards the lift, no, because you want to escape. No, and then when you reach the lift, you will perhaps realize, Arey, you have your wife, Gauri, my daughter's name, she is still in the house. Now I have to go and pick them up first. No, so I will return back. She said, do you know why? This is a typical self-preservation instinct that each one of us has. No, and if we have self-preservation instinct which is far superior than other responses that you would have for others, then who am I to question? You are a medical person, you understand the risks, and you should go ahead and do that. Then I told her only one thing, that this is fine to listen to, but we still don't know how HIV is transmitted. No, not enough was known then. If ever I acquire, I need an assurance from you. If ever I acquire HIV infection anytime in my life, you should not question on moral grounds to me. No, it is possible. I don't understand. I might get it. She just laughed and went away. And my second woman who influenced entry in HIV in a strong way perhaps was my own wife at that juncture. I became the fourth clinician in Bombay in those days. There were only 3 clinicians who were willing to even touch or speak with an HIV infected individual in Bombay. This is no exaggeration. No, this is time around 1989. One was Dr. Gilada, the second was Dr. Maniyar, and third was Dr. Sapre. I was the fourth one. And within a short span of time, I established a cohort of 73 patients in HIV. Those days were different, no? Those days, the clients those who used to come for testing were partners of film stars, no? It was a different kind of a world in Bombay at that juncture. And then you had to ensure that you retain your cohort really well. No? That projected me very strongly at a national level because I was one who had this particular cohort. And at the same time, simultaneously, I was establishing sickle cell disease cohort. One was hospital-based cohort and the other one was a community-based cohort. And my first talk that I had to give, now imagine somebody who has come from a background like mine, I was to give in front of Bombay Hematology Group, which had these stalwarts that I talked about. And they appreciated it so much, it gave me a lot of confidence on what I am doing because there was nobody otherwise to supervise you on sickle cell disease at that juncture. Subsequently, Dr. B.C. Carr, who is very well known, read about sickle cell disease, you will find that he had collaboration with Dr. Sargent, who is known as a world authority on sickle cell disease. He had the largest cohort, large number of publications coming from Burla. He liked my talk so much on the cohort that I had developed and some research outputs that he suggested, I will get you transferred. I want to hand over this particular large cohort that I have to you. You will get a promotion because your additional director general was junior to me. I can just tell him to promote you and shift. But I went against because I was to prefer HIV plus sickle cell disease combo. No, I said I won't be able to do that if I go to Burla. 1990, my first presentation in World Congress on AIDS that was taking place in Bombay was highly appreciated, where I had developed a model to say where would this HIV spread. Yeah? And now this is no exaggeration. As I said, I am not a eye specialist. But this is because your people said you should tell how things unfolded so that others feel motivated to join in. No. One of the things that had happened was there was a Time magazine reporter. And after my presentation, she said, it is of such a great utility. I would like to interview you and put it in Time magazine. Now just imagine, I was hardly around 30 or so. No, maybe even lesser, I don't know. No, and somebody saying Time magazine and I would put your photograph there and interview also. So I went and asked Dr. Apte. No, one major learning that took place that day. No, when I asked him, should I give this interview? Because he is the boss. No, so when I asked him, his first response was, you can give, it is up to you to decide. But please remember, no, once people will see that you have come in Time magazine, it will be appreciated for a short period of time, but thereafter, everybody will ensure that they have to pull the legs and ensure that I don't grow at all. What you want to choose, you do. So I thought his wisdom was far stronger. I refused the interview because I kept one thing in my mind: no shortcuts. Look at the long-term thing, and short publicity doesn't make much difference. In 1991, there was an orphan who was HIV infected, who turned out to be HIV positive, and the child was admitted in CWC, Andheri. It was an orphanage. And there was a chaos because nobody wanted to touch that baby, and the baby was hardly one and a half months old child. So Dr. Sarunke, you must have heard of recent even in COVID in Maharashtra. No, he was running the AIDS cell. He also came from government medical college. So he said, will you go and handle the situation? I did. I did it effectively, had a big session with everybody in that orphanage. But thereafter I realized you cannot intervene only at one side. Let us try to prevent it. So Indian Association of Promotion of Adoption, IAPA people, they came and they said, let's do it for all orphanages across. I did it with a lady who had actually been handling a HIV infected child in her household. And she was a lay person, but it was such a powerful effort that in Bombay, nothing ever happened after 1991 in orphanages. That was one of my first success stories that occurred then. Simultaneously, there was first, interaction with men having sex with men, gay people and sex workers. I come from an orthodox background. I had never seen what is a red light area. When I went to Kamatipura, I was shocked. Kamatipura those days, there used to be 1.5 lakh people, sex workers, who used to stay in Kamatipura in those days. And then I saw their quality of life. One of the things which I realized is they are also equal human beings. And when I put quotes, it is also to tell me that that time I was considering them as they and not only equal to me as every human being. But I had to change within. I decided that I would also make efforts to empower these women. And Dr. Vijay Thakur, one of my early compatriots, and we made every effort in India. And this was not an official effort. Every Saturday, Sunday, we used to travel. In Maharashtra and Karnataka, we tried to develop a community-led targeted intervention. We wanted to see that we don't remain gatekeepers. Even those who are illiterate sex workers, they should lead their own intervention and not us. Because then, gatekeepers benefit and they always try to deprive these women of their rights. It succeeded for quite some time. We were very happy. But then BMGF came. Bill and Melinda Gates Foundation put in so much of money in such interventions that we could not fight with money, money power, and we lost it. one of the PLHA leaders, first person who was found to be HIV infected was Dominic D'Souza. His case had become very, we had received lot of media publicity. The reason was very simple. This fellow was found as positive, and in Goa, they used an act and arrested that individual. Dr. Gilada and Anand Grover, they came together and tried to ensure that he was released from the prison. Then we supported him and established what is called as Positive People's NGO. And at that point in time, after some time, he was the only voice of people who are infected in India, even internationally, and he was a very good communicator. What happened was he contracted, those days he had advanced disease, so he contracted pneumocystis carinii pneumonia, as it was known before. And we wanted to see that in the struggle again for AIDS, we don't lose him, because he was also a strong force. So in those days, there used to be pentamidine was an injection, and it was not aerosols. No, they were not available in India. They were available in Australia. We tried to get those for this patient, and we shifted Dominic to Bombay. It was a very large large private hospital. And when we went to the hospital, they said, we are not against you. No, we will allow you you can take care of your own patient here, but none of the staff members would come there. Now, if you recall, in PCP, you have breathlessness. Now, when you have breathlessness, we were not people who were providing quality care in a patient who is admitted in the hospital. Now, the result was, there used to be a humidified air which used to smell different, and all of us used to get worried whether you will acquire the same infection from Dominic per se. Dominic died, and when he died, he had written a will where he said, I want to be cremated, despite being a Christian. We tried our level best. So we called everybody who were working in HIV in Bombay then, but not more than 4 people could come. They did not want to come. And that was one time when we realized that working in HIV can be extremely difficult. And if those 4 people who were there, we told each other that if any one of us dies, we will make every effort to give khanda, जो बोलते हैं ना, खंदा देने के लिए 4 लोग तो हमने कैसे भी लाना है, and we should have that bond remaining there with you all the time. Simultaneously, what was happening was, we were invited by ethicist groups in Bombay. They are from Catholic churches. जल्दी करूं क्या? नहीं, बात का सेशन कितने बजे है? अभी तो 1992 को आया then what happened, the ethicists wanted to discuss, because we were a small number of people in the field of HIV. They wanted to discuss implications of condom use, the way we were promoting, because Catholic Christians, they don't allow you to speak on those issues. Then when they called there, at that time, they were all very senior people in white robes, those who were ethicists, and they started discussing. There was an animated discussion. But in the end, when the fights started occurring, I went on the mic and I started discussing. I tried to tell them that please don't treat this particular use of condom as a contraception. But think about it, contraception may be something which is not allowed in Christianity, but think of it as an anti-infective measure. And that's how, I managed to sell that idea well. Then Father Pimenta, who actually was even one of the candidates for Pope's post some time back. Father Pimenta said, "This is the only Hindu we will allow to speak on sexuality in our area. HIV is an important issue. We have to protect everybody." And then I was told to start talking on sexuality, STDs, and HIV in Catholic schools. No, they were the best schools that we had in Bombay. The result was that experience was dramatic. No, this was also not allowed in official work because I was a researcher. So I used to go every Saturday, Sunday to Bombay and try to train the parents, their children. After that, the impact was the government of India recognized that if this person can do this kind of task without inviting any social pressure, then we should start family life education, a course for school children. And that time, one of the secretaries, if you may recall, our chief election commissioner used to be Ansari, who retired from there. Uh, he was in human resource division. So what he said was, you develop similar program for college going students, which was called as University Teachers Aids. And those two programs were perhaps one of my major kind of contributions on this particular issue per se. In 1992, something went wrong. Now, we were to actually decide how to do sentinel surveillance of HIV in India. The meeting was taking place in Calcutta, and WHO's group had come. James Chin, one of the kings in the field those days, and Paul Sato was another one. And we were having all kinds of brainstorming how to do it and the scientific design part. Suddenly, my additional DG came during lunchtime and he said, "Acha, I have heard that your father stays in Pune." I said, "Yes." "So I am transferring you to Pune." I said, "Why?" He said, "I have established National AIDS Research Institute in Pune." I said, "I have never heard of this institute." He said, "I laid the foundation stone yesterday before coming to Calcutta, and I have decided all those who are working in the field of HIV in different ICMR institutions will be pooled in Nari." And I didn't, no, I never wanted to go to Pune. The reason was Pune was known as Marathi Sanskriti's Mahar Ghar. No? I said, how HIV will thrive there? HIV will not. See, if you are in Bombay, you have 1.5 lakh sex workers. No? So your suddenly patient base becomes too stronger in terms of number. But I tried avoiding. Finally, I had to succumb to the pressure that came, and I had to go there. Was that a good thing to happen? Yes. It was good because that was a time when people with whom we had, as I said, small clan in HIV, people with whom we were also interacting were involved in bovine HIV vaccine trial. Something which was a dubious activity. If I would have been there, without knowing, I would have become a part of it, and perhaps you would have looked at me as a criminal by now. No, not a good thing to happen. This was the first reports that we generated. As I said, we never believed Pune would have such a bad HIV scenario. You look at female sex workers, the prevalence rate in Pune then was 56%, close to 56%. You look at male STD patients, it was around 20%. Partners of STD patient, 14%. And if you look at HIV incidence, that is rate of occurrence of new infection in the community, you will find that we had the highest rate in the world at that juncture from any city reported. And that was something which led to development of far more studies at that from the same clinic, the Gadikhana clinic where I used to work. When I joined Nari first day they told me that you have to go to BJ and there is a skin department and we have to test all those patients of STDs, so you collect the blood. And I was shocked because in Institute of Immunohematology, we were never asked to do phlebotomy. No? And they used to Becton Dickinson needles, no? Vacutainous, which were not seen otherwise in those days. When I went there, the first thing that happens is I get a needle stick injury. And unfortunately, the patient was having phagedenic chancroid. I don't know, you will not understand. Acute phagedenic chancroid is almost a pakka sign that the person could have had been HIV infected, and which was known at that juncture. I was scared. I passed through all kinds of scares, including the typical way we think, why me? Why did God select me to get this kind of a needle stick? What wrong have I ever done? Later, I was asked to join Dr. Kotnis dispensary as an in charge there. Kotnis dispensary is the same Dr. Kotnis, Kotnis of Amar Kahani kind of stuff. No? He was the one who went to China and helped them in World War II. And we had the oldest STD clinic that was present at that juncture. Now, what was worse, I was a pediatrician and I didn't know how to diagnose STDs, how to handle STDs. But then one thing which I did was I never gave up. I accepted the challenge. Every Saturday, Sunday, I used to go to GT hospital and learn about STDs. One of the best things that I had is we had collaboration with Johns Hopkins University. The result, we were using the best diagnostics which were perhaps not available to any STD practitioner anywhere in the country. The result was I could refine my skills of diagnosis and management very well, and to a tune that we had one of the largest cohort of STD clinic attendees. 10,000 odd people were followed every 3 months in the clinics per se. One good thing that I could do, I could project Gadikhana, which is known as Gadikhana, that is Dr. Kotnis clinic popularly. That Gadikhana became globally famous in terms of research if you look at our earlier publications. My clinic used to get one advantage which I had was Budwarpet was close by, so I used to get sex workers, MSM, all kinds of Hijra population, and that was a big learning that I used to have then. I must have been perhaps the first pediatrician to give a keynote address in a national venerologist conference. That is because I had good collaboration, I could learn and refine my own skills. All this was because of the scientific rigor that I had developed because of research mindset per se. The biggest opportunity that influenced my career was I was sent for doing MPH at Johns Hopkins University. Johns Hopkins is world's #1 public health program institute. What is most important is it's perhaps #1 in majority of the medicine related branches. I did not take my family with me. The reason was, which was allowed, and I used to get more dollars if I would have taken there. But my biggest fear was if I take my family and if they start saying that we like the USA, we would like to stay back, then what would happen? My desire to come back would never get fulfilled. So I stayed alone for 1 year in US, and what was most important was I took 110 credits. There was the maximum credits that you can take in JHU for doing MPH was 110. If you have to pass, you could do it with 80 credits, but I took 110 because I said this is my last opportunity to learn. I may not be able to give full time again in my own life, and that shaped me a lot because I went up to AP5 level because you used to have AP1, 2, 3, 4, 5, and the same way in biostat, and that shaped the way I think. Though if you ask me, during COVID times, I was recognized as an epidemiology person. But if you ask me, I used to be a clinician before, but this MPH added that layer of epidemiology to my mind. My first most cited paper was a very simple one. Those patients who were coming in Gadikhana, and their partners were getting tested. And one day I decided, while I was in JHU, I decided that we should compare sex workers versus non-sex workers who are STD clinic attendee. When we analyze the data, one of the things that became prominent during analysis that among those who denied history of sex work, 92% of these women were married and they had no exposure whatsoever in terms of sexual exposure to other partners, which actually became so famous. It was published in JAMA, which was a very high impact factor journal then. This was used by UNAIDS to do advocacy in Southeast Asia region towards undertaking research efforts to develop women-centric prevention methods per se. And at that time, one thing which I learned was most of the people who used to get HIV, they used to be called as sinners. And therefore, nobody was interested in doing anything for them. Then I realized that when it comes to talking about married monogamous women, there was a sea of change. People became sympathetic. They said, "Arey, these ladies are getting infection without their own implication in the risk behaviors." So that reduced the level of stigma. So I learned for the first time that if you focus on women, things can be different. You can influence policymakers. And then I learned that if it is pregnant women and their babies, perhaps that would be the best thing to happen. We can develop a good program because we don't think it that way. This was the paper then, which was published in JAMA. I won't go over that. Next thing which we did the first study globally where we tried to establish that counseling actually helps. Now, you might say, oh, it is so easy, intuitively so simple. No, but the reality is the study design for the same has to be very different because ethically, you cannot give no counseling to one of the groups per se when you do such kind of studies. This became one of the best practices paper in UNAIDS in that particular year. You will perhaps learn that we use syndromic approach for management of sexually transmitted diseases. Now, one of the things was people used to resist. And then we did a beautiful study where we found that generally among these people, you tend to get more than one STDs. They have different incubation period and therefore they can manifest at different times, and therefore you have to use syndromic approach. And this was a paper which was used in India to push syndromic management of STIs in the entire country. Now, circumcision was another our landmark contribution. In circumcision, we found that most often people used to say those who are uncircumcised, those who are circumcised, the risk of acquisition of HIV is very low. When we analyzed our huge database, we realized it may not be true. For the first time globally, we came out with one finding that the risk of acquiring HIV may be low, but it doesn't reduce the risk of acquiring different STDs, whether it is syphilis or chancroid, and this balances the risk of acquisition of HIV because it tends to enhance the risk dramatically in presence of STDs per se. And that led to a revolution worldwide. If you actually look at the literature, you will find then there were people who started thinking about circumcision community-based trials among adults. All kinds of studies followed this particular. It's a small letter that we had published in Lancet. The PMTCT was another prevention of mother-to-child transmission program. No, when I passed out MPH, I decided that I would like to do something different. And by then, as I said, I had learned that if you focus more on pregnant women and children, but their unborn children, perhaps you will get all kinds of support. So I came back to India. I wrote a protocol, clinical trial protocol using ritonavir, which subsequently turned out to be a rotten drug. But those days, this was a new drug that was available then. Now, when I went for funding, everybody refused. They said, we don't want to fund a clinical trial. No. This is a story of 1997, 1998. Then UNICEF said, we don't fund clinical trial, but if you do a demonstration project and if you use earlier findings, we would be willing to fund. And that's how I went with that concept that I can develop a protocol for UNICEF. But what was the best thing? There was a meeting for development of guidelines against opportunistic infections at national level. Now, when we were actually having lunch, the Director General then of NACO, Mr. JVR Prasad Rao, now he came and he said, while eating, he just was talking to me and said, I have come from Bangkok yesterday. The CDC has developed a new, they released certain findings. फिर ये निकालूं क्या दोनों रखूं ठीक हाँ 10 मिनट्स कोई चिंता नहीं अभी फास्ट जाएगा so he said can we do zidovudine based study now should I invite CDC and then I asked him a question why should you invite CDC we have sufficient expertise can we not do it by ourselves and that's how the first protocol was developed by me and then subsequently the first investment, national investment in AIDS programming came for this zidovudine based approach which was called as Bangkok regimen where 11 crore rupees was put in. Earlier, we were only using World Bank funds. Later I developed a protocol using nevirapine and then one thing happened that we decided to roll down this as a national program in 2002 which was done very successfully. One day, I was in NACO and then Mrs. Sushma Swaraj was then the health minister. She had lost election in Bellary. So she told, she had lost it against Sonia Gandhi. So she told that I want the best of healthcare to be provided in Bellary. So one such letter had also come to NACO and the additional DG there, he saw me walking out of a meeting. He said, अरे अच्छा हो गया ये आप देखो ना इसका कुछ तो अच्छा बनाना है. Then I laid down one condition, I'll write the best thing, but you should not remove anything out of it. And there I put in free antiretroviral therapy program for Bellary. No, he said, this will never be approved. I said, if she wants the best of the program, she will approve. And we use this particular precedence to try and develop free ART programming. And that's how free ART programming became a norm nationally after 2004. Free ART was the first such intervention for any chronic disease which required lifelong treatment. We had never done that in any national program so far. The lesson that we learn is never give up, search for solution. Every challenge can be overcome, spot the opportunity. Later, I advocated for the expansion of the program in different ways, including those for monitoring. I also believe that if we want lifelong adherence, it's one of the most difficult things to do. Just imagine sex workers or poor people who get infected by HIV and nobody is going to stick to taking treatment on time every day for life. So one of the things which I realized was it can only be done if we improve treatment literacy. And that's how I started speaking about HIV prevention as well as treatment, side effects that occur with the treatment, with all kinds of population in simple languages to them, to a tune that the associations used to take the videos and show it across in their networks across, because that was the best way that we could scale up on the knowledge per se. And it was easy for me to do, because I do not remember how many patients I must have had managed, but it is in 30,000-40,000 patients must have had been my patients. And majority of those HIV infected people who were prominent leaders were also my patients. And the result was that community acceptance was very high. I take a pride in one thing in HIV, that treatment literacy among PLHs, people living with HIV infection, is far higher compared to the literacy about any of the chronic diseases that one tends to have from a mainstream literate population per se. You require quality counselors for them. So one of the things which we did was we wrote a book, question answer, in a question answer format on the horizon of adulthood, which was printed by UNICEF. 5 lakh copies were distributed across in 3 different languages, and this book used to be treated as one of the textbooks that every counselor should read and understand about HIV better. I became director in charge at NARI in 2015, so we are coming close to ending, I suppose. Don't worry. I changed the atmosphere. One of the first things which we must remember is we should provide freedom to our juniors. No? Most often, all the papers that you read, either the boss is the first author or the last author. I changed that thing because I know only one thing, that even my stature can increase if the juniors work really well and earn their name. And that was what I essentially followed. And one of the big dreams that I had, NARI became the third globally approved global laboratory for pre-qualification by WHO, where we could say, if we test a particular kit and if we approve at our end, globally people will purchase it without doubting its quality. And I expanded that mandate that I had for HIV DR drug resistance testing to Nepal, Sri Lanka, and Myanmar during my tenure. Now we'll skip this part. Sometimes even I wonder, how was this entire journey possible? It all depends on advocacy skills. This is what I infer as of now. Now, what are my learnings? Whenever you want to question, always start with a positive note and then spend time on discussing evidences for a revised strategy that you want them to adopt. Always compliment the program whenever you do, that this is the most successful program. And why is it successful? Because policymakers are progressive, flexible, and believe in evidence-based strategies. So they they cannot deviate from the evidence base per se. Never criticize in public. Always do it in small rooms when you want to even discuss something strongly, but discuss evidences respectfully in every forum. While requesting for introduction of costly interventions, you must understand, for HIV, it was huge money that we had to spend for ART purchase or even for monitoring through CD4s and viral load. How do you advocate for the same? Should look at the savings that you may have in terms of lives saved and the kind of treatment that they would require otherwise as a complication. Use media and community effectively, you will be best off. Then subsequently I was transferred to as head of epidemiology and communicable diseases in ICMR. Now my first challenge I joined in January, and in May, my first challenge came from Nipah, which had a case fatality rate of 89%. It occurred in Kerala, which was an unusual state. And then I fought. It lasted only for 2 weeks. And within those 2 weeks, we did dramatic research work. And what was most important was we became global leaders in Nipah within a short period of time. We had developed an adaptive trial design to be against Nipah using different kinds of, like you heard about COVID, we were the leaders. We were the principal investigators for entire Southeast Asia region. And what was most important, when it occurred again in 2019 summer, we could stop Nipah. Only one case occurred there, and the child, not the child, he was an engineering student who survived because of our own efforts. What was more important for Atmanirbhar Bharat? No, I take a lot of pride in that we develop a point of care test for Nipah. It's a molecular test which is approved by our Drug Controller General of India and not the reverse way. We tend to have approvals by US FDA or EC and then take up those tests here. But this is a different kind of thing that we could do. This was something which we had never done in the past. Even DCGI was handling such a case for the first time. And we also developed a similar test for leptospira, which perhaps you will see soon enough. We provided the first evidence then in 2018 that Zika was a well-established infection in India that was in Jaipur and in Madhya Pradesh at that juncture when Zika outbreak occurred strongly. We initiated multiple studies, but Zika outbreak died down and therefore they could not be completed. Nipah, the reason why I'm showing this, somebody had asked me to speak on bioterrorism also. Nipah introduced a fear that there could be bioterrorism. The reason was in Kerala, in that part of Kozhikode, you had Simi or some such organization which is banned. And there was a fear because one of the soldiers was suspected to have Nipah who had died. The result was this care had to be handled productively. So what we did was we trained our staff in biosecurity in Bangladesh, where Australian people did that. I had, in one of the efforts was in TB, you must have heard that there are certain tests which come from multinational company. No, but we had developed our own indigenous test by an Indian company. And when the government asked me to ensure that this would be supported by WHO and Global Fund, I was sent to Geneva, but I failed. I could not convince them. That was a shocking thing that I learned there. And then I came back. While in the flight, I decided I must fight against it. Why should I have approvals that have to come from agencies outside for selling good tests in other markets per se? So I established a 10-country network which were from Timor-Leste to Maldives, excepting Pakistan and China. All the countries were part of it. We had 2 different meetings, and the idea was very simple, that if I develop a research platform and everybody undertakes, let's say, validation of these tests or any intervention which are indigenous, they will actually be able to buy because their own drug controllers would have had allowed it. And what was most important, almost 1/3 of the population stays in these 10 countries. So I should not worry in terms of my market if it's a Indian this thing. Then perhaps I couldn't progress ahead because COVID came. This was a story of January 1st in 2020. My Padma Shri was declared on 25th of January. Suddenly in the afternoon, I got a phone call from Ministry of Home Affairs and they informed me. I was actually going to buy a trolley, because I wanted to go back to Pune. No, but then I didn't know anything. No, but this was only possible. No, it is a matter of principle for me. I have never applied for any award in my life because I think we project ourselves. You will be reminded of the first slide. You tend to project in such a manner, you become almost narcissist. No, what is important was this was a nomination that came from all the associations of people living with HIV infection, sex workers, men having sex with men, and Hizada population. They said, if you don't get it, that would be the biggest insult of us as a community. You deserve it. The Nipah and Zika work got me support from Ministry of Health as well because they did not. They said he should also get it at that juncture. One reason why I'm mentioning this is people tend to feel that my Padma Shri was because of COVID. It has nothing to do with COVID. No, on that day of 25th January when they declared on the TV and informed me as well. No, the truth is, I was trying to find out what happened to the 4 samples which we had collected in Jaipur, and health secretary was all the time pushing me. अच्छा जल्दी बोलना है, अब क्या करूं, मैं आपको ज़्यादा कुछ नहीं बोल सकती, आज तो आपको पद्मश्री डिक्लेयर हुआ है, लेकिन वो ज़रा कर देना ना, ये रात को 11 बजे तक. It was a bad time at that juncture. We managed to do lot of things in COVID. Most of them are truly, if you ask me, are not known outside. We expanded the testing labs. All of you know from one lab, you had more than 2,500 labs now. And that was done virtually because there was a lockdown. We had to train them virtually, do quality assessment as well. We started National Task Force, expert groups on operations research, diagnostic research, and clinical research. Launched multiple studies in different aspects, including plasma therapy, and national serosurveys were done during lockdown, which was not so easy. And take initiatives in development of diagnostic ELISA, co-vaccine, and Covishield also. Now, this was all done before I retired. And what was the most challenging task? The challenging task that I used to face when people say I used to be seen every day on TV, no, the challenging task was to educate the community. Please remember that even for AIDS today, while the program is almost now more than 4 decades old, no, almost 4 decades old now, if you actually look at it, the proportion of people who are aware of even preventive routes and practice them continues to be low. We take decades to change people, ensure that they adopt preventive practices. And the fear was COVID is not going to give you such an opportunity because it's a very rapidly spreading kind of a virus. The challenge was there are no theoretical models on how to communicate during public health emergencies. Ours is a democratic country. If today also, if somebody now tells you whether I should stop speaking, there will be half the people who will say yes, other half will say don't. No? That's the way our democracy is. The fear was, when I was asked to handle the press, I was not used to it. When I went there, one of the things that I had in my mind, if I fail once, if I use one wrong word, everybody in the country used to be looking at you. If you do that, all the gains that you had made earlier would be wiped out and people will come out on the street. Now that I had to avoid. So what did I decide? Adopt transparency. This was important because none of us knew about COVID so much. We were also learning, and it takes guts on TV to say to somebody that we don't understand, I don't understand what will happen, because we are not used to saying something like this. and truthful responses in simple languages. My retirement, to be honest, was the most celebrated event for a government servant. No? Otherwise, I was a public servant. Within an hour of my retirement, the news flew like a wildfire when it became viral, and over 2,000 Twitters, Twitter messages went to PMO's office to not to let him go. The reality was, I was told that you should continue for next 3 years, but I had my own personal reasons that I wanted to come back. And that led to one thing, that I could meet Modi when I was awarded Padma Shri. He himself came. I had never met him in any formal meeting, though I had met all other ministers. Yeah, I used to interact with them. But the reality was, he just came and said, there are 110 people who receive some Padma award or the other. He came and said, so you have retired. Now you must be itching to work more. Now, for a person who came from such a background, where I never saw myself that I would be one person whom Modi, whom I respect a lot, would ever know me, and he would also know that I have retired and offer that you could work with me. That was my biggest moment. If I was to briefly summarize, last slide, sorry. नहीं समरी नहीं किया तो वो तो गया ना, वो गाइड ही नहीं है फिर. One can win hurdles race with passion and dedication and hard work. Never expect that people will facilitate your success because you deserve it. Every effort to stop you should make your intentions reach the goal stronger. Your race ideally should be with yourself, your past, and not with people around you. Because if you become jealous of somebody else's achievements, you are going to lose your time, you are going to lose in terms of efforts. Compete with yourself. Try to better yourself further. Never try to strive for recognition. Recognition follows out of sincere efforts. Be human, treat everyone equal. This is a great, if you do that, world is one of the best places to live. And what is most important about research? If you do only practice, you tend to treat one patient at a time. If you do research, you try to give a policy change, and then you are indirectly treating hundreds of thousands of people. You could just imagine the numbers, because that it depends on disease burden. What is most important to remember? Even if you would be the best practitioner, if you become a researcher, you will find in the history books of medical journals, your name will continuously be remaining there. No, but for a practicing physician, maybe for 10 years people will talk about him. After that, you are no more. I wish you the greatest success that you can have. Combine both practice as well as research. You will make a difference. And one of the talks I am told is from Dr. Bhaviskar. You will not find a better example of how research can be done while practicing. Thanks a lot, and I am apologizing for delay. Sorry,
Thank you, sir. Those were some inspiring words. Sir has worked closely with the people at the grassroots level, like sex workers and HIV affected patients. Shattering the taboo surrounding such group of people, he talked about stigmatized topics like sexuality, which requires education among the masses. Thank you, sir, for sharing your experiences with us. Those were invaluable.
Now, we would like to show our gratitude to Dr. Raman Ganga Khedkar sir by presenting sir with a token of appreciation. I kindly request Dr. Prasad sir, Professor and Head of Department of Medicine, to present Dr. Raman Ganga Khedkar sir with a token of appreciation.
I think sir is the biggest teacher for all of us. So I want the students to stand up and give him a standing ovation.
Dr. Navjeet Singh sir as our next guest for the session.
Dr. Navjeet Singh sir is the Head of Medical Affairs, Biomedics, South Asia. He is an alumnus of UCMS, New Delhi, with more than 20 years of experience in the field of medical affairs. He has made history in the hospital and healthcare industry by having worked with the country's most esteemed healthcare institutes throughout his career in the field of emergency medicine.
He was earlier heading medical services and handling anti-infective portfolio at Ranbaxy Lab for ASPAC region, having 32 brands of antimicrobials in different segments. Now I would like to invite Dr. Navjeet Singh sir on the stage to brief us about this topic, antimicrobial resistance.
Yes.
Just from the pen drive now. Yeah, I'll come here. Is it on? Pardon? No, it's okay. First, let it start. Sorry. Good afternoon, everybody, and it's a really pleasure to see such a big crowd of students, faculty, honorable, distinguished members of VM Medical College and HODs. First of all, thank you so much for inviting me today, and I'm very pleased, and there is a sense of deja vu of seeing students managing the whole show. Yeah, I also used to do the same in my time, and I wish you all the luck. Yes, I'm really pleased, but I hope I can meet the challenge to catch my flight from Pune at 9 p.m. So I'll try my best. As far as the session goes, I will take the allotted time of 30 minutes to me, and I want your complete attention because the topic which we have chosen, that's antimicrobial resistance or AMR, is not only a regional threat, not only a national threat, but it's a global threat. And that is something which we need to intervene not when we become doctors, but we need to understand while we are becoming doctors that how important it is to learn at this stage so that we can do the right steps to either tackle AMR or reduce AMR for the future generations. So I would be talking about the challenges and diagnostic solutions which are pertaining to AMR. So I would be covering some topics in my presentation, starting from what are the challenges, how COVID-19 has changed AMR, what is antimicrobial stewardship, and role of diagnostics in it. And I will also share with you some real-time case studies and take-home points from various hospitals. So let me start with the challenges. And it was a pleasure to listen to the earlier talk, which was very insightful, a lot of experience. But yes, the experience is saying that by year 2030, most of the antibiotics, which are high-end antibiotics, will become extinct, like the dinosaurs. And this is the way antibiotics are being prescribed, used, or if I say misused, that this is going to definitely happen. Dr. Rama was talking about Time magazine, but I also want to share something about Time magazine. So people say time cannot go wrong, but time can also go wrong. That means Time magazine here. In 1966, Time magazine was saying that nearly all of the bacterial and viral diseases would be wiped out from the globe by year 2000 AD. But the same Time magazine in 2017 is asking us how to keep the world safe from superbugs. So you can very well understand what kind of issue AMR is. Presently, as far as the data is available, I can tell you this data is only from Western countries or developed nations, not from developing nations or so on and so forth. It says that something like 700,000 or 7 lakh people die because of AMR related consequences, and this is one death every 45 seconds. But a report which came up in 2015 by Sir Jim O'Neill, who was basically a finance minister in James Cameron government, he published a report on AMR which says that by year 2050, would be estimated 10 million deaths because of AMR. And 10 million, which means a crore deaths. So that is how it will progress. And believe you me, this data is not taken from underdeveloped countries or African countries or countries even in Southeast Asia. So how does AMR impacts us? So I believe many of you must have known about antibiotic resistant organisms like MRSA and MSSA. MSSA means methicillin sensitive Staph aureus. MRSA means when it becomes resistant, so it is methicillin resistant Staph aureus. So whether it is the cost to treat a patient or the mortality rate just doubles if MSSA changes to MRSA. And we take the gold medal in consuming antibiotics all over the world. India, it was followed in various countries for 15 years from 2000 to 2015, and it was found that we consume the highest amount of antibiotics in the world. You very well know, we even advise antibiotics to family members, to friends. अरे गला खराब हो गया तो azithromycin ले लीजिए, क्या बड़ी बात है. Sometimes, though we all are doctors, people advise us also. I remember sitting in a flight and somebody advising me, आप ciprofloxacin ले लीजिए. So, people know antibiotics and we get antibiotics so easily. We all should have some money and we can get antibiotics, sometimes even free of cost from the hospital pharmacy. But see where we are. We are consuming antibiotics even more than China, even more than Russia, which are again big countries. And that's the reason India has the highest antibiotic resistant rates. Not only that, India has the highest rates of superbugs. That means resistant organisms all over the globe. So we lead. And earlier there was no data from India coming up, but there is an organization named CDDEP, Center for Disease Dynamics and Economics, which publishes data from LMIC, that is low and middle income countries, and just see antibiotics and resistance levels as compared to other countries where India stands. We are having resistance for carbapenems also, which are very high-end antibiotics. And this is for E. coli. Similarly, for Klebsiella, we are the gold medals again. Even polymyxins have started showing resistances in India. Pseudomonas, just see, we touch 70% or more for most of the antibiotics which are available. Don't believe Australia doesn't has any because the data was not there. Then Acinetobacter. These are all killer bugs, and just see where we stand as compared to other countries. So that was the issue of AMR, which was already there, but then COVID happened. And believe you me, just see the levels of prescriptions of drugs like doxycycline, hydroxychloroquine, or ferropenem shooting, the prescriptions just shooting during COVID times, because as Dr. Rama was saying, nobody was aware what to do. Everybody was trying everything, and antibiotics is the most easy way to try it in all patients. So just see what levels. Definitely, you can see HCQ came down after reports saying that it doesn't works much, but others still, went up. So, a very important study, I would say, published in July 2021 said that there has been substantial overuse of antibiotics during COVID-19, and India will greatly need to increase COVID-19 testing and reduce empirical therapy. Empirical therapy, which we all know, is just giving antibiotics without doing any investigations or knowing which is the right one to give, or just start like that. So, antimicrobial stewardship interventions is very critical now for India if we want to overcome this crisis. So we have bad news all around, because of misuse and overuse of antibiotics in hospitals. But have we ever thought why we misuse or overuse antibiotics? Have you ever thought the reasons about that? So we give indiscriminate antibiotic prescriptions. We many a times land up selecting the wrong antibiotic. Either we start antibiotics too early or too late, or we give it for prolonged duration. Even if it is said that we need to give it for 5 days, we land up giving it for 10 days also. We use or inappropriate use of broad spectrum antibiotics when we can select narrow spectrum antibiotics. Sometimes we change the antibiotics too fast. We use parenteral antibiotics even when oral effective antibiotics are available. And moreover, we don't consider appropriate diagnostics while prescribing antibiotics. Have you ever seen how many people or how many HODs, first saying, okay, let us do this test and then start an antibiotic and see whether we have started the right antibiotic or not. So this was bad news, but there is good news. Good news is that in some hospitals in UK, what they did, they restricted use of fluoroquinolones for some years. So during that duration, you can see they had less incidence of fluoroquinolone resistant Pseudomonas aeruginosa, or the incidence decreased. So that means if we can restrict use of antibiotics, we can decrease resistance. And that is obviously needs a lot of effort. So what kind of effort is required? That effort is known by the term antimicrobial stewardship. That means we are stewards. Steward is the word by English dictionary, means that you need somebody to protect something. So we are there to protect the available antibiotics. Otherwise, we may land up what I showed you in the first slide, in extinction area of antibiotics. And how role of diagnostics is important. So let us first try and understand antimicrobial stewardship. So as this cartoons say that, if a lady is asking what can you give to a man who has everything, the answer is antibiotics. That you can give it to anybody. And fever is not a sign of ceftriaxone deficiency, but we believe, if somebody has fever, somebody should be given antibiotic because that may be deficiency of antibiotics. So that is also not the case. So what does AMS means, or antimicrobial stewardship means? That you should give the right antibiotic for the right indication, for the right dose and route, for the right duration, so that you can save those antibiotics for future generations. It sounds so simple, but it's not as simple as that, because even the first step of choosing the right antibiotic is sometimes challenging. Which antibiotic will work in this patient? So how do we know that? So this gentleman is Sir Jim O'Neill, whom I told you was a minister in UK government. He was not at all a medico guy. So he came up with a 20-point agenda to tackle AMR. And, we were fortunate enough to host him in our headquarters in France, Lyon. So he was asked, which is the out of that 20, which is the most important thing you will say we need to do? So he said, when I am asked the most important intervention that would make a huge difference, it would be using diagnostics to prescribe the right kind of antibiotics or even to stop antibiotics. So when we talk about diagnostics and AMR and infections, I think we cannot forget blood cultures. I believe many of you would be second prof students or even final prof students or even PGs. Yeah, you must have heard about blood cultures or even must have drawn blood cultures yourself in OPD postings or ward postings. So we talk so high about blood cultures, but here you can see a data of nearly 1,50,000 samples. Only 5% of these sepsis patients had confirmed blood cultures. So are blood cultures so non-worthy that only 5% come positive? Yeah, many of times we have seen reports like blood culture negative even if the patient has infection. So why does it happens? It happens because obviously first is absence of bacteremia, there may be no bacteremia, intermittent bacteremia, prior administration or presence of antibiotics, non-cultivable organisms, fastidious organisms, but most importantly poor use of blood cultures. Because sometimes we don't write blood cultures at all. Even if we write blood cultures, we don't know how much blood to be put in each bottle. So I have asked this question sometimes, how much blood to be put in each bottle. I have got answers like 0.5 ml to 50 ml also. So you can understand the level of understanding about how much blood to be put in each bottle. We sometimes believe we don't have anaerobic infections, so we use only aerobic bottles. But that is not the case. And we don't use enough sets. Enough sets means, one set means 2 bottles. So if there is somebody from cardiology, they may agree with me that for conditions like infective endocarditis, you have to send 3 sets, which means 6 bottles. And what usually we see that there will be 1 bottle which will be sent with some quantity of blood and the lab is asked to find the bug. That is challenging. So what usually manual blood cultures are done, you take a bottle, you see every 24 hours, if there is a growth you subculture, but keep on seeing it every 24 hours for 7 days, and if there is no growth, you write no growth seen. So it's an extremely time taking process with a very high risk of contamination. So there are a lot of drawbacks of manual blood culture if you are doing. But for me as a clinician, if you ask me, the most important drawback is no antimicrobial neutralization. That means if somebody has taken a course of antibiotic, blood culture will not grow something if it is done like manually. Man has evolved, so has the microbes. So we have to fight with bugs, right? That is important. So nowadays, why I'm showing this picture is because this is from bioMérieux, but there are many other blood culture and all are great. So rather than manual, there are automated blood culture equipments which are available. And how do they help us? They do continuous monitoring. If you put a bottle inside that machine with blood sample, so reading is not taken every 24 hours, reading is taken every 10 minutes. It's a ready to use media. It is an inbuilt incubator and agitator, which means it increases the chances of growth, and the bottles have media for antibiotic neutralization, which again means if somebody has already taken a course of antibiotic, you can still expect a growth. Why? Because it has media which neutralizes antibiotics. So let's inculcate culture of doing cultures. So let's do prescribe cultures in particularly bloodstream infections, or we suspect bloodstream infections. Then after blood cultures, if there is a growth, we need to find out which bug it is and which antibiotic will work. So something known as AST, I believe, have you ever heard about AST? Anybody? Okay, no problem. So AST means antibiotic susceptibility testing, which tells which antibiotic has more probability of working in that particular patient. So it is reported like S, I and R, sensitive, intermediate or resistant in front of antibiotic. So that is the usual way of reporting, but doesn't works when you have multi-drug resistance organism or immunocompromised or critically ill patients or challenging pathogens like Pseudomonas, Acinetobacter, Stenotrophomonas. So I will share a very interesting case, and this case is from your nearby Mumbai only. So there is a 24-year-old patient with abscess and cellulitis, which means skin and soft tissue infection. He was given clindamycin and penicillin, and on doing gram staining, I believe some people must be knowing what is gram staining. On doing gram staining, there are, you can say, gram-positive cocci in clusters resembling staph. So do you think the person has been given the right antibiotic? I think so, because it looks like staph and clindamycin and penicillin will work against staph. So let us see the manual AST report. So more number of pluses means better is the antibiotic. So you can see here penicillin is 3 plus, looks okay, and clindamycin is 2 plus, looks okay. But there is an inherent fallacy. The fallacy is here. If you do by manual method, so if the zone of inhibition is less than or equal to 28, penicillin is resistant. But if it is more than or equal to 29, penicillin is sensitive. So will I treat my sepsis patients or critical patients by this method? Obviously not, because an error of 1 millimeter can make penicillin sensitive to resistance and vice versa. So the gold standard to do an antibiotic susceptibility testing is MIC, that is minimum inhibitory concentration. I'm sure you must have read it in microbiology also. You must have read it in pharmacology also. KDT to padhte hi hoge. So I don't know whether it is in vogue nowadays or not, but it's very easily explained in these books. So MIC means minimum inhibitory concentration, where there is a doubling dilution of antibiotic in series of test tube, and you add equal quantity of microbial solution in all of them. So the first test tube which shows inhibition, like here, 1.6 is the answer. That's the MIC. So it is said that lower the MIC, better is the antibiotic. So if we treat or choose an antibiotic based on MIC, we may have a better decision making. So why MIC is a gold standard for all critical infections? I will not name them. These are all infections where anybody, or when you are thinking of starting an antibiotic, please base your treatment on MIC reporting. And you can see all critical infections are written here. But there is something known as breakpoints also, which you have to keep in mind while prescribing antibiotics, and breakpoints have to be correlated with MICs. So what are breakpoints? Breakpoints are basically dynamic values which change every year, and it takes care of serum achievable levels, resistance mechanism, and successful therapeutic outcomes. So because it takes all into vogue, so that is the reason they are important while prescribing antibiotics, and that is the reason they change every year. And this is done by scientific communities. But what we need to know about breakpoints is that when you get a report of MIC for any patient, it should be less than the MIC breakpoint for that drug. Only then there is higher probable chance of that antibiotic working. So I will try to explain it a very hypothetical, simple example. So suppose there are 4 antibiotics, A, B, C, and D, with 4 MIC levels. So which one you would like to choose? If you ask me, I will like to choose D because it is the lowest MIC. So I believe that D will work the best in this patient because this antibiotic has the lowest MIC. But till now, I have not correlated with breakpoints. So when I correlated with breakpoints, you can see the breakpoint of D is less than the MIC which we have got from the patient. So it will be resistant. But on the other hand, antibiotic A, which I was not considering at all, it is much less than the MIC breakpoint. So it will be sensitive. So this is how MIC and correlating it with breakpoint can help you choose a better drug for a patient. But for that, you should have a report which is based on MIC. So do we have something which gives us MIC values in a patient? Yes. So this is another automated equipment named Vitec 2, where the report when you get is antibiotics and their MICs written, and which further you can interpret that whether they are sensitive, intermediate, or resistant. So this is a fully automated system. It has more than 300 organism database in it. You get the result in hours versus days, and the AST report is given along with MIC. And also there is an advanced expert system which can tell you resistance mechanisms also, like ESBLs or something within the report. And it gives me pleasure, which I got to know from my colleagues, that your hospital already has this equipment. Am I right? Okay, great. So that if you have time, please go to your lab, and thanks to Dr. Sujata, having it there in the lab, so you can contact her, see this instrument, how it works, and it would be really helpful. So now I will come to share a real case with you. Have you heard about this organism in your hospital? Elizabeth Kingia meningosepticum. Yes, it looks like, name looks like it is not in India, it must be in UK. Elizabeth, Elizabeth Kingia meningosepticum. It cannot be in India. Why I am talking about this organism? Because if somebody finds this organism, one should be really worried, because no antibiotics work against this organism. And why I am sharing this? Because in India we thought it is not there, So this is a report, Vitek report from Medanta Hospital in Delhi, near Delhi, that is Gurgaon or Gurgaon, if you know. So this is a Vitek report. You can see how the report comes. So Vitek gives you which organism it is, Elizabeth Kingia, and it also tells you what is the MIC of various antibiotics in that Vitek card. So you can see very well here, either it is R or I. So most of the antibiotics are resistant except 3. Those 3 antibiotics are ciprofloxacin, tigecycline, and cotrimoxazole. And the doctor called me and he said, first of all, we never thought that we will have this organism in our hospital. Second, we never thought that even ciprofloxacin can work in this organism. So they started, based on this report, they started with cotrimoxazole, and the patient improved rapidly. So they published this in 2011. So this is something like 11 years back. And I'm sure it is there in all parts of India. And if you have Vitek and if you are doing reports on Vitek, you will also find it in your city or in your hospital. So I can tell you with an example. I was giving a similar talk in Varanasi in 2014, if I remember. And the hospital didn't have a Vitek. So I was showing them. So they were kind of amused. They said, Dr. Sahab, hamare yahan nahi hota ye sab. We never get. So that hospital bought Vitek after 6 months. And I used to go to the same hospital after an year. By that time, they had isolated 5 Elizabeth Kingia meningosepticums. So this is very much around. So I can also tell you, these are the new Vitek cards which are now available. I would not go into the details. So there are various antibiotics for gram-negatives, fermenters, gram-negative, non-fermenters. But interestingly, there is a new card on critical care card which has most of the antibiotics which are used in ICU. So that is a very useful card. So concluding on MIC, MIC is a measure to susceptibility of a pathogen to a possible antimicrobial therapy in vitro. So the aim of susceptibility testing and MIC measurement is to predict the likely treatment of success, and how it helps the clinician. You can select the most appropriate antibiotic, customize antimicrobial dosing, and helps to define and optimize antimicrobial dosing regimen. So these all advantages you can do if you are treating your patients based on MIC. And my last section is real-time case studies and some take-home points. So anybody from pediatrics here? No, I know, but maybe somebody here? No, no problem. So good, I am feeling very satisfied that I am discussing AMR to an audience who will have the maximum responsibility of saving the drugs in future. So this is a 2-year-old, just 2-year-old female child with a history of fever for 1 month. Fever is moderate to high grade and there is no other history. No rash, no pain abdomen, no loose stools, no cough, no dysuria or ear discharge. Only history is poor weight gain, and the child is having high grade fever along with decrease in oral intake. I'm sure in 3rd year postings you will find that kind of a patient in periodics. So, interestingly, patient is having fever and poor weight gain for 1 month, and there is no other history. And even if you see this, more or less is okay, except there is some hepatosplenomegaly with anemia. So, you know how we admit patients like PUO, pyrexia unknown origin. So, was given ceftriaxone, artesunate, pantoprazole, crocin, Maxtra. We start giving everything to the patient, and this is just a 2-year-old child, right? So, we are giving ceftriaxone again, right? Then more investigations were done. Again, malaria is not there, typhoid is not there, blood culture they had not sent, but they sent on third day, and only provisional diagnosis which they make was enteric hepatitis malaria because some liver enzymes were raised. So that is the diagnosis which they are making. But when they did it on Vitek, they found brucella, and nobody was thinking about brucella at that point of time. So they stopped everything and started Septran and Rifampicin, and the patient started improving and was discharged in stable condition. So what does it mean? What they said, we were not thinking about brucella because it is a hospital in a very prime affluent society. They thought, who come on, where brucella? Then they took the history that the kid had gone to grandparents who live in countryside and had a close contact, and then that fever and poor weight gain for 1 month. Nobody was able to diagnose. So they said we would have also not, if we had not taken blood cultures and further used Vitek for the identification. So this is the second case. Again, a case of a baby born after prolonged rupture of membranes, which means she had signs of early onset of sepsis. CRP is raised and was started cefuroxime. But this is a case from Apollo Hospital, Chennai. What they do, whenever they draw blood cultures, they do 2 sets, 2 aerobic bottles, 2 anaerobic bottles, always. So when they had put it on Bactilert, the anaerobic bottle flagged positive first rather than aerobic bottle, and they identified Bacteroid fragilis on Vitek. So instead of, when baby was started on cefuroxime, but then they added piptazo for anaerobic coverage, and then the CRP or the C-reactive protein started falling, and the baby was discharged. Though they could find bacteroids after 3 days also, but the time was saved because they had automated blood culture and Vitek, which could help them identify bacteroids much faster and start treatments much better. So, coming to the concluding slides, that how diagnostic tests can help fight AMR, they can definitely help you because you can identify the organism, you can adjust and optimize treatment, and you can also monitor the patient response. Because if you have chosen the right antibiotic, you can continue, but if you have not, you can change and give the right antibiotic at the right time and do antimicrobial stewardship. So, what are the take-home points for us? Antibiotic resistance is very high in India, and let's agree, more than 50 to 80% of all gram-negative bacteria are resistant. Diagnostics are key for tackling the menace of AMR. Automated blood culture and identification methods significantly reduce the time and decision making for early antibiotic therapy. MIC is the most accurate method for prediction of clinical outcome of antibiotic therapy. MIC and breakpoint correlation are critical components of antimicrobial stewardship. So please correlate the MIC levels with breakpoints. And evolution of bacterial resistance and development of new automation makes a close working relationship between microbiologists and clinicians. So I would request you to be in touch with your lab, with your microbiologist while making decisions to start antibiotics or even to stop. So I started with a slide that by 2030, we may land in pre-penicillin era. But I am showing you a report of Vitek from Safdarjung Hospital, Delhi. And this report is printed on March 13, 2009, which is showing Pseudomonas aeruginosa, and there is not even a single antibiotic which is sensitive. All are resistant. So we are already there. We were thinking that we will land in 2030, but we are already in pre-penicillin era, and there are organisms which don't know antibiotic is working against them. So what is future for us? In 2000 BC, we were asked to eat the root. In 1000 AD, the root is heathen, we were asked to say the prayer. In 1850 AD, the prayer is superstition, drink the potion. In 1920, the potion is snake oil, so swallow the pill. Thank God in 1945, the pill is ineffective and we had penicillin. But believe you me, within 10 years, even penicillin was resistant. But we had tetracycline. And similarly, we had more antibiotics coming up till 1919. But I'm sure by 2030, if we don't change our habits, our learnings about AMR, the bugs will win and we will again have to eat the root like 2000 BC. Thank you so much and keep doing antimicrobial stewardship. I honestly know there is not much time left for taking questions, but if anybody has a burning question, you are always welcome to contact us. My colleagues are here, Abhijit and my gentleman sitting here. You know, you can contact us for any help, any advances in antimicrobial resistant managing or antimicrobial stewardship, or even the newer solutions which are coming up, because at Biomerio we have solutions for all categories. We have procalcitonins, we have equipments for syndromic approach, we have blood cultures, we have IDASTs, and so on and so forth. So it is again a pleasure to see such a great audience, and keep up the good work. And please remember that you have the maximum responsibility of tackling AMR. Otherwise, we will leave nothing for our kids, and even a scratch can become deadly. Please remember that. Thank you so much.
Thank you, sir, for sharing your informative insights. Antimicrobial resistance is a rising phenomena being witnessed all across the globe, but especially in India, it has a very high rate. It is essential for all the medicos to be alert about it. Thank you, sir, once again for guiding us on this important topic.
Now, I kindly request Dr. Dantkale ma'am to please come on stage and present Dr. Navjeet Singh sir with a token of appreciation. Moving on, we welcome you to be a part of an engaging panel discussion. Good evening, everyone. Being in the medical field, most of us have an innate yearning to constantly acquire more and more consciousness about life and what drives it. There is a constant urge of not wanting to stop learning. So, what after MBBS?
Ever since the day we step into a medical college, we want to have our post MBBS plans sorted. But with an endless confusion surrounding the question, need PG or next? Which branch is more promising? College rankings and whatnot. The ever expanding competition that comes with entrances might even make one doubt about continuing on the same way, or to start looking for alternative options, or to start with the clinical practice right away.
The perplexity escalates with the consideration of moving abroad for further education. And at times, some of us even consider switching to a non medical path altogether. So, to put an end to this brain drain and uncertainty about what after MBBS, today we have a team of experts to guide us, to introduce us to an array of career options to choose from, and to help us make the best choice for ourselves. The theme for today's panel discussion is Why Did I Choose My Career? With that, let's welcome our panelists for today.
Dr. Amjad Sayyed sir, Dr. Shirish Kumtekar sir, Dr. Yuvraj Mani sir, and Dr. Pushpa Agarwal ma'am. I request all of them to come up on the dais. Dr. Amjad Sayyed sir has 20 years of experience in patient care, 4 years of experience in specialty of internal medicine anesthesia and chest and TB in patient care and teaching at Dr. VM Government Medical College and Hospital, Solapur, and many more achievements like this. He has published many papers and presented as well in national annual conferences.
Dr. Shirish Kumtekar sir is one of the most well-known oncologists in the city. Countless patients have placed immense trust in him and his practice over the last many years.
Dr. Yuvraj Mane sir is among the finest general physicians in the city and is widely known for offering excellent patient care.
Dr. Pushpa Agarwal ma'am, Head, Department of Anesthesiology, Dr. VMGMC Solapur, has been guiding students and helping them excel for many, many years now. So I would request all the panelists to start with the panel discussion, please. Thank you.
Thank you.
Well, good afternoon, all the organizers of Medalium. It is indeed very refreshing incidents, I must say, to meet young undergraduates, because I left my medical college, VM Medical College, way back in 1982 when I did my Master of Surgery, and then moved on to study further for cancer surgery. In those days, surgical oncology was not the term coined, and there was no super specialty degree as such. So I went ahead and worked in Tata Memorial in a residency program, and got myself finished up and decided to come back to Solapur. There was a Siddheshwar Cancer Hospital in those days. It is even now there. And I started out the surgical oncology department because by that time only radiation was available and the surgical department was not existing. So I had the opportunity to initiate that department over there. But very soon I found out that working with Trust Hospital or working with somebody else's hospital, it is better that I should have my own hospital. And in those days, I come from a middle class background. My father was a teacher. So funding was a big problem. Way back in 1986 and all that era, banks were not very keen to give you loans and all these things. So I decided to move out of the country. I went to Saudi Arabia. I worked in Riyadh Military Hospital for 3 years as a specialist consultant. My wife, who is a pathologist, she also came with me. My son, who is now an oncosurgeon, he was also with me. So for 3 years, I had a good opportunity to work with the international community and the best of the techniques and technology that was available at par with USA in those days. And then after 3 years, I decided to come back because whichever country you go, you are alive, you are treated as a foreigner. It is best to come back to your own country and best to come back to your own roots. So that's how I came back and then rented out a hospital and then had my own hospital in Solapur. It was a long journey to pay back the loan of 40 lakh rupees that I had taken in those days. Now, I'm sure Amjad must have gone into crores, but in those days, it used to happen in lakhs. But 40 lakh was a huge amount in 1996, back those days. But with sincere and good work and if your knowledge and practice is sound, you can surmount those difficulties. But these are not the days. Now, the era in which you are going to go are the days for super speciality, for good practice, and for joining corporate hospitals. Because medicine has no more remained a profession, it has become a professional business. Let us understand this. Now, you will be surprised to know that even after having acquired a good super specialty degree, you may not be chosen on quality alone. Quality is not the only criteria in our country to be chosen for a particular job. You must definitely have merit. You must have definitely chosen the right super specialty or the right branch. And then you must have the right ecosystem, political system around to get into that place and to adhere to that place. So, whole medicine has become corporatized now. Your generation will come into practice in next 5-10 years. And by that time, the entire scenario would have changed. The hospital that I built and I own now, or Amjad owns, is fortunate to have his own practice. So he's happy with that, and I'm very glad that he is one person who has stood the test of time. That doing family medicine is extremely possible, it's beneficial, and you can be successful in doing family medicine. There is DNB in family medicine available. Why you people don't opt out for that, I don't understand. But you should think about that. Why family practice or general practitioner should only be BAMS and BHMS? Why an MBBS man doesn't dare to go into family practice? The answer, when I tried to think about this, I found out that we people are running after getting postgraduate degrees and super specialties. But the problem is that your aptitude and your liking is not considered in whatever the tests that you undergo for selection. For example, there is a postgraduate selection test, PG set. But your choice is not considered, your marks are considered. What marks you get will decide your specialty. You want to become a surgeon and you get such marks that you end up getting into some medicine or some skin and video and that sort of thing. So that is one of the biggest fallacies in today's examination. What I personally feel is that the PG set should be taken into two streams. That is PG set for surgical streams and PG set for medical streams. And from that then people can be filtered out into whatever branch they like. And this demand should come from students' side. In our country, unfortunately, bureaucrats decide on how the examinations will be taken. And your marks decide where you will go or where you will end up. Your liking, your aptitude, a surgeon becomes a physician becomes a surgeon, and then the entire lifetime is lost and ruined because they had never had that aptitude to do that sort of job, because it requires 24/7 attention, it requires hard work, it requires stamina, and you have to be alert and responsive to the sentiments of the public and the patients who come to you. So let us now, just when I came in, I was listening to the lecture given by, I don't remember the gentleman's name, but he was talking about newer techniques in microbiology and whatever they available. So medicine is becoming more and more technicalized. It is dependent on technology. But please remember that clinical medicine still holds the ground. Spend more time in wards. Spend more time with the patients. Even if there is nobody to take your clinics, don't worry. Go into the wards. Take out the papers, read the papers. See, basically, postgraduate and undergraduate studies in professional courses is self-help program. Teachers are there to guide you. They are not there to teach you. You must understand this. There is no more spoon feeding. Spoon feeding was available till 12th standard. But after the 12th standard, once you enter professional courses, you are supposed to learn on your own. Spend more time in libraries, more time in wards, more time in theaters, and that is the way you will learn the things. Teachers might come and they teach you, but how much amount of reading you do, how much amount of patience you have got and stamina you got to acquire knowledge will decide your future. Jaisi Sangat Vaisi Rangat Vaisi Pangat. You decide with whom you are moving around. You must be focused. See, focus is the first important word that you must remember while pursuing your medical career. You must be focused on what you want to become. Then you must have your dream diary. Say, if I stand up, gentlemen, please stand up. Tell me your 5 dreams. No, he's puzzled now. Because I am the first person to ask him his dreams. His mother, father have never asked him, his teachers have never asked him, his friends have never asked him. Please sit down. So before you go to sleep today, make your own dream diary. You know why dreams are important? Human being is the only person on earth who can dream, who has the capability to dream. But dreams don't come into reality unless you write them down with your own handwriting. Putting your dream in a computer board is of no use, computer screen, because that's virtual, it doesn't exist. Make a diary, write it down, put a date on it. So the simple formula for success is dream plus date is equal to goal. Write down your dream, put a date on it, and then stay focused on it. Be persistent, be consistent. Failures are going to teach you some lessons. And out of failures, you're going to learn and you're going to get more experience and more better. So failures don't matter. Even if you fail in certain examination, if you don't want to go ahead, if you don't feel like going ahead, decide again, step back, take a step backwards and then decide and then focus. But do write down your dreams. What you want to become, where you want to practice, what type of vehicle you want to own, what type of girl or boy you want to marry. Yes, you can also write that also. You can choose your husband and wife just by writing your dream. Just write a dream, my husband or my wife. And the dream should be written in present tense. I am a cardiologist. I am an endocrinologist. It should be written into present tense and a date has to be put on it. I can tell you a simple example how it happens. Whenever there are arranged marriages that take place, the boy sees the girl sees the boy, the two families meet. But this alone doesn't progresses into marriage. The marriage function has to be printed on an invitation card. The date and time is printed and then the marriage takes place. When you buy a plot of land, hospital doesn't automatically get selected. The architect draws it on a board. Then you suggest him changes. Then you tell the engineer that this is the date by which it should be ready. Unless you give the date, it won't be completed. So date is also important and writing down on paper is also important. So remember these things. Dream plus date is a goal and that will get you to your success. Write down your dreams. Stay focused. This is the right time to choose where you want to go. What is your aptitude, where you would like to practice. It is not necessary that everybody should go to metro towns. There are tier 2 cities, tier 3 cities, and they are also developing. So you can focus on those areas where you want to go. And please remember, gentlemen, money is not the end point. You should not run after money. Money should run after you. Practice in the most ethical way, the best possible way, and in an honest way. Don't try to take any shortcuts. Every shortcut will cut you short. So please understand this. Now with these words, I would ask Amjad to take over and carry out and speak out his thoughts about all these things. Thank you, sir.
It's a wonderful talk by Dr. Kumtekar sir. So here are all my teachers, Dr. Agarwal madam, Dr. Prasad sir and Dr. Kumtekar sir. I am their student. I got a call to talk on the topic of discussion is why I want to become a doctor or what I should choose in life to be after taking medicine probably. That is the topic, right? So we all know our forefathers have mentioned in the books that there is no greater opportunity for a human being than to become a physician. So everybody must have read this few words. So it still holds true. Though we have come all the way from art of medicine to commerce of medicine nowadays, but still the old formula of having art of medicine and empathy holds true for your success. It is key to success. Though initially patients were patients, now they are customers. Because I have been through all government jobs, then private practice at present. So I want to share with you, and in fact I want to ask you, I believe these are all undergraduate, right? So yeah, still to choose our career. So first of all, I would like to ask one of you or two of you why you wanted to become a doctor. Then I'll tell you few of my stories in between. I don't want to tell the whole story, but relevant things. So any volunteer to tell why he wanted to become a doctor, how he chose this profession? Any volunteer? Anybody? There must be, I am very sure, there must be few of you, at least 50% of you must have chosen by choice. Because nowadays, it is not by choice sometime, even though for my case, it is not by choice. I've been pushed. Nobody? Yeah, good.
Well, it's basically about personal interest and an aptitude towards the field. And also, there is the satisfaction of treating a patient and watching them go back home cured. So, I think it's basically about the personal satisfaction that this field ultimately brings us.
Great. I think this should be the most of the us in our time we used to be very get this thing by of course I have to see around myself some general practitioners though would be think very great about them. People used to respect them. Any functions, any gatherings, a doctor is respected so much. And I've seen many doctors not attending their family functions but taking care of patients. And it was thought that it's something different. So that was the thing. But now things have changed. I don't know, but I'm not sure about the undergraduate, but postgraduate, before post graduation, most of the doctors they calculate where I'm going to settle, what is the deficiency there, how many specialists are there, which specialization will work well. What I would suggest you to not to go with these. Of course, there should be some rationally to take your super specialization or a specialization after your MBBS, but then your inner will, where you can excel, you know very well. But choosing any branch, like if to tell you my story. To begin with, I wanted to be an architect, but my father was a medical representative, and he wanted me to become a doctor. So ultimately, I was pushed into. Then of course, I developed the interest, and from the beginning, second year of my first day of my clinical posting, I came across with a cardiologist. Even though he was a retired AFMC cardiologist, and he used to teach me murmurs and all those things. So I was so much interested, I thought I'll become a cardiologist. But it was a long journey. After MBBS, then it was difficult to get into even MD medicine. I did 1 year MD anesthesia. Madam knows, she was my PG teacher in anesthesia. Then I got into medicine. Then I went for cardiology. So those days my thought was only murmur, some diagnosis, and I didn't know that I am going to do angioplasty in the future. I didn't know that point of time. So now it is not the case. You know, you are focused. So it took me for 3 years of super specialization, I worked 5 years more to get into that course. So it took 7 to 8 years to become a cardiologist. But then I wanted to become that only. That was this thing. So nowadays it is not like that, because the life is very fast. People want to finish the course, come into the practice, and settle early, all those things. But I remember one brigadier I met after my MBBS. I was trying to get into PG. So I went to AFMC and wrote an exam. I was getting MD pathology. I left it actually. but I happened to meet him. I asked him, he asked me, why you want to become a physician? So I said, I'm very much interested in medicine and I want to treat patients. What kind of a job you want to do? I want to treat patients. I want to be very happy if I could diagnose a thing and treat properly. Patient will be relieved. What we'll do, private practice or a government? So by that time, I think I have worked for 6 months in government hospital, and I actually am from a private medical college in government quota. I did from DY Patil. So I saw the difference in a private hospital and a government hospital very early in my life. So I thought government probably is not the thing because things are not advanced. I would go for a private practice. So he told me, uh, do you know what is the best way to serve as a doctor? I said, maybe private practice because they could do all the complex procedures and they can go to the top. Maybe government setup does a. But he told me, in what way you want to? You want to be a very good human being, a very good physician at heart, and be empathetic about your patient. Do you have do you want to earn huge money? I said, probably money is not an issue at all, but then definitely I would like to earn. So he said, I will tell you to do a job. Because he told me, if you do a job, it is a fixed salary. You are not biased. Okay, because at the end of the month, 1 month, whatever you do, you will get fixed amount of money. As against that, a private practitioner like me, the more I work, more I get, even money and fame, whatever it is. So sometime you are biased to get more money and fame, you might deviate from your original aim. So he told me that private practice better to have a job, either a government, AFMC, army, any job where you're fixed salaried, so then you can serve people properly. So this is probably time to really think, because nowadays things are totally different. I believe in next 10 years or 15 years, our health system will totally change because we are so many specialists coming into. When I started competing for a DM cardiology, that time the whole India has only 46 seats and DNB some 60 seats within 100 number. Now we have 600 cardiology seats in India. It is only matter of 10 years back. So similarly, even your MBBS seats. So I believe in 10 years or 15 years down the line, all doctors will be employed because the small setups are dying, corporates are coming in. It is not possible to give all services under one small hospital, under one roof. So you probably 10, 15, 20 years down the line, you all will land up in doing fat salary jobs and 8 to 10 hours daily job. That will be really ideal because we overexert ourselves doing 24 by 7 work. We call it as we are workaholic. We call it as that we are gods, dummy gods, because people say we are God and we spoil our life. What I would suggest you should be very focused. Somebody is really energetic and he wants to do it, he should plan a clinical subject. And somebody is really, you should identify your own interest and your own capacity and your own inclination and your family background as well to plan your super specialization or a specialization. Because in clinical branches like general medicine or cardiology or neurosurgery, some most of the surgeries, surgical and emergency branches drains a lot because you have to exert a lot. Of course, you in that this thing you get more money and more fame probably, but then you have to choose from the beginning. And this is the probable time you should think of what exactly, as sir told, what exactly you want to place yourself in the society. And wherever you want to, the most important thing is the basic aim should be benefiting your patients, your customers. If you give better service and you satisfy them, that is the only key to success. And other logistics probably can be arranged for you by anybody else or yourself. But then the most important is the how, because in India you must have heard, some doctor is very famous, lot of patients are with him because he talks very sweet. It is very unfortunate. Only talking sweet is not sufficient in a scientific this thing era now. But then you should have this art also. So you should be a multitasker to become a successful doctor. It's not the subject, it is not the gold medal, it is not the spot diagnosis, it is not the advanced technology, it is not nothing. One thing is not sufficient. It is all multifactorial. And I think, you should think of all these factors. Suppose you want to become a pathologist, you should think whether you are destined for a job or you have sufficient funds to get all the gadgets. Like I was saying, going through now so many like equipments, have a start your own business. That days have come that probably this is the time you to think also. From my time, I have never thought of anything till I finished my cardiology. I never knew that I'm going to come to Sholapur, because most of the time, in 17 years of my journey of my learning medicine, I was away from Sholapur. So I was not destined to come back. But then I landed here. And one more thing I want to tell you, whatever you plan, your plan always should be flexible. Should be. Your baseline should be definitely there, but you have to slightly change your plan according to the opportunities which come. But your basic characters, basic ideas, basic values should never change. Because once you think that you are going this way, that should not change. For example, for me, to get into cardiology, it took 5 years after my MD medicine. All those 5 years, I was earning only 15,000 rupees stipend, and I was very difficult for me to sustain my family and my kid and everybody. But still, 5 years I slogged to get into cardiology. Then I got it. Probably this time also this is possible, but then it depends how, like, your intention is to go for a particular thing. So my suggestion for all of you to choose any branch will be your inner voice and your some basic plan, because whatever you plan you will do that way, it is not necessary. Things will probably not fall into the line at that point of time. You should always have a plan A and B, and then you can proceed. Anything you if anybody has any queries, you can ask me, because this all I think we are talking about how to choose the career, why to choose the career. Why to choose also very important. And today, things have totally changed. The government setup and the private sector, or a trust, hospitals, these are the options you have. Initial days from the Britishers, when they left, we have only government institutions, and all higher studies used to be done in the government institutes, and whatever few equipments required for the treatment of patients were there only in that institutes. But slowly, two things happened. One, there were a lot of the jobs were saturated, and then we required a lot of new gadgets, which probably after independence our government was not able to provide. So the private sector came in, and now we trust more in a private sector, only because they are more equipped and their practice is slightly different. We have some restrictions in the government. Of course, if you want to become an academician, probably private practice is not the thing we should choose, because it takes a lot of time, and government job or any semi-government job, probably a medical college job, will more satisfy you as an academician. And these two things probably you should, from the beginning you should decide, because everything has pros and cons, and everything has its own importance. If I'll tell you, in our Cardiology Society of India, we go to conferences. We have all senior cardiologists and like all stalwarts in cardiology, all you can say leaders in cardiology. Out of 10, 3 to 4 will be some from a medical college HODs. They are still leaders. It doesn't mean that some cardiologist is earning some crores of rupees and having a big hospital, he becomes a very intelligent or a very academic person. So any field you choose, you can go to the top. And that should be the aim, rather than choosing a particular branch. And you can go to the top in any branch, may it be any subject or any subspecialty of medicine, you can excel. And you have to plan your career according to the availability also. That is also one factor. Any queries or any just? Acha, okay. I think I'll invite Dr. Yuvraj next.
Hello friends, I am Dr. Yuvraj Mane, doing general practice since last 22 years. Here I am to share some thoughts and experiences of general practice. This may help you in your future career. After completion of internship, what comes in mind what next? Shall I go proceed to PG NIT, or just I will start my general practice or practice in my area? See, there is another option that you can go to government hospital as a medical officer, but that is a different aspect. After completion of MBBS degree, why should I go for general practice? There are lots of reasons for that. First and foremost reason is your family background is ready to accept you for next 3 to 4 years for again studying for the PGs. And also, can your family bear your all the expenses when you are studying the PGs? Moreover, are you really sure that the things will go accordingly when you will study and get the PG degree? And then after, are you really interested in that subject or that degree which are you getting after your PGs? You should be confident on your MBBS degree after completing internship that you can go for general practice. And also, some students come from the remote area, villages. The need of their villages or their area and the interest of that people and looking towards you that you can do something for them after completing your MBBS. और सबसे बड़ी बात जो है कि सब भाग रहे हैं, दौड़ में भाग रहे हैं, हर कोई पहले नंबर पे पहुंचना चाहता है, लेकिन बैच में थोड़े लोग ऐसे भी रहते हैं कि जो एवरेज है. यानी मेरा एक्सपीरियंस में बोल सकता हूं कि जब हम फार्माकोलॉजी जब पढ़ते थे, जब हमारे सेकेंड ईयर के मार्क निकलते थे, तो हम वहीं देखते थे 3 इडियट्स जैसा 50% है, हाँ ओके, दैट इज गुड, दैट वी आर एमिंग दैट 50% आ गए ना. तो 10 लोग ही ऐसे रहते कि जिन्हें 70% चाहिए रहते हैं, लेकिन जो लोग रहते हैं 60% वाले, उन्हें डिसीजन लेना पड़ता है कि हम क्या करेंगे. तो उनको आज मैं रिप्रेजेंट कर रहा हूं. नाउ आफ्टर डिस्कसिंग ऑल दिस फैक्ट्स, you have to become a good doctor. What qualities should be there in a general practitioner, good general practitioner? The first and foremost, that the general practitioner must be having a good communication skill, because this is your language speaks a lot. आज तो मैं इंग्लिश में बात कर रहा हूँ आपसे, लेकिन हिंदी में भी बात कर रहा हूँ क्योंकि मैं एक जनरल प्रैक्टिशनर हूँ और मुझे हर कोई लैंग्वेज में बात करना पड़ता है. मेरे पास 100 लोग आते हैं दिन में और उनकी हर एक की लैंग्वेज अलग है, हर एक का टेम्पो अलग है और हर एक की बताने की एक्सप्लेन करने की जो पावर रहती है वो अलग रहती है. A good general practitioner should develop his communication skills very neatly, and you should be polite, you should be calm and not to be panic. देखिए, जो पेशेंट आ रहा है आपके पास, जो पेशेंट आपके ओपीडी में आ रहा है, ही इज हैविंग समथिंग ट्रबल, एंड आप ही उसको गुस्सा करेंगे, आप ही उस पर आपका गुस्सा निकालेंगे और आप उसको ऐसा दिखाएंगे कि मैं आपसे कुछ तो बढ़कर हूं, तो ये उसके लिए अच्छा नहीं है और आपके लिए भी अच्छा नहीं है. सो यू शुड बी काम, यू शुड बी अ गुड लिसनर. आप उसे सुनिए, आप उसकी मन की बात सुनिए, उसको वो क्या बताना चाहता है, उसकी कुछ बीमारी के कुछ सिम्टम्स है वो आप बता रहा है, वो आप अच्छी तरह से सुनेंगे तो आप उसको एक्सप्लेन अच्छा, उसको ट्रीट अच्छा कर सकेंगे. और एक बात जो है जनरल प्रैक्टिशनर की, you have to apply your knowledge very fast and with very short period of time, because the patient expects from you that he should get good treatment in a very short period of time. एज ए जनरल प्रैक्टिशनर आप जब बैठेंगे क्लिनिक में, तो जब एक पेशेंट जब आपके पास आएगा तो वो बोलेगा कि सर मुझे 2 दिन में अच्छा कर दो। अब जो आप सुन रहे हैं, जो देख रहे हैं, 2 दिन में रिपोर्ट्स भी आने में वक्त लगेगा। आप उसको 1 दिन में कैसे ट्रीटमेंट देंगे ये आपको सोचना भी पड़ेगा, उसको डायग्नोस करना पड़ेगा, उसको सेटिस्फाइड भी करना पड़ेगा, और यू हैव टू गिव हिम assurance that he will be good and he will be better, will feel better in 2 days. So you have to develop your knowledge also, and you have to treat him also. A good doctor should be a very good actor also, because lots of people coming to him with different type of moods and different types of languages. So a good doctor should be a very good actor also. अगर आप कन्नड़ बोल नहीं सकते, अगर आप सोलापुर में रह रहे हैं, आप एक्सपीरियंस करते होंगे शायद, अभी क्लिनिक में बैठते हैं वीएम सिविल हॉस्पिटल में, लॉट ऑफ पीपल टॉकिंग इन कन्नड़, हिंदी, अदर तेलुगु, आपको उनकी भाषा समझ में नहीं आती, लेकिन वो क्या कहना चाहते हैं ये आप समझ सकते हैं। तो आप you should be a good actor, that you should pretend that you are listening to him and you are getting what he is saying. That will give him a good satisfaction also. So a doctor should be a good actor also. And this is one more important point, that as this is a very noble profession, he or she must protect her character by maintaining social life, by in a proper dignified way, and social life will be secured by him, so that your patient can feel good when he is seeing you. He will see you outside in the OPDs or on the area in the your city. Now coming to the next point, how to choose the proper place for your consulting. Your consulting should be situated on the main road of your area or your city, or your where you are taking the decision to start your OPD. It should be placed on the main area or the sub road where it is attached to the main road. Okay, and the consulting room should having at least 3 rooms of appropriate sizes and with good ventilation. Okay, there may be a proper waiting room for the patient, there must be a proper consulting room for your own, and there should be a examination room where you can carry out the minor procedures also. Okay, you can attach a medical stores also with your OPD, and that can help your patient to give prompt and proper treatment. And this may help one of your family member to get a good job also. You can arrange a pathology lab near to your consulting or the in patient's waiting room area also. About the staff, you can take one receptionist, and with you can go with a assistant staff also, who can help in your daily routine, and who can maintain your daily records also. Friends, general practitioner is the first person whom the patient can explain his complaints, and general practitioner should also listen to the complaints and can guide him in his treatment, or give him a proper suggestions. Number of families are attached with the general practitioners. Thus, the general practitioner is the first helping hand to them. If there are number of good general practitioners in certain area, they can provide good health services, and ultimately the health standard will be maintained of that city. In last pandemic, there were lack of good general practitioners, due to which number of hospitalization of the patients increased. General practitioner is the basic need of the society. They are now not only the symptomatic relievers, but they are the first line warriors of the saving lives. Last but not the least, general practitioner can earn not only good source of income, but they can also win the heart of the patients and thousand families forever and ever. So friends, कीमती है जिंदगी, जिंदगी तुझको अपना सलाम, लाख दुखों की है दवा खुशी, और खुशी देना ही अपना काम. Thank you.
I think give a big clap for Kumtekar sir, Amjad sir, and Yuvraj sir. Because they have guided you in a different ways. Okay? And as a Harsh Agarwal told me that, Madam, you also guide in some other way also. Because now they have told you in what we have to choose career. Okay? The first I will ask the question, all of you. How many of you are having a stress before exam from second, third, that is fifth में थे, 10th में थे? How many of you? 11th, 12th, first year, second year, third year. Okay, clap for yourself because ये problem मुझे भी था. Give a big clap for you. See, for each and every exam I used to cry. घर में पूरा problem, कोई बात नहीं करना चाहिए. My family, that is a big family, sir, knows that. My elder brother is a surgeon, and my cousin brothers and all the 10-15 families, we are living together, and पूरे हमारे माहौल में किसी ने बात नहीं करना. क्यों? पुष्पा की एग्जाम है. And for each exam, after the exam, I used to come first. In 5th I was first, 7th I was first, 10th I was first. Maths I was gold medal. Everything that was happening, but each and every time there was a stress. 11th, 12th, same thing happened. First year MBBS, I was first in anatomy. I was second in the physiology, but there was stress. My whole life was going in a stress and stress and stress and stress. And imagine that at the time of MD, that is MBBS exam, there was an exam for medicine. And some I had told about that is cyanosis, that is bluish eyes. Examiner told, Madam, just up एक ही answer दो, I will give 100 out of 100. And I was knowing the answer, but because of the stress, I couldn't answer. So see, even Stanford University has told that to be a success, apart from your hard skill, soft skill is very, 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 very important. 30% hard skill is required, but 70% soft skill is required. And where sir had already told that communication is required, confidence is required, and clarity in the mind is required. So these are the three things they have told us, that confidence in your subject is required. There should be a clarity, and you have communicate with your patient. You should able to communicate with your seniors. You are able to communicate with your teachers. You should able to communicate with your colleagues and your junior, your patients. And apart from, if you are starting hospital, then you are class 1 to class 2 and class 3, and so many people are there. Our problem is that we are not developing all these soft skill. And because of that, there's a lot of stress factor is there. You see, the lot of energy is required into all those things. If energy is not there, I feel dull. I can't read. I can't produce. I can't treat patient also. As sir said that, Yuvraj said that, general practitioner. See, I'm anesthesiologist, but still I'm general practitioner. Why? Your family, they don't want anesthesiologist. They want general practitioner. Right, sir? I'm a general practitioner for my mother, my father, my brother, my neighbors. So this is your basic. You can't say that I'm cardiologist. I can't do this one. See, still I'm an anesthesiologist. My family members ask about some obstetric problems. They ask gynec problem. Sometimes they ask cardiac problem. Some about poison, everything. They ask everything and they expect everything. They expect that I should manage critical patient at home. They expect that once you enter in MBBS first degree, your family member says that my child is doctor. And they are expecting a lot of from you. Similarly, when you go in society, other people are also expecting from you too much. That may be beyond your capacity also. So that you have to tackle very nicely. How I become a doctor, that is a, you can say, tragedy also or accident also. I was very good in mathematics, 100 out of 100. I was getting engineer, but my family were, at that time there was no engineering college in Sholapur, sir. And my family was not ready to send me outside the Solapur. So option was medical. And in the family also, when after the exams, 12th exams, when I come at home, my father used to ask, how was the paper? Yeah, paper was good. I never said that I will get 100 out of 100, 95 out of 100, something like that. I do remember at that time also, in the physics, I got 95 out of 100. I need that 80 out of it in theory and practical 15 out of 20. And where these 5 marks were gone? That was because my stress factor only. Because in a line, the one person in front of me, second number was absent. And when they called me, I went there. And everything was confused. And that created a stress factor, vicious cycle. And that reflected everything. Even I was a very good in practical. I used to do a practical very good throughout my first, that is complete whole year. In a final exam, I lose my 5 marks. So same thing is going to happen. So you have to think. Sir said that there should be clarity in your mind. What you want. What is your goal? What is your final goal? What are your short time goals? Goals are going to be changed sometimes. Right? So you have to think on that. You have to decide. When I entered in MBBS, I never decided that I will go for the anesthesia. My brother was surgeon. Definitely, he would have been guide me. You go for the surgery. They were asking me at the time of applying for the PG. You apply for the OBG or you apply for the OBG. I was getting diploma in OBGY. But when I came here, I never showed my form to my brother, elder brother. I did MD anesthesia first and DGO second. And was first, that is, I got MD anesthesia. I was getting surgery also. 3 of my colleagues they got surgery also. So I chose anesthesia by my first choice. There is no question of the money. See, what you like, that is very important. If you go with the money, Reliance also has good money. There is no need to become a doctor. You can start any business. Even Vada Pav person also having a good buildings. Like Bhageshwari Vada and everything. So money is not the question. Here, when you come for the MBBS, you are for doing PG, study for the knowledge. That should be underlined. You study for the knowledge, you will definitely good marks, and when you will go to marks, even in a practice also, because you have a knowledge, your practice will be good. And if there is no stress factor, a good communication will be there. So you can manage your patient very nicely. When your results are good, with the results, 1-to-1, that is, other patients will come to you. So this is one how you become a success. But the story doesn't stop here. See, your knowledge is not for you. In a whatever intellect you have, that is not yours, that is given by the God. Everybody is not the same, but only that you have to nurture that one. To nurture that one, you have to give 100% when you are going for the study. Library में बैठे और कुछ दूसरा कर रहे हो, that is not good. And to study 100%, you have a good sleep also. You have proper food also. You have to keep your healthy body, healthy mind, healthy communication. Your relation with the society with very good, your colleagues. And then you can do very good in your career. You can choose your career. But when you choose a career, now a sir said that everything not is in your hand. That is depends upon the marks also. Only that you have to put your efforts. But in the later, if you wanted to become a surgeon and you don't get that one, and then you become an anesthesiologist, you become a obstetrician, you become a pediatrician. Now everything that is your choice that has been gone. So don't go in a past. Now whatever that is having in front of you, give 100% to that. Because that is your life. If you don't want it, that branch, as sir said that, so there should not be any grumbling later on. If throughout the life you are going to grumble, cannot enjoy the life. See, here we are, this life is to enjoy in a better way. With the grumbling, with the everything, you having a 3-4 buildings and everything, and grumbling is in the life will be there. So nobody will be happy. People around will not be happy. You are making others also, that is boring. So most important part in your life is that celebrate your life. To celebrate, give 100%. Decide what you want. Every that is sir said that diary, you have to keep a diary. If you want to change the goal, you can change the goal if you want. Short time goal, that is you have to make it. So final goal, that is big, that is good human being. With whatever you want to do 100%. We are here to give service to the society. See, Lata Mangeshkar is there and she sing very nicely. If she sing in bathroom only, what is the use of that? That is for us, no? We feel good. Similarly, whatever intellect we have to nurture that one, and we have to give a society. Just anesthesiologist. See, second part of my life is that I never wanted to become a doctor first. Second, I never wanted to don't wanted to go for the post-graduation also. Third, I don't wanted to go in government service also. I never wanted to become a HOD also, never wanted to become an administrator also. But sometimes, everything is written in your life. You have to put your efforts. You have to put your efforts. If you put efforts, what is good for you, you will get in your life. That is very important. Instead of crying, go with your choice, decide your goal, put your efforts, give 100%. And whatever that is, everyone knows in this world, that is what is good for you. And definitely you will get it. See, it's very important. If you give a good service to the society, society will help you. That is very important. So in my life, I have learned this one. That is, always put your hand, give your hand to the society, your colleagues, your friends. So you will get everything. I think I covered. Anybody wants to? Anybody? Harsha? Can you clap for us? So it's very important. See, if I am smiling, I feel that you also smile. Because I also feel good, right?
मैं हिंदी में बात करूंगा. देखिए, आप सब यूजी स्टूडेंट्स हैं. आपके घर में हमेशा कोई तो ट्रीटमेंट के लिए जाता होगा, बाहर ट्रीटमेंट लेके आता होगा. प्लीज गो थ्रू द प्रिस्क्रिप्शंस. देखिए, उसमें कुछ लिखा है, कुछ डॉक्टर ने प्रिस्क्राइब किया. गो थ्रू इट, स्टडी इट. यू आर अ स्टूडेंट, मेडिकल स्टूडेंट. जस्ट घर में एक चिट्ठी आई है, पढ़ी है कोने में, आप पढ़ने मुझे पढ़ाइए, मुझे पढ़ रही हूँ माँ. नहीं, आप मेडिकल स्टूडेंट्स हो, आप उसका स्टडी कीजिए. वो आपको फ्यूचर में डेफिनेटली हेल्प करेंगे, क्योंकि आप वही बनेंगे जो आप पढ़ रहे हो. आपको भी वही करना है आगे जाके. इसलिए बहुत इंटरेस्ट से काम कीजिए, आपका इंटरेस्ट बढ़ाइए इस फील्ड में. यू आर अ डॉक्टर, नॉट अ ऑर्डिनरी मैन. आप डॉक्टर हो, आप एक हेल्पिंग हैंड हो इस समाज का. तो खुद को बढ़ाओ, खुद की नॉलेज बढ़ाओ, खुद का इंटरेस्ट बढ़ाओ. और आपके जैसा हेल्प, आपकी जैसी हेल्प कोई भी नहीं कर सकता इस समाज की, जितनी आप हेल्प कर रहे हैं. आपने देखा पिछले कोविड में आपको भगवान बनाया था लोगों ने, और भगवान जैसा आपको ट्रीट किया था, क्योंकि आपके पास वो नॉलेज है, आपके पास वो डिग्री है. आप उसका यूज कीजिए, आप उसमें इंटरेस्ट बढ़ाइए. एक प्रिस्क्रिप्शन भी है तो उसमें आप स्टडी कीजिए कि क्यों दिया है, क्या है इसमें, कौन सी बीमारी में दिया है. तो आपका नॉलेज अपने आप बढ़ जाएगा. क्योंकि देखिए, हर एक इंसान, हर एक फैमिली मेंबर, आपके बाजू में रहने वाले लोग आपके पास एक डॉक्टर की नजरिए से देख रहे हैं. और आपका एक दायित्व बनता है समाज के लिए कि आप उनको अच्छा और सलाह की जरूरत है उन्हें, और अच्छी ट्रीटमेंट की जरूरत है. जब तक आप खुद उसके बारे में अच्छा नहीं सोचेंगे तो आपके जहन में से अच्छा नहीं निकलेगा. सो try to become a good doctor, not only a doctor, good doctor. Okay?
Thank you, sir. I would like to thank all panelists for their guidance. Now I would ask the permission of the panelists to open the question and answer session. Audience, all your questions, kindly raise your hand. The mic will be brought to you by a representative. Questions? We have a few questions. To start, I would like to ask Yuvraj Mane sir, as he just said, the doctors are made gods by the people, but sir, the same doctors are being bet up and killed, or even violence on the doctors. So sir, should private practitioners hire bodyguards or learn self-defense?
No, नहीं, कभी भी नहीं. बॉडीगार्ड्स की जरूरत नहीं है. आपके लिए अच्छे और तंदुरुस्त दिमाग की जरूरत है. आपके लिए, आप अगर अच्छा सोचोगे तो आपके लिए बॉडीगार्ड्स की जरूरत नहीं है. देखिए, आप एमबीबीएस स्टूडेंट्स हो आप सब, लेकिन आप जब प्रैक्टिस में आओगे तो आपके सामने बहुत से फेक डॉक्टर्स भी आएंगे, और बहुत से ऐसे सिचुएशंस भी आएंगे कि आपको भी सोचना पड़ेगा कि यार क्या ट्रीटमेंट दिया है इसने. तो जस्ट आपको खुद को बैलेंस रखना है, और आपको सिर्फ पेशेंट के बारे में सोचना है. और आप अगर अच्छा उसको ट्रीट करेंगे और उसके बारे में ही सोचेंगे तो आपको बाकी की जो ज़रूरतें हैं उनकी ज़रूरत नहीं पड़ेगी. आपको सिर्फ उनके बारे में ही सोचना है, उसके अच्छे हेल्थ के बारे में सोचना है. और बॉडीगार्ड्स वगैरह तो इट्स जस्ट शो ऑफ, मुझे लगता है.
Just to add to what Yuvraj said, basically the conflict arises on two problems. You are not communicating properly with the patient. Your communication has to be extremely good. Your language has to be restrained. You should not have high-handed approach towards your patient. You must be polite. You must listen to their problems. Usually the problem comes when there is a question of settling the bills. They feel that the bills are excessively charged. There is a problem. The patient has not received proper treatment. You must be able to explain them in a very calm and quiet way and very confident way. And usually, if this is handled in a very quiet and very sensible way, no question arises. But in due course of time, in corporate hospitals and particularly with high risk branches like what Amjad is doing in cardiology, in oncology, and all these areas, we may in future need bodyguards, because the society at large has become very impatient, very sensitive, and on small, simple occasions, the situation may go out of hands. So you better be prepared in future. For your generation, this may arise that you may need this type of requirement. As of today, your communication, your handling of the patients, and doing the things in the right way will not provoke this type of situation.
See, as Yuvraj and Sir was telling, a doctor should be a very good actor. That is the most important thing, the key point here, because we are coming across a lot of violence against doctors recently. Who is responsible is a different matter of debate now. But in short, what I feel is both sides are equally responsible for that. Doctors as well as the patients and the overall society. Things have totally changed. And rather than talking very ideal about it, we should be realistic as a doctors, because especially you people, because 10 years down the line, what situation you will face, we don't know. And the more you invest in your equipments, the more you invest to give care to the society, the better you can perform and better you can serve. That is definitely there. In that process, there are the elements in the society which don't like these things rather than doctor. They are very, for example, I have, for me, this is my 11th years of practice in Solapur. For last 10 years, I was a chairman and director of 3 hospitals. Now, ultimately, I started my own hospital 1.5 year back. So the moment I started my own hospital, I became a devil for everybody. Till that time, I was a Masiha because they used to follow me. But the moment I started my own hospital, probably they don't like it. Till that time, I was serving them. Whenever you are at receiving end, wherever you are underdog, people like you. When you try to lead, people don't like you. So simple as the where you required an assistant, a bouncer or a security person, different situations. Like he's a general practitioner, he's an onco surgeon, I'm a cardiologist. So situations are different. But I'll tell you, as sir told, doing a high risk procedure and a costly procedure, definitely you require a security backup. You may not show in terms of a bouncer or somebody standing with gun, but then you should have some plans and rescue plans for in future. Definitely it is required. So you should be. Probably this may not happen when your tongue is very sweet and your intentions are very clear and obvious and you are really caring about them. And in terms of finances, you are very clear. And in spite of you being very clear and telling them everything, we do video counseling, we get a consent, written consent. In spite of all that, patients will tell, no, you have not told that. So that is a different thing. You cannot help it. And such situation will definitely arise more and more in future. So people should really think, hospital at least are thinking to have a parallel security setups. And that is probably required.
Thank you, sir. Coming to Sirish Kumtekar, sir, as you just said, the finances are an issue. So, commercialization of medical field, how ethical it is? Should we charge? How much should we charge? And how to determine the fees upcoming? Because we have seen certain doctors who are charging 400, 500, and certain doctors who are charging 100 or 200. So, sir, is this just the difference in the skill, or how we determine what are our skill set?
See, usually your charges, nobody will complain about charges taken by an advocate for taking a simple जामीन. तुम्हारा माहिती रहा, आपको शायद मालूम होगा कि जब कोर्ट में किसी को पेश किया जाता है, उसको अगर रिमांड लेना है, जुडिशियल रिमांड है, उसको जामीन मिलाना है, तो एडवोकेट्स लोग 50,000 से लेके 2-2, 5-5 लाख तक फी लेते. वहाँ पे कोई तकरार नहीं करता. मगर हमने अगर ऑपरेशन की 15,000 से 20,000 फी की तो लोग तकरार करते. तो how much fees you should charge usually depends upon the city and area you are practicing. See, I am practicing in Solapur and suddenly I start charging 1,000 rupees as consulting fee because I am a senior onco surgeon. Will not be suitable, will not be acceptable by the society. It should be a level playing field. A super specialist should charge in Solapur about 500 rupees. A consultant, specialist, houser, senior I might become, I still charge 300 rupees. Well, Yuvraj Mane might be charging 100 rupees as the initial fee. And that is justified. Because he also must charge. On many occasions what happens, general practitioner never charges at all. He will just charge for the drugs given or the injections given. That used to be the situation. But with people like Yuvraj, like MBBS, general practitioners coming in, we should start this practice of charging for our knowledge. Basic consultation fees must be charged. And one of the second points that I have noted in my practice is that I never take money or fees in my hand. All my patients pay the money to the receptionist. I never accept the money and put it in a drawer or something like that. No. The bills are paid outside because handling money is not my job. Handling the patient is my job. Money will be handled by somebody else, as Yuvraj rightly said. You must have a receptionist. You must have your own case paper printed. You must have your own properly designed prescription pads. You must use a unique type of pen and a unique type of ink. Use a different ink. Use a yellow ink. Use a green ink. Use a blue, not blue always. You should have your own unique signature. You know, your prescription pad is the biggest advertisement that goes out to the world. So your prescription paper has to be of good quality. Your handwriting has to be readable. Don't ever give computerized prescriptions. In my opinion, they don't work. Those drugs don't work. You must write down your own prescription. Be very sincere about writing down your notes and time. When the patient comes, please enter the date and the time when the patient has visited. Because they are going to be important documentary evidences if at all some medical legal question arises. So never be afraid or never be lethargic about writing with your own hands. Be ready for that. Be ready for doing a lot of clerical work. And as he was asking me, the fees are decided in the city you live, about the type of investment that you have done, the type of hospital that you are providing, the type of care that you are providing. In a multi-speciality, multi-bedded, super specialty hospital, the initial fee might be 1,000 rupees. When you go to Dinanath Mangeshkar Hospital, the consultant fees is 2,000 rupees. Nobody will ask any question. But that is the situation out there. If you create that show, people will pay. You come to Balaji Sarovar, you pay for lunch 800 to 1,000 rupees. Whereas dal chawal on Vijapur Road is available for 20 rupees.
Yes.
So it depends upon what type of practice you are doing.
Yes.
I think we should not be very emotional about we are charging because it is like it's your doing a private practice. It's your like there is no other thing you do in life. So you have to be while to keep the amount what you charge should be, as sir said, it should be depending on the community where we are practicing. You cannot charge out of the way to anybody, but you should not undercharge, and charges should be fixed. See, you understand, wherever you must be going for shopping, fixed rate. You believe more. It's a fixed rate. So it must be genuine. So your charges should be fixed rather than changing. That is very important because that gives a very clear message that you have baseline. Of course, those charges can be waived off for many people who are poor or in situation like your relatives, your colleagues. So whatever ethics comes in about the money, you can definitely change it. But your charges should be very fixed, and you should not be ashamed of that you are charging, you're taking money, because that is your profession, and you are working for that. So that we should be a pride to say that my fees is more than somebody else because I am very senior and I have been slogged those days and I see differently. Because as sir said, advocate will charge so much and everybody charges differently. So it is a personal skill that is sold. And legally also, in medicine recently government has tried to crash the whole private system by so-called capping everything. But one thing they couldn't do it, that is a professional skill. They couldn't cap the fees of a doctor. Fees in terms of a OPD fees, or it may be a procedural fees like a operation or procedure, that cannot be capped. The moment that will be capped, probably we will sue the government and government will have to listen to us.
I think the most important part is the mentality of the people. That is there. They can go in a beauty parlor, they can go in a Balaji Sarovar, they can pay everything. But when come for the appendectomy, the doctor should do 50% charges. Beauty parlor, even they can say, I can pay more than this, but do very nicely again. You are ready to pay more. Right?
Yes.
You can go for what are the shoes? 1,000 or 2,000, 5,000. Who is going to look at your shoes? But health is more important than that. That is very important. You have to tell your patients. Health is very important.
I think the problem is because, see, whatever you get free of cost, you are afraid to pay for that. दोस्तों, इस दुनिया में सिर्फ 6 चीज़ें मुफ्त में मिलती है. मैं इसका स्टडी के इसलिए मैं बोल रहा हूँ. जो सांस ले रहे हैं वो हवा मुफ्त में है. बाहर जो धूप है वो मुफ्त में है, आपके माँ बाप आपको मुफ्त में मिले, उन्होंने तुम्हारी बॉडी तुमको मुफ्त में दी। अपने देश में हम जैसे मर्दों को बीवी मुफ्त में मिलती है, और हमारा देश राय बहादुरों का देश है। कोई भी के किसके हुए की सलाह देता है, राय बहादुरों का देश है ना, राय बहादुर। तो जो चीज मुफ्त में मिलती है उसकी हमें कीमत नहीं रहती। अब इसलिए लोगों को दुख होता है कि जब आते हैं उनको जब स्टिचेस लेना है, सर्जरी करना है, इंजेक्शन लेना है, तो उसके कैसे पैसे, मुफ्त में मिला है ना, तो उसकी कीमत दे उसको। तो मैं उसका एक हमेशा एक एग्जाम्पल करके दिखाता हूँ कि हर्ष, आप हर्ष हो ना?
यस सर।
हर्ष जैसा कौन बनेगा करोड़पति खेल चलता है,
यस सर।
वैसा हम 2 मिनट खेलेंगे यहाँ पे।
यस सर।
मैं आपको 1 करोड़ का चेक देता हूँ,
ओके।
आपसे छोटा सा काम करना है, आपका एक आंख निकाल के मुझे दे दो।
नो सर।
चलो हम 5 करोड़ कर देते,
नो
5
सर।
करोड़ का चेक देता हूँ, एक आंख निकाल के दे दो।
नो सर।
देखो अभी हर्ष के एक आंख की कीमत 1 से 5 करोड़ में नहीं हो रही है, तो पूरे हर्ष की कीमत क्या होगी, समझिए आप। तो ये लोगों को समझता नहीं, और इसलिए लोगों को बड़ा दुख होता है जब खुद के इलाज करने को लिए पैसे डालने का टाइम आ जाता है, तो उन्हें बड़ा दुख हो जाता है।
यस सर।
दैट्स व्हाट शी वाज ट्राइंग टू कन्वे।
वी टेक आवर बॉडीज फॉर ग्रांटेड।
और एक बात, आप जब आपके क्लिनिक में बैठे हो तो प्लीज रिलेटिव्स, ज्यादा रिलेटिव्स को अलाउड मत कीजिए अंदर आने की। क्योंकि एक रिलेटिव ठीक है, 2 या 3 रिलेटिव्स आ जाते हैं, उसमें से बहुत ज्यादा दिमाग वाला रहता है, होशियार, बहुत बहुत ज्यादा सर। वो मोबाइल निकाल के देखता है क्या बात कर रहे हैं आप, और वो खुद क्या डायग्नोसिस बना देता है। और हम पेशेंट्स को जस्ट एग्जाम कर रहे हैं, सर इसको अटैक तो नहीं आया। अरे भाई चेक करने दे, अभी पूरा होने दो। तो ये जो प्रॉब्लम्स हैं, ये प्रॉब्लम्स आप खुद ही टैकल कर सकते हैं। आप अगर अच्छा इंस्टीट्यूशन बना रहे हैं, आप अच्छे स्टाफ मेंटेन कर रहे हैं, तो देखिए डॉक्टर हमेशा एक सॉफ्ट टारगेट रहा है समाज के लिए। जो भी फटे हुए नोट है, कलर लगाई हुई चीजें है, नोट है, सब डॉक्टर के लिए बने, ऐसे मुझे लगता है। निकाल कर लाते हैं देने के लिए। तो यू शुड बी वाइज इनफ, यू शुड टेल योर रिसेप्शनिस्ट डोंट टेक दैट नोट्स। क्योंकि ये जो मानसिकता है डॉक्टर के बारे में, क्या यार इसको क्या कम है, इसके पास तो बहुत है। बेटे हमने 6 साल गुजारे हैं, हमने यहाँ, हम सोते नहीं है महीना है ना, मंथ हम सोते नहीं है। तू आज एक मोबाइल निकाल कर मेरे एजुकेशन के बारे में मुझे सवाल नहीं कर सकता। मैंने मेरी जिंदगी गंवाई है, मेरी जिंदगी के 7 साल दिए है इस फील्ड के लिए, तब मैं यहाँ आके बैठा हूँ। तो यू शुड रिस्पेक्ट योर सेल्फ ऑल्सो, ओके।
Anyone from the audience? Yes, my colleague Saad.
Good evening, everyone. So, the theme of the conference was like promoting research mentality in medical students. So, sir, I wanted to ask, what is the scope of research in private clinical practice?
I think there is a lot of scope of research even in private practice, because of course government institutions, you have a structured program for research and government funding and something, but private practice, especially the pharma companies nowadays, they have their own R&D departments, and they have a lot of funds for research. And as a patient pool, if you see the private setups have large number of patients and more systematic records and more systematic way to approach research. So a lot of research is being done in the private sector nowadays rather than a government setup. So as a practitioner, you want to be in research, so you have to be associated with such a hospital or a center where the research is going on. As a totally solely private or single practitioner, probably it may not be feasible. But then if you are attached to institutions wherein there is a team of doctors who are working, having a teaching activities, whatever the diplomas or degrees or DNBs or CPS those kind of a thing. Such hospitals will have a cell, research cell, and there will be definitely some pharma-D, one or two pharma-D people who are sitting there, and they organize all this research. So there is definitely a scope in the research even after totally private practice. Of course, if you are in a government setup, you have more opportunities, a more systematic way to go about it. But then they have their own restrictions. I hope.
So I fully agree with Dr. Amjad. In private setup, you can comfortably do research of whatever way you decide to be. But the thing is that you must be very perfect goal oriented about it. Documentation has to be perfect. Keeping the data, having the photographs, having the record taken. We are normally lazy in our practice about keeping the data properly. It is the only thing what research matters is about maintaining data and analyzing it. So that's where we lack. We do not maintain our data properly and we do not put enough time to analyze it and don't set goals about it. So if you can do that, you can do small research even in private practice. You can select one goal and work on it. Like what Dr. Bhaviskar did about scorpion bite. He decided and he went ahead and he devised an absolutely wonderful method to resuscitate those patients.
So in a private practice, suppose a lot of cases, they are coming interesting cases. So if you are not having a time as being a doctor, you can keep a data operator or someone with you. You can pay for them and you can keep a data. Only what you have to do that is you have to compile and you have to publish that one. But more important thing is that ethical approval is also required when you are producing the data also. So that is, I think we tried in last year, that is our doctor society, that is the Indian Medical Association, can with the joint venture with the institute where the research is going on, with such ethical committee, they can ethical approval if they can take. So it's becomes very easy for the private practitioners also. So such a doctor's team can take a lead and they can do it. Or sometimes like in a PhD also, when people go with the PhD, at the time of the PhD research, they appoint few people from the different, from advocate and social worker and all those things, and they get approved their PhD dissertation and they can appear. The same thing we can do here also. But here's a team, this such a committee, we can go with that and we can submit that one. Even if government sector or some institute is ready to go with the joint venture, that will be very useful for the society.
Thank you, ma'am. Yes, please.
Okay. Good evening, everyone. Ma'am, my question is to you. Ma'am, you said ki you were not interested that much to enter in medicine. Mine is also same case. So, ma'am, how you just develop interest in it?
See, I was not interested. The thing is that accept the situation as there. If we are not going to accept, then leave this one, go for the other things. That is when, this is the time. Nowadays, bond is there, so you cannot leave this MBBS and PG. My time, there was choice. But when I enter, I accepted, I gave 100%. This is your nature. So same thing I told, that give 100% whatever you are doing. And I was getting a success in my life. I never grumble for this. But whatever I do 100%. That is the thing. I was not interested. In biology, I got less mark than the mathematics. I was not having a single tuition in 10th, 11th, 12th, 9th, nothing. Only thing is that I won't say that I was very clever. Like a sir, I was not. But my efforts, भगवान ने बुद्धि दी है लेकिन बुद्धि को कुछ करेंगे नहीं, नर्चर नहीं करेंगे, it is useless. So I got MBBS. In that, I gave my 100%. Whatever I do, now also whatever I do, don't say, some people say that Agrawal madam like administration. I don't like administration. But when work come to me, I do 100%. That is there. Being an anesthesiologist now, I choose anesthesia. I'm doing 100% if I love anesthesia. And more important thing is that, like in MBBS, you don't like. Suppose you anatomy don't like, or physiology don't like. So what we do in exam also, if anatomy don't like, we go with only physiology and biochemistry. I keep anatomy on the back side. Now start doing the opposite. Whenever anatomy book comes up, say, I love anatomy, and start reading that one. One day you will have interest in that. That is there.
You don't like something, what do you do? What do you do?
Sir, just study.
You quit?
No, sir.
Suppose you are not able to quit. Suppose now I'm sitting here. Even if I don't like, I have to sit here.
We hope that's not the case, sir.
So you have to. But I sincerely advise you, maybe you don't like to become a doctor, but since you entered, so what I would suggest you, as madam told, whatever you do, try to justify and try to do the best. So till MBBS, you finish your MBBS. You will be graduate. Fine. Then the whole world is open. You can become IAS officer, you can become politician, you can become whatever you want. But you have to finish MBBS because you have entered. If you leave it, you will be covered. If you leave this, you cannot follow anything in life. So whatever you take, you finish. That is the message I want to give all of you.
Yes. Thank you, sir.
Hello.
Again, important thing is that if you are having an MBBS degree and if you are going to become an IAS officer or something else, that is a boon for you.
देख भाई, तेरी सिचुएशन अरेंज मैरिज जैसी है. अब एक तो तू उससे एडजस्ट कर ले, नहीं तो उससे अपने जैसा बना ले. यही तेरे पास है. तू अगर MBBS को आया है तो सर ने जैसा कहा तुझे कंप्लीट करना पड़ेगा. और बहुत नोबल फील्ड है यार. तू काम कर, सिर्फ तू देख. तो क्लिनिक्स अटेंड कर, ज़्यादा से ज़्यादा क्लिनिक्स अटेंड कर, क्लिनिक में जा. थियोरेटिकल इट्स ओके यार, मैं बोला ना पहले 50 ओके ठीक है. 85 है ना अभी, क्या बढ़ गया है? 85 है नहीं, 35 था यार. 50 को गया आफ्टर 12th. तो 50 ठीक है, उतना ही जा. लेकिन जब तू क्लिनिकल काम ज़्यादा करेगा ना, तेरा इंटरेस्ट अपने आप बढ़ जाएगा. क्योंकि वो बहुत नोबल प्रोफेशन है यार. तू तेरा 100% दे उसमें आज तेरे माँ बाप तेरे पास एक डॉक्टर की हैसियत से देख रही है, तो तेरा भी कुछ दायित्व बनता है. तू बन जा, तू कुछ तो कर. और उसमें इंटरेस्ट बढ़ाने के लिए कुछ ऐसा ज़्यादा नहीं करना पड़ता. जस्ट यू हैव टू बी सिंसियर एंड नॉलेज बढ़ा, अपना वक्त दे फील्ड के लिए, तो अपने आप तुझे अच्छा लगने लगेगा.
See, most important thing is that be a grateful first, but you got a human life. Second, be grateful that you have an intellect, God given. Being grateful for your family that they put in MBBS, and grateful that you getting a chance to serve the society, the poor people suffering. If you are grateful, then you can manage anything.
Thank you, ma'am. Anyone else? The mic, please.
As ma'am and sir said, life of a doctor is very stressful and hectic. So, what suggestion would you give to improve our social lives? Or is it a sacrifice we have to make?
See, doctor's life is not a stressful. When the stress is there, you should know the definition of the stress. The most important thing is that when you wanted to do the things and you're having a less energy and less time, then that creates the stress. If you're having a adequate time and energy, then there won't be no stress. Don't say life is just stressful. How you are taking your life. See, I'm also doctor, I'm working, I don't have any stress. Even emergency also, I don't take stress. I said, whenever emergency comes, people will call me and I will go further. Why should it's in morning 8 o'clock? Today I'm on emergency on call. Today I'm on emergency call. Today I'm emergency call. 24 I'm going to do that one, and there may not be any emergency. Right? Do you understand?
टेंशन लेने का नहीं देने का. So stressful life. See, if we discuss that doctors are under a lot of stress. Just imagine any IT person or anybody in life now. Everybody is so busy. 5 years back, 10 years back, probably it was true for doctors, but now it is true for everybody. Everybody is doing multitasking. Some teacher is doing 6 to 10 job after his school, and he tries to earn more. Everybody is busy. Everybody is under stress. So tension लेने का नहीं, tension देने का बस. That is the only formula.
And there are two types of stresses: eustress and distress. Okay. Now you convert your distress into eustress so that you get motivated. And डॉक्टर होना अलग बात है और डॉक्टरी करना अलग बात है. समझ गए ना आप? तो कॉलेज में डॉक्टर होना सिखाते हैं. डॉक्टर ये तुम बाद में जब बाहर पढ़ोगे तब सीख जाओगे. अब एज सुन एज यू बिकम ए डॉक्टर, बिकम ए सोशल डॉक्टर. सिर्फ बिजनेस के लिए और पैसा कमाने के लिए डॉक्टरी मत करो. टेक इट एज ए चैलेंज, बी ए सोशल डॉक्टर, mix with the society, work for the society, and you will enjoy the fruits. You will become famous, you will be honored, you will be respected everywhere, and then you will feel special as a doctor.
Thank you, sir. Next, please.
Good evening, everyone. So my question was that in future we will be seeing a lot of our patients dying in front of us, but at the same time we have to give assurance to their families that everything will be all right. So how are we supposed to do that?
See, normally say when people with grade 3, grade 4 cancers come to us or terminal cases come to Amjad, see, we explain the real situation to them. Never try to give guarantees. Okay? Life is not about guarantee. Life is about doing honest work to save that life. You must show to them and assure them that you are trying to do everything that is possible honestly, to the best extent possible. Okay? But you can never assure anybody anything. I can give you a guarantee for this pen, but there is no guarantee that I will reach from here to my house in next few hours. There is no guarantee. So never talk about guarantees. Talk about assurances in an honest way and giving honest services.
Sometimes you probably have to be slightly diplomatic when you talk to the relatives. In front of what relatives, what to talk, that also comes by experience. Suppose, as sir said, somebody is in terminal stage, of course is dying. You have to be first good actor to say that probably we are going to save him, we will try. But then some of those relatives should clearly know that patient is going to die. At least somebody, to keep yourself clear. But you have to be diplomatic enough to talk in front of so many relatives at one time that is going to die, nothing can happen. So that way, it is because unfortunately we are dealing with humans, we are not dealing with machines. So we have to understand the emotions of the person sitting in front of you and try to modify your words rather than intention. You understand? So this will you learn only, as you said, once you become doctor, you do doctory rather than only becoming doctor. Once you start practicing, you will learn this. Okay.
What I do that is very important. My experience I am telling that when we manage a patient in ICUs, like in trauma ICU, surgical, so critical patients, sometimes we know that this patient is 99% is going to die, but we take a chance that to resuscitate everything. We have to explain everything. Patients relative comes, पण बरा होईल ना पेशंट म्हणजे तो क्रिटिकल आहे पेशंट आपण सांगू शकत नाही नाही डॉक्टर पण वाचेल ना ते रिपीटेडली दे आर सेम थिंग्स देन व्हॉट आय डू बघा मला जेवढं करायचं मला जेवढं तर ते पूर्ण 100% जाऊन तुमच्या पेशंटला हे करणार ते करणार सगळं करणार पण 1% देवाच्या हातात आहे माझ्या हातात 100% नाही मी आत्ता तुमच्याशी बोलते आहेत बाहेर गेल्यानंतर मला पण माहिती नाही माझे दिवस किती आहेत आय एक्सप्लेन दॅट पण डायरेक्टली आपण सर्वांना बोलू शकत नाही तुमचा पेशंट मरणारच आहे तर मला काय विचारू नका. वी कॅन डू दॅट वन. सिरियस आहे, वाचण्याची शक्यता कमी वाटते, पण आपण सगळं करूया, सगळं देऊया, प्रयत्न करूया. 1% द्यावं ते सोडून टाकू. दॅट इज यू आर सपोज टू कम्युनिकेट प्रॉपर.
Yes. Thank you. Okay. Due to constraint of time, we would ask the further questions to be. During the snack time, can we do that? Okay. So, thank you everyone, and thank you panelists for joining us today.
I request all the panelists to please be seated. So please be seated. Thank you, sir. As Dr. Kumtekar sir said, every shortcut will cut you short. That's something that rings true for every field and not just for our medical field. Dr. Amjad sir mentioned that a medical professional needs to be multitasker and keep his plan flexible and adaptable to the circumstances, yet the core principles should remain a constant. Dr. Yuvraj sir shed light on the ever troubling question for medicos like us if we should prepare for PG NEET or set up a private medical practice. Then he went on to enumerate the qualities that are to be expected in a general practitioner: to be a good listener, to apply his knowledge reflexly, and to be a good actor along with a good doctor. Dr. Pushpa Agrawal ma'am taught us how not to be let down by our stress or let stress you down and your expectations when your expectations do not meet up your reality. Thank you, sirs. Thank you, ma'am, for your experiences and guidance. Will definitely help us plan better and make wise choices. I now request Dr. Tirankar ma'am to please come up on the dais to felicitate our esteemed panelists. I request Dr. Tirankar ma'am to felicitate Dr. Pushpa Agrawal ma'am.
Madam and myself were together with the same batch. I am very glad today.
I request Dr. Tirankar ma'am to please felicitate Dr. Kumtekar sir. I request Dr. Tirankar ma'am to please felicitate Dr. Amjad sir. I request Dr. Tirankar ma'am to please facilitate Dr. Mani sir. As it is rightly said, research is to see what everybody else has seen and to think what nobody else has thought. I now conclude today's session. Snacks have been arranged. I request everyone to enjoy your snacks before you leave the venue. Thank you everyone. Looking forward to see you all again tomorrow. Everyone, please be seated. Yes, ma'am. Tomorrow's session will begin at 8 o'clock. That's it. Everyone is requested to please be present on time. And um, you have to show your food QRs again, and please go one by one. Don't overcrowd there. Thank you. Thank you.